Good morning. Thank you, everybody, for being here, coming from all different parts of the state, and ready for an exciting conversation this morning. Remy, will you please call the roll, and then we'll do who's here in the room, and we'll see who's on the phone.
Yes. Angie Blackwell.
Okay. Thank you, Angie.
Katie Brooks. Present. Peter Buckley.
Here.
Peter Buckley. Ann Kubich.
Here.
George Mendoza.
Here.
Peg Miller. Here. Khalid Thorne Ladd. Excused. Eva Ripito.
She's just running late, but she will be here.
Chair Sue Miller.
Here.
Early Learning System Director Mariam Calderon.
Present.
OHCS Director Margaret Salazar.
I'm here.
An enormous on the wall behind us.
You're very present.
Oregon Health Authority Director Pat Allen.
Here.
And Deputy Director, Department of Human Services, Liesl Wendt.
Lisa.
Liesl, excuse me.
And Lisa will be here in about 15 minutes. Okay.
And then also Colt Gill. Colt Gill, replaced by Candace Pellet.
Right. And Candace, are you on the phone?
I'm on the phone.
Okay, thank you, Candace. Appreciate you joining us. So we have some people running a little late and some people ill and others calling in, but appreciate those of us who were able to get here. So what we wanted to do to start off the meeting today, well, let me have Carrie introduce herself, sorry.
Carrie McCann from the Build Initiative.
Right. Carrie's going to just be helping facilitate different parts of the meeting today. Thank you, Carrie, for being here. So we want to start off today by doing just sort of a go around the table and talk about what is going on in your areas, whether that's a geographic area, an area of work and expertise, and what you do professionally, and just obviously as it relates to Raise Up Oregon and building this early childhood system that we are all committed to, and why we are all sitting here around the table. So how about if I just start this way and ask Peg if you would begin.
Well, I actually just got back from a big child abuse meeting in San Diego. It's an international child abuse meeting, and it's tough duty to have to go to San Diego in January, but I persevered.
Someone's got to do it.
That's right. And this wasn't just kind of assessing kids with child abuse. This was really talked about prevention and how to be more trauma informed and care for kids that have experienced trauma. One of the greatest talks I went to was called Attachment Vitamins, and a guy got really fired up about it's a mental health program to try and encourage attachment between mothers who have experienced complex trauma and their infants, and it doesn't have to be administered by a mental health provider. It can be taught in a 2-day session to home visitors or preschool teachers, and it seems to me that that's, and again, I don't know what the cost of this training is, but it would seem to me that that's a really good way to get attachment and prevention out there for kids. So I got excited about that. I also really got excited about a program to support moms and babies that have substance abuse problems and babies that experience neonatal abstinence syndrome. And Delaware, which is great because they only have 6 hospitals in the whole state, is running this and really successfully and keeping kids in homes and helping moms deal with their substance abuse, but keeping those kids safe in the meantime. So that's kind of what I've been up to in the medical child abuse arena.
Wow, very exciting.
Yeah.
And what's the name of the Delaware program?
You know, I don't know that it has a name,
Okay.
and they're still collecting some data on that, but it really looks like a strong program, and they've already shown really good improvements. And it's not anything that costs a lot of money. It's identifying those moms early, and in fact, I think that we could do it earlier than they do it, because they do it on hospital admission when moms are in labor. I think we could do it prenatally. And I think, again, what they said is start small, so I think maybe a pilot to get that in a couple of counties that don't have a lot of hospitals, because I think it can be hospital and obstetrical provider driven,
Exciting.
and then pediatric supported.
Pat will see to it tomorrow. Right?
Well, it isn't expensive, you just do the drug test.
Yeah, they say Delaware has 4 counties at low tide and 2 at high tide.
Oh, dear. All right, yeah.
So a few things on our front. In the child welfare arena, we've been working closely with Department of Human Services on an element of the continuum of care for kids that is particularly problematic right now around psychiatric residential treatment services. It's taken us actually quite a while, but we're now at a place where we and DHS agree on exactly what the need is. We're in the midst of fulfilling our original commitment to create 25 new beds, and basically we've identified we need 47 beds more than the 25 that we're currently creating. Those numbers don't sound like a lot until you realize that we thought we were going to get 25 done in 2019. We scaled that back to 15, and we actually delivered 7. It is very, very difficult to find providers and appropriate facilities to be able to do this now. The fact that it's going to take us a while is sort of good news, bad news. The bad news is it's going to take us a while. The good news is this should be a dynamic number that as we make other investments like intensive in-home services and those kinds of things, that should actually drive down that need. And so I don't know that we'll ever get to the place where we have 72 more beds of capacity, because we should be able to avoid that need. But that's kind of the mission that we've got lined up right now. A couple of other things. CCO 2.0 is now fully in swing. Those contracts are in place, and we're doing that work. All 15 coordinated care organizations have 5-year contracts. That was a little bit of a thing we were dealing with late in the year. As we've talked before, there are significant intersections between Raise Up Oregon and CCO 2.0 around kids' investments, and so we're working on those. 2 projects to call out. Universally offered home visiting is now in its early adopter phase. We've identified 8 counties, 8 areas. So it's Clatsop County Public Health, the Early Learning Hub at Lynn, Benton, Lincoln counties, Early Learning Hub in Central Oregon, the Eastern Oregon Early Learning Hub, which is Baker and Mount Airy counties, 4 Rivers Early Learning and Parenting Hub. I believe that's the expanded Gorge region, Marion and Polk counties, and then Washington County. So those early adopters are working on program and data design and all those kinds of things to be able to begin to roll out training and work on that. We're also jointly doing rulemaking with Department of Consumer and Business Services, because this also, thanks to Senator Steiner Hayward, involves a commercial insurance mandate, and so we're trying to line up the rules and practices across those 2 areas so that we've got something that looks more like a fidelity model that can be adopted on the commercial insurance side, alongside the publicly delivered Medicaid piece of the model. Then the last thing to talk about is a really exciting grant that we received a few months ago. We presented on what we've come to think of as children with health complexity. We talk about kids with medical complexity, and then we talk about kids with social complexity. Well, this is the intersection of the 2. Very high needs kids who need a huge degree of care coordination to be able to successfully navigate multiple systems. Centers for Medicare and Medicaid Innovation put out what they've called the INC grant. It's Integrated Care for Kids, and it's basically it's that model of intensive care coordination. We applied to do a project in 5 counties: Jefferson, Deschutes, Crook, Marion, and Polk counties, and received a 7-year, $16 million grant to implement that. And so now we're in the spin-up stages on that effort. But that's a huge investment in sort of the core infrastructure that's necessary to take the level of care coordination that we currently do through CCOs and really target that and intensify it for those kids with health complexity.
And those kids would be 0 to 18?
That's a great question. I don't think I have an age target in the overview materials I've got here, but I think that's right. I think it's kids that are eligible for children's Medicaid.
Wow, nothing going on at OHA.
No.
That's good. Good to know. What's the timing on the home visiting? Is that a year or 2 out?
I don't think it's that far. Junction City Hospital, you don't need to hear about that. The pre-initiation phase goes through June 30th, and so we'll start early delivery of services beginning the fiscal year.
Oh, that's exciting. It's faster than I thought.
Yeah. Well, I mean, in Lynn, Benton, Lincoln, we're basically piggybacking on the model that's already in place there, so we're able to kind of expand out from existing services.
Great. Right. Thanks. Any questions of Pat, or?
Good stuff.
This can be, yeah, good stuff is right. Very interactive. Peter?
Well, not much is going on in Southern Oregon either. So off of what Paige was talking about, we do a program now called the Oasis Project, which is being done by Asante and Addiction Recovery Center, where it's skin on skin as the baby goes through withdrawal, and the mother does too. And they're now trying to develop a program so they can stay with the moms for 5 years and help the first 5 years of support, which would be outstanding when you get that done. And one of the joys of the recent months has been doing the ACEs trainings for the volunteers, because the babies have to be held 24/7. So these group of about 26 senior citizen volunteers who come and hold babies, and they do shifts to hold babies. They're great people. So our collaboration, Southern Success, is it's all levels of education, early learning hub, the K-12 districts, the 11 K-12 districts that we have, Rural Community College, Southern University, healthcare folks, All Care, Jackson Care Connect, Southern Pediatrics, mental health providers, human service providers, public safety and workforce development. So everybody at the table to focus on helping kids and families. And this collaboration has decided that our draft goal is that by 2027, all families in Jackson and Josephine County will have the knowledge, skills, and support needed so that 100% of our kids enter kindergarten ready to learn. And that's getting people to really focus in different ways. The Early Learning Hub is taking lead on, of course, the families with young children currently. The rest of the collaboration is really taking lead on the next generation of parents. We're really trying to brainstorm how we approach the next generation of parents. We're really focusing on self-regulation as a key issue. We're seeing all across the board. We're working with the school districts, obviously, on how they're going to implement the Student Success Act funds, including the dollars that are coming into early childhood education. Medford School District has already announced they're going to open up 4 preschools in their district in this coming year, working with Kid Time, which is one of our top preschool operations in the Rogue Valley. And on a kind of interesting side note, we had our Southern Oregon legislators convene to try to have a bipartisan approach as much as possible to the short session that's coming up, and also to the 2021 session. And the one area that they all agreed on was to support Kid Time's request for state funds for the remodeling of the building that they're in. So that's a very positive thing. So we're currently doing a series of interviews with 40 people around the region on that goal for kindergarten readiness, and really focusing on the social and emotional part of kindergarten readiness. And we're getting feedback from people, parents, teenagers, preschool teachers, kindergarten teachers, and that's been a fascinating process. As I was mentioning to Katie, one of the biggest themes that's coming across, not a surprise, is the financial stress that so many families are under. And that is seen as such a huge factor in the inability to actually help teach their kids learn how to self-regulate, because parents are having trouble self-regulating stress they're under too. So,
Right.
a lot going on, and just one other thing to show off, our early learning hub is like getting these out like everywhere. They're laminated little versions of Raise Up. As Katie said, you can eat lunch on it while you read it over.
I thought I recognized that.
We work with the hub too, just one last thing. It was a great process, and we'll probably talk about it a little today, of going through the data of actually where the need is for daycare and preschool, and it's scary. I don't know if, again, I think Katie's going through it in Bend too. Rogue River has 2 slots for infant toddler care, 2 slots. Some of our communities have, Cave Junction and Eagle Point. It's so, the need is so vast, it's mind-blowing. So I'm glad we went through the process as hard as it was to go through the process.
Peter, was that the sector planning
Yes.
process?
Yeah.
Great.
Yeah.
Yeah.
I mean, not the part about the lack of supply, we hear that all over, but
Yeah.
that the community was able to come together
Absolutely.
around that and look at
They
that
did
data.
a parent survey and got over 400 responses to the parent survey. That really helped inform how this was all coming together.
Yeah. I think that's something we've heard consistently, we'll talk about later across the board, is that hubs were able to engage thousands of parents, I think, across the
Yeah.
state in this process.
Awesome. Peter, is the stress, is that income related? So is it a poverty issue?
Yes,
or-
well, we have a very high poverty rate in Southern Oregon, higher than the state average, and the housing prices continue to rise, so that the strain on that is trying to keep up with the housing prices. And I visited Southern Oregon Pediatrics recently, and they actually have now a licensed clinical social worker in their office, because they have so many families with so many needs, that they're basically taking families from the pediatrician's room to the social worker's room to try to meet services.
Right.
That's a great model, and it's a really proven model that's been done in lots of different parts of the country.
Yeah.
That co-location.
Yeah,
So-
yeah, and to have a social worker to address the social determinants of health at the same spot.
Right. Yeah, that seems to be sort of the spot where you can
Yeah.
pretty reliably figure parents are going to show up, at least in those early years.
Yeah.
So, awesome. Thank you, Peter.
You bet.
Katie, what's happening over in Central Oregon in your world?
Well, a lot, actually. I think the last time we met, I was sharing with you all that we were fundraising to hire a child care accelerator position. We successfully raised the money and hired somebody, and she has been working for us for almost, I'd say 2 months or so. And we have made some progress. Some pretty exciting things are happening. The steering committee, which includes the hubs and the Governor's Regional Solutions and me and Better Together and some other organizations, sat down in a retreat about a month ago and set some goals. Our goal is 1,000 slots by the end of 2022, and we think it's doable. And so far, and a lot of those, as you guys know, are the 0 through 3 age bracket. Is really the sweet spot, but the area that we're concentrating on is the economics of the thing.
Yeah.
And so there's 3 blobs that we're kind of attacking at the same time. One of the blobs is how do we lower the operational costs of operating child care, and who can we partner with to do that, including employers who say, hey, I'm going to write you a check if you guarantee me X amount of slots, and this is just to help offset overhead, maybe pay your people more, maybe help you with that. Shared operational models we're starting to explore. Stoney and other folks who really showed us a couple of models that are really fantastic. And the other thing is just finding a physical place for these things to go. When I was here, the median home price in Bend is $480,000. It's ridiculous, and we have less than 3% occupancy in commercial properties. So partnering with people who have the heart and the wherewithal to actually just say, no, we're going to do childcare. I'm not going to put in another yoga studio or software company or whatever the heck it happens to be.
Dispensary.
Yeah. And you're welcome, Salem, for Tokyo Starfish. And anyway, and the other piece is so if we can't find a physical building, is finding land. So we're partnering with manufactured home builders to come up with a model that suits code for childcare facilities, and looking at that and finding land and doing a lease situation. We've partnered with nonprofits in the area who have expansion plans to co-locate and get donors to fund it. The regional hospital just made the decision that they're going to start exploring seriously providing childcare for the folks who work in the healthcare industry, and we're helping them pick up with a few folks there. And I sit on the regional intergovernmental agency called COIC, Central Oregon Intergovernmental Council. We still have leftover money from the Obama era for economic development on a low-interest revolving loan fund. And one of the economic blocks for child care providers has always been the tenant improvements. It costs a lot to put a bazillion little toilets in a room and to have all the things that you need to have. So this is a loan program that's 1.6% interest.
Wow.
So we're going to take this to our board, and I sit on the board, to help redirect a good chunk of that money. It's about $600-ish thousand toward the child care industry, so they can have access to cheap money to make those tenants improvement, which not only makes the economics work, but also takes the burden off the landlord, because that is the biggest barrier, are the tenant improvements and the liability. So there are a lot of prongs of partnership, finding the right land and finding access to money. We've also partnered with a few of the churches in the area because they always have extra space. Some of them actually have physical space suitable for childcare, and making some connections with well-qualified providers and the space. And one is probably going to open sometime within the next month or two. And then the last thing is changing policies. And the City of Bend has put forward a very aggressive policy change to lower the costs of permitting, expedite the permits, and they're also thinking about assessing some sort of fee. We already assess a fee in Bend for affordable housing, and doing something else for child care facilities potentially. Redmond is doing some similar things. So just trying to get people on board with thinking about municipalities, how can you make it easier? And then the Governor's Regional Solutions representative put a whole booklet together working with all the departments in the state that touch when you open a child care facility, when you authorize providers, to put it all in one place so that when you're trying to open a facility, you have access to that information that's really easy. So pushing many buttons at the same time and seeing what happens. So pretty exciting.
Wow. Those are certainly lots of public and private partnership
Yes.
examples that you're throwing out. Katie.
Yep, and that's what it takes.
Yeah. Eva.
I was just curious about childcare providers that you're partnering with, because obviously I know a few in the area. That's not the area where I know a lot of them, but I can help connect you with some in-home providers that
Great.
you would probably love to be involved in.
Absolutely.
You know, because they're, especially if they're certified in-home, they can have the 24/7 license, and that would help with the healthcare field too, to get people, you know, overnight.
So our
weekend
hub
care.
is on our steering committee, and this revolving loan program, oftentimes the money to do the tenant improvements in-home care
Yeah.
is also a big deal. So
Oh, absolutely.
these funds would be available to that as well.
Great, thank you so much. That's
Yeah.
awesome.
All right, Eva, why don't you just keep talking?
I have nothing like this to report. I feel like I'm the slacker of the group. My area of focus has been other areas, but not early learning. I think, you know, I've alluded to other connections before to public defense, but that's been my main focus lately is public defense. There's money that needs to be released to support to expand the parent-child representation program, which is for families entering into a parent who's been convicted of a crime gets a case manager and a public defender that's got a caseload cap, and there is a reduced time in foster care, higher rate of reunification, and lower rate of recidivism. And I think that, you know, we're working toward a model like that for all of public defense because, you know, there are many parents that enter into the criminal defense system. So how do we relieve pressure on that? So that's been my main focus lately. So not as focused on childcare or early learning.
It's
Also
okay,
involved
I'll
in
bet there are little kids.
yeah. Yes, there are little kids
Yeah.
involved, and that's what I tell people, that it's great that it's great that we've increased funding and expansion for parent-child representation program, but we have to also think about the rest of the adults in these kids' lives and get stability and get people the services they need so that we can, you know, reduce the amount of time that they're apart, reduce the amount of stress from, you know, trauma of separation and everything. And then also involved in the conversations in Multnomah County around their efforts to do preschool for all or universal preschool, depending on who you're talking to.
Right.
So that's exciting as well.
Okay, great.
Thanks.
Thank you. Thanks. George? LeGrand.
Yeah, I'd say in Eastern Oregon, I don't have deep discussions with all the early learning providers or the hub, just because I'm focused on a lot of day-to-day things in the school district. But when I do have discussions, whether it's with other administrators or even in state level discussions, the focus has been mainly on the preschool grants that we have, Preschool Promise, and what do school districts want to do and how do they want to be able to apply for those funds? Is it easier for school districts to say we're going to apply for those funds and then try to ramp up our programs or enhance the systems that districts already have in place, or is it easier or better to just give your facilities and space and try to get Head Starts or other preschools to have access to your facilities and space, and what makes the most sense? And then I'd say a lot of administrators or districts they're more focused on applying for money or more focused on understanding what the process or the system will be like, versus even deeply understanding what is Raise Up Oregon and what is the focus of Raise Up Oregon. So one of the things I did is I did a presentation to a large group of superintendents to just start to explain to them what is Raise Up Oregon and what are some of the focus areas for the early learning division. So I wound up basically getting into focused on early learning division is focused on developing standards for preschool programs and continuous improvement systems, professional learning and job embedded coaching, creating community master plans, K-3 alignment, getting a data system or implementing better data systems, coordinated enrollment. So I gave a lot of those kinds of things, and a lot of superintendents, they're starting to understand that there's a early learning machine, and then there's a school district machine, and that when they start only thinking about their school district machine, it's not necessarily their best use of time. They need to also start understanding the early learning system and that machine and start collaborating, discussing, working with. So those are outcomes that are taking place, I think. But definitely, I think from the K-12 side, folks are really wanting to have more collaboration. They want to understand what early learning division is doing or what the early learning system is asking for in terms of high quality and different kinds of programs and initiatives. But they also want to influence. I think the fundamental truth of K-12 is their viewpoint is they want, or I'll just say we want more kids to have opportunities to have early learning experience prior to kindergarten. Just the reality is when you ask a student to do something for 7 hours and they're not behaviorally ready, or they're not socially ready, or they're not academically ready, or any kind of ready, it creates a lot of work for kindergarten teachers and first grade teachers, and it traumatizes a lot of other students. And so I think early learning is now really hearing that part too, that folks are really wanting to see more for expansion and enrollment and support services for that. But I think what also is happening is that K-12 is also saying, okay, we need to also support the ramp up, the support of the early learning system, and we need to be good listeners and good partners. So, but I think we have to keep doing that.
Yep.
over time.
Yes.
And so those are big kind of epiphanies for everyone that's taking place. But what I'm hearing a lot is just conversations about facilities and space, and how do we know which kids are getting served or not getting served, and how do we help our Head Start providers or preschool providers to access us if they need us, and how do we do family engagement even better together is other conversations that folks are having. I would even say from the Blue Mountain Early Learning Hub, nothing like that poster has been created. So to me, the more we get a poster like that in every location,
Yeah.
but specifically in if folks want schools to understand what's going on, we need more signage, we need more branding, we need more information that's simple and easy for people to follow. We also probably need the hubs to do more presentations at times to school districts, or school districts to go to presentations at times for hubs. I'll just stop.
Okay. Those are great examples that I'm sure Carrie is going to pick up on when we start talking about the roles of council members, because you've just laid out a whole raft of communication and connections, and I think that's a role we can play ourselves, and obviously also staff. But thank you. Great overview, George. And welcome, Lisa.
Thank you. Apologies.
No, appreciate you being here. Thanks. So Ann, so I'll just talk about a couple of things. So I live in Roseburg in Douglas County, and I have had some interactions with my local ESD and the local Early Learning Hub about how this is rolling out. And I expect that there will be opportunity for me to convey that feedback, because there's some opinions about it. And then I would just want to talk about a couple of things that we as a foundation, the Ford Family Foundation, have been working on. We did some experimental grant making around facilities improvement, small scale facilities improvement for childcare. We worked in partnership with Western Oregon University around that. Small scale grants, meaning anywhere from a couple of $1,000 to $5,000 grants for particularly home providers. That's been interesting. We learned a lot of lessons from that, I think, that are worth sharing. On childcare and trying to increase childcare slots in Douglas County, one of the things we're working on is with NeighborWorks UMCO, which is a local community development corporation, providing IDAs, individual development accounts, for child care providers, and perhaps even also for users of child care, and trying to think about some innovative ways to deal with both the financing problem from both the supplier side and from the user side. But I'm so fascinated by the fact that you have a child care accelerator. That, to me, just sounds like I need to talk to you about what that really means and how to use that to ramp it up. The other thing that we have that's pretty exciting in Douglas and Coos County is a growing home visiting system. We have a strong home visiting systems coordination work. There's some leaders doing great home visiting work at particularly the Bay Area Hospital in Coos Bay with their MOMS program, and they have their expanding child care slots. So in Douglas and Coos, there's some interesting efforts in place to try and really create the infrastructure for home visiting and child care provision. And then at the state level, I had the privilege of being on a panel at the Oregon Business Council at the summit in December, where I tried to talk about rural issues specifically, and was able to slip in a reference to the Early Learning Council. Also at the state level, I have the privilege of serving this year as the chair of Chalkboard, the Foundations for a Better Oregon. We're thinking about the role that that group is going to play in helping to implement the SSA generally, and issues of workforce and data are both really primary for the thinking of the work of Foundations for a Better Oregon going forward. And speaking of data, there's a lot of work that several of us are doing to try and understand what's happening with the Oregon Child Integrated Database and how to make that come together in a way that's useful for our state, and that's something that we are also attending to. So with that, I will pass on.
And
Wow.
how about the preschool that you're starting with the ESD, with the fully focused on self-regulation for little kids?
Well, we have been paying for classrooms.
Right.
Yeah, we have provided grants to the ESD to pay for classrooms and for training around, it's called Ready, Set, Learn. We have several classrooms now and it's growing.
Great.
And also we are underwriting the cost for some infant mental health certification for, I think there's 12 people who are currently in the program to be certified in Douglas County. So there's a lot going on behavioral health and and infant mental health that we're sort of seeding now in Douglas County that's actually very exciting, so thank you for raising that. Working in partnership with the ESD, but also with others. Yeah, that is sort of a common theme that I certainly have been hearing a lot. Yeah. Lisa, welcome.
Hi, thank you.
Anything happening in your agency?
No. Slow day for us.
As usual.
February's going to be slow, just
Right.
like it will be for Pat. Well, did you want me, I'm sorry to come in a bit late to the agenda. Do you want me to talk about kind of our priorities for the department, or?
We're just sort of sharing at this point kind of what's happening. I mean,
Okay.
are there just some kind of key pieces, or Pat was talking about some of the grants they've been getting and.
Sure. Well, I mean, I think the most significant piece for us, and I think it would be probably useful at the next meeting to have our new child welfare director come, Rebecca Jones-Gaston, who's been with the agency now for about 2.5, 3 months, and she comes from Maryland, where she was, and before that, Casey, and had spent time in Maryland really implementing Family First, which is the new federal legislation regarding child welfare. So I think for us, it's a bit of a fresh start to look at what Family First really means for Oregon. Which is also in parallel to the feds kind of saying, oh, whoa, we didn't quite clarify everything when we passed this bill, which is, a pretty unique situation. And one of the things that Rebecca's talked really clearly about, she has a really nice visual of kind of concentric circles, and she said, we tend to talk about the child welfare program, and we mean child welfare system, but we're not actually talking about kids and family system when we're talking about child welfare. We're talking about the division within the Department of Human Services. And if we're really going to help kids be safe and with their communities and families, we have to really start talking in sincerity about the system and what all of those different layers mean. And I think that's a perfect conversation to bring here, especially as it relates to younger children. And this plan and OHCS's plan and some of the work at OHA are all kind of targeting that direction. I think the challenge for this next year is how do we help find some focus and alignment so that we can tackle some of the many challenges that we have for some of the most vulnerable kids and families in the state. So I think she's getting settled and learning Oregon. We suggested don't travel to Southern Oregon and the coast yet until the weather's a little nicer, but she'll be out and about connecting with communities. But I'd really like to bring her here because I think that's probably the most significant opportunity for our agency to engage with this council going forward.
Great.
And then the other piece I would add, there's a very significant rollout happening in April around integrated eligibility, which is an exciting one universal application for assistance between the health plan, SNAP, TANF, and many other important benefits. So that begins its rollout in Jackson and Josephine counties in April, and then begins kind of a wave rollout through the rest of 2020. So I bring that up because it is affecting 1.5, 1.7 million Oregonians, about 4,600 of our staff, so that's about half of our staff. Quite a significant business change and quite a significant technology change that I just think is important for folks to understand, because as you're seeking to partner with some of our local leadership, they may be not the right time over the next 6 to 9 months, just given how much is on their plate. It's a huge and important change. So I think we don't talk about it probably enough about what's coming, and that's a big change for consumers as well, which ultimately should be incredibly helpful. But I'm going to assure folks it'll be bumpy and we'll need partner support to kind of give us some grace to work through that.
And Peter, you get to be in the focus of that
Yeah.
for the first phase.
And
Congratulations.
there is stress with the local DHS.
They're a little eyes twittering a little bit, yeah. No, it's a modernization that's time has come, but I just think we'll need some grace to get through that.
Okay. An excellent idea about getting Rebecca to come. That would be wonderful. She spoke at the Children's Cabinet a week or two ago whenever we were there, and is just excellent. So thank you. Great idea.
Great.
Madam System Director.
Yes, hello. I appreciate the reference to the eye twitch. That's happened a couple times. That's, I think that's a thing here. So we have an update on our agenda around the Student Success Act, so I'm not going to sort of take time here to talk about that. So first, I'll talk about exciting new grant that the division was notified right before, right at the end of the year that we applied for, which was a preschool development renewal grant. So we were previously awarded a one-year grant. This next renewal cycle was more competitive, and so we were kind of fingers crossed, hoping that we would be selected. So Oregon is one of 20 states to receive this grant. It is a 3-year grant. We applied initially for $10 million, close to $10 million, which was what the maximum we were eligible for. All of the states that were awarded are taking about a reduction from their original application request, and that was so we are working with the Administration for Children and Families at the Department of Health and Human Services and exactly what that will look like, but we're estimating still probably about $9.6 million, $9.5 million a year for 3 years. And we wrote this, I think we have a one-pager on our website, and the full grant application is posted as well, so if you're ever looking for very light reading, it's federal grant, 75 pages. It might be interesting
You were
to
the
read.
top scorer in the country.
Yeah.
Yeah, Oregon was the top scoring.
Wow, really?
Mhm.
Thank you. So and the reason I say encourage some reading, or at least of the executive summary beyond the one-pager, is because we really wrote it aligned to the vision of Raise Up Oregon and the Student Success Act, and really thought about how to bring additional resources into the state to be able to support the work and the vision. So I just want to give you a few highlights about that, but I think we will be coming back and hopefully talking more about many of these initiatives and activities as the work gets underway. There's one area that's talking about sort of parent choice and knowledge. It's giving us resources to engage with families, to understand really what information they're seeking when they're thinking about early care and education and what is quality. And I think that that's a really critical step that we need to take in our state as we enhance all of the various websites and tools and resources that are available to families. As well, to think about, based on that information and what we learn about what they consider to be quality and what they're looking for, which we know through the early childhood, the work that the hubs have done around the sector plans, that is just such rich information that they've been gathering about what kind of care meets their needs and what is responsive to their families and their cultures and their contexts, is to then think about a system of ways of communicating that. So I don't want to get too down a rabbit hole, but we've been talking about, we've been using ratings right now, a 5 or a 3, and those are trying to take big concepts about quality and ideas that really, things that matter to families and they're looking for, and sort of put them under kind of a star system. And so with this work, we think we might be able to get even a little bit more micro in the kinds of ways that families will know that they can recognize quality, and quality can be recognized based on what they value. So that's one area. It's super exciting. There's a whole other area of the grant that's really talking about our professional learning system and how to enhance the supports to our family, for our providers and educators across the state. And I will say this really complements a little more of what we're going to hear about later through the Student Success Act update around our professional learning plan and some of the resources that were included in the early learning account, specifically to support early childhood educators and providers in our state. So I think about these as some of the, there's some aspects of more dollars for the infrastructure that will support some of the changes that are needed, continuing to build more capacity of our R&R system to deliver high-quality professional learning, and expanding the availability and the diversity, think of what's offered. And then something that I think would be a particular interest to the council is thinking about a participation with K-12 to do training and more support around our early learning guidelines, which have a huge emphasis, as some of you may know, around children's social emotional development, including extending through the kindergarten year. So I think that's a rich opportunity to bring K-12 professionals and early childhood professionals together around training around our early learning guidelines. Also with some support and revisions to those, because we would like to add infant and toddler guidelines to that. So to our guidelines as they currently exist. There's also opportunities for expansion of services in the grant, modest expansion and enhancement of services. So we have resources there to expand the pilot of Baby Promise and really focusing in tribal communities, as well as rural and frontier. Also two exciting cross-sector opportunities. One is to work around mental health consultation and increase capacity across our states. So Pat, that will be something we're looking to partner with OHA. Margaret, we also set aside resources to be able to partner with housing around some of the co-location work that I know you're going to talk about in a moment. That would be for slots for infants and toddlers and funding kind of some of the operating costs around that grant. And last but not least, there's also in this area more work to build capacity around the state to help providers get licensed and go through the licensing process. So something that's been touched on already. And then there's a whole big area around program evaluation and data, including inventorying the data that's collected at the sort of state and regional level and helping us understand what's the capacity and infrastructure we need to build here at the state level to be able to bring more early learning data into the statewide longitudinal data system. So not resources to build this out, but to begin to inventory what we have, what gaps are, and do some planning around that. So that is the preschool development grant. As you can see, it's pretty far-reaching, but and expansive, and a lot of work. But it's the work that we've all committed to doing across these 5 years to be able to move our system forward. I want to say something quickly about just the legislative session, which starts on Monday. Something because it's all been touched on. This is a pretty quiet, I would say low-key session for the Early Learning Division, but there is a bill that we are really interested in that introduced by Senator Gelser, SB 1518, and it would it seeks to resolve some of the challenges that providers are facing with the out-of-state background check processes, and so this would remove some of the statutory barriers so that providers could be conditionally enrolled while we're waiting for some of the out-of-state background check processes to culminate.
I'm sorry, Miriam, was that House Bill 1518?
1518, yes. And then my final comment is I'm excited to introduce that the division has hired a new Director of Equity Strategy. Her name is Melinda Avila, and she's right there. She brings a tremendous set of experiences working in the K-12 system as well as the health system in communities at Woodburn School District and Legacy and Silverton Health. So she also has is a very involved community member in Woodburn and a number of associations. I think chair of the Commerce. Yes.
I am the president
of the Chamber of Commerce. So also, I had to say that because Katie was here. Thank you, Melinda. I can't remember exactly what that was. So we're so excited to have Melinda, and given her very diverse background in a number of the systems and working communities, I know that she will be also a great resource in engaging with all of us at the council in Raise Up Oregon. So that's it.
Introducing Troy.
Yes, absolutely.
Hi, Troy.
Thank you. Sorry, Troy. Troy Duker has also joined the ELD recently. This is 1 month? Yes. 1 month, great. So we are very lucky to have Troy. He's formerly the Chief of Staff for Senator Lou Frederick. As some of you may remember, Senator Frederick played a very key role in the Student Success Act, especially around the early learning investments. So we got to know Troy, and I just had one, slightly uncomfortable meeting with Senator Frederick after. Just kidding. He was very gracious and supportive. But we are really lucky to have Troy join the division, and now will be leading sort of our legislative work. So.
Of course you said na-na-na-na-boo-boo.
Yes.
Awesome.
Thank you. There's a lot also new staff in the division, so I
Right.
will, yeah, we'll find other ways to give you updates about that.
Okay,
Yeah.
I just knew we'd be seeing
Yeah, thank
Troy
you.
over at the Capitol.
Yes, that's true.
Okay, let's jump to the phone then. Margaret Salazar, anything happening in your world?
Yes. So nothing's happening with housing. Still hear me okay?
Yes.
Yes.
It's,
Can you hear me? Okay, great.
it's a little,
So what's going on in our world, a lot of updates I wanted to give you. Is Chelsea Bunch in the room with you all today?
I don't see her yet.
Okay, so I think she'll be doing. The first
Margaret,
thing I wanted to.
let me ask, can you adjust your mic somehow? There's almost a muffled,
Yeah, I'm sorry. Let's see, does that help? Does that help at all?
No.
your cohort says
Send me
no.
the island number that I can.
Can she call
Send me the
in?
dial number. I think there was a phone dial option.
Yeah, this is, she would have to call into the Zoom, which is all set up. Otherwise, we'd have to hang up the telecom.
Okay.
Yeah. so-
Why don't you go ahead, Margaret, and
We'll just deal with it.
we'll see how this works.
Okay, I think there was a dial in on the calendar invitation, so I can also try that.
Okay. Let's,
No.
Yeah, if she calls into the Zoom meeting through like a telephone, it might be different.
Yes,
Okay.
you should try the dial-in.
Yeah.
okay. Okay, thank you. While you're dialing in, let me jump over to Angie. Angie, welcome. Thanks for being on the call. I think if you're feeding.
Yeah, I'm wondering if you're going to have the same difficulty hearing me.
Oh,
Can you hear me?
Yeah,
yes.
sounds okay.
It's better.
Can you hear me okay, or do you want me to also call in?
Probably having you call in also would be good. I'm not sure why we're not doing too well.
Okay, I'm going to do that.
Okay,
then.
thanks. Margaret, let's go back to you if you are in.
She, give her another second. She hasn't popped up yet.
Okay. Let's see, is it working for Candace? Candace, are you on?
Can you hear me?
Yeah, it's just constant. It's consistent.
Hello?
Yeah, it's the same. There's just
Distorted.
like this muffled.
Can you hear me?
Yes. Is this Margaret?
Wow, that's a number.
Well, she has to turn off her other mic.
Yeah, you need to turn off the other one, Margaret.
Here, I
Yeah.
Yeah, it's off. Can you guys hear me?
Yeah.
Sure, let's go for this.
Can you hear me?
Really bad.
Yeah,
Are we there?
Yeah.
Give it a try.
yeah, let's try it.
Thumbs up? Can you hear me?
Sure. Yeah, go ahead, Margaret. We will
All
hear.
right. Technology. I'm not clear. Can you hear me or not?
Yes.
Yes.
We're fine. We're good.
Okay. We're going to go for it. So thank you for the patience there. Tomorrow's a big day. Tomorrow we have an exciting convening. I heard a number of you talk about the facilities issue, about the need for childcare infrastructure and facilities. So tomorrow I want to acknowledge Chelsea Bunch because she has been spearheading putting together a convening called Build Early, which is a day-long convening to get together folks from the early learning world as well as the housing world to talk about the opportunity for co-locating childcare facilities and early learning facilities and affordable housing. We have a lot of examples out there that we're going to be learning from. There's been a pilot program in Seattle that we're eager to learn about. and just experiences of practitioners. So I think a number of you have already registered for the event or will be speaking. I think we'll learn a lot. This is one of the priorities in the Raise Up Oregon plan, to look at these models and figure out what the barriers are and whether we need to look at any policy changes or resources from the state that can help us further that work. So we're excited about that. It's happening tomorrow, and we'll continue the conversation after that. The other thing I wanted to mention, and I may mention it before, there is a landmark housing package coming out of the 2019 session, including not only new resources for homeless services to prevent and address homelessness, including families and children, but also new development dollars. So I'll talk about a couple of things. In February, we will be putting out a notice of funding availability, including $75 million for the LIFT program, which is a development program to fund the construction of affordable housing. And there is a particular emphasis on families with children. And we made some policy changes this past summer and fall, really in conjunction with our work with all of you, to prioritize large bedroom sizes. They're hard to finance. It's hard to finance 2 and 3 bedroom units. There's a reason why we haven't done those. But we've made some program changes with this to really incentivize folks to bring in developments with larger bedroom sizes. So we're excited about that. Those dollars are hitting the street. So those of you that are working in communities across the state, I would definitely ask you to encourage your development partners to come in with applications for this to help us spend that $75 million. We've never had anything at that scale before. And then the final thing I wanted to mention, there's a priority in Raise Up Oregon around both maximizing, enhancing, as well as prioritizing the homeless assistance dollars that we administer for families with young children. And as I've talked to council members in the past, that's a very political issue for us. It's a kind of a, obviously we have a homelessness crisis that affects multiple categories of individuals and families across the state, and everyone's got a number of strategies in play. But we are excited that we have some opportunities this year to really do some exciting work with families with children that are either at risk of homelessness or experiencing homelessness. We have a new program that was funded by a TANF pilot reform bill in the 2019 session. With the partnership with our friends at VHS, we built a team around reaching families that are eligible for TANF or receiving TANF that are either experiencing homelessness or at risk of experiencing homelessness, to provide short-term rental assistance as well as linking some to DHS resources to have more wraparound services. And we're piloting this in several areas of the state. So the Portland metro area, the Tri-County area will be one of the pilots. Southern Oregon, as well as far eastern Oregon, so Mount Hood County. And our council will be reviewing the framework for that program next Friday, and we hope to get their blessing so that we can roll the program out later this spring in conjunction with DHS. So that's really will be our first opportunity to directly prioritize families to receive this kind of rental assistance. But we think that we need to do more than that. There's some limitations to that pilot. And so as we look at our budget bills for the next government cycle, we're looking at what we might be able to do for a family homelessness strategy. I also just wanted to acknowledge that I'm excited about linking up the Early Learning Division, Early Learning Council, with our community action agencies. This is the delivery system for a number of our community services programs at OHCS. These are the nonprofits and county governments on the ground who are administering not only the homelessness dollars, but also, in many cases, Head Start and other and other assistance. And I think there's been some great dialogue that have been started around linking those community action agencies and their leaders with the Early Learning Division to really get their buy-in on so a lot of exciting things in the works, and I hope to see some of you at the meeting tomorrow.
Thank you, Margaret. Yes, I'm looking forward to that, and I know several of us will be there. So thanks for the update. Exciting. Angie,
Could I ask a follow-up
Oh,
question?
yes.
With Margaret, do you know if Speaker Kotek's bill that's in the works for homeless shelters, is there any intersection with some of the work that you're doing that you know of?
Yes, someone mentioned the short session. I think it was Marion talking about, relatively quiet. So we thought this session would be relatively quiet for us. Not turning out that way. So the speaker has a bill that she will be making public here very shortly, where she will be requesting dollars for shelter. We had a shelter study that our agency commissioned and published back in the summer that really highlighted the need for new shelter infrastructure. Knowing that shelter is not the solution to homelessness, but it has to be part of the strategy as well. And so we believe that we will be potentially receiving additional shelter dollars, including shelter available for families and children. And I think right now what I'm understanding is that what the speaker is asking for is relatively flexible in terms of the population served, so there would be an opportunity to deploy funds to local communities that are ready with shelter concepts and resources and sites, frankly, it's one of the biggest barriers to be able to also look at families and children as a population that they're trying to serve. I think the challenge with shelter is we just don't have shelter-ready projects. And so, obviously the local, we have a local pushback to siting shelters. So I think we're going to have to be pretty open about the kinds of shelter projects that we need fund, because we don't want to delay getting the shelter dollars out. We want to be able to ensure that we'll have emergency winter shelters funded by next winter. We don't want to delay that. So I'm hopeful that we can serve families and children as part of the speaker's action.
Thank you.
okay. Thanks, Margaret. Angie, let's see how we can listen to you. If you called in. Angie, did you call in on the line?
I think her phone's muted right now. Let me try. Angie?
Okay, we'll see if she gets off of mute.
Angie, are you there?
Yeah, I'm here. I called you, I can hear you on the telephone, but you can't hear me.
Okay, let's go for it, Angie. What's happening
Do the best we can.
with your world?
Oh gosh. Okay, so can you hear me?
Yeah.
Sort of.
Sort of.
Go for it.
Yeah, go ahead.
Yeah.
We will listen carefully.
Well, Dan, I'm on my phone too, but I don't know why I can actually see you on my phone. So I don't know why I can't speak to my phone.
Okay, well, go ahead. We can hear you.
Okay, I will, I'll just try to, I hope you pick up the conversation. So my kids are not very wrong, in the first 4 months of school, just seeing a lot of families that are with a lot of comment into domestic violence, incarceration, homelessness, and there's so much more, and it's what's going to come out, of course, in our classrooms. And it just highlights for me the importance of why this cross-sector collaboration is critical to this early childhood development. So in the wake of that, what we're doing is I'm looking a lot on social emotional development. We are implementing conscious discipline, which is a social emotional learning curriculum. And we're doing that in collaboration with Launch. These new actions that unmet needs in early childhood. Sorry, I don't remember exactly what Launch stands for, but we're working with Launch to implement that both in our program and throughout the community. And I'm also working closely with our child's behavioral health department to bring play therapy on site at our facility so that we can increase accessibility and follow through for parents that are either working and can't send their kids to play therapy, or they have transportation barriers or other barriers that are standing in the way. So we're working with behavioral health to be able to do that on site at our facility, and that is already getting kids and families into play therapy that have not otherwise engaged in those services. I'm going to try to make this short. I think I had one other thing that I wanted to share. Talking about professional development for teachers and managing these challenging behaviors that we're seeing in the classroom. Through the new Hope Early Learning Hub, all of my teachers now have access to intensive coaching and remote coaching that the Early Learning Hub is made available to our staff, which are people within the mental health sector that are providing the services via, Zoom or Skype, other kinds of tools like that, and available for all my teachers, which has been already very helpful because it just gives them another resource to talk through what they're seeing in the classroom and try new strategies, ways to deal with those things, and just help teachers cope because, as we know, this is drawing teachers out when people are in my field. So I'm willing to take all the help I can get to try to offer them that support. But just in the interest of you guys being able to do me, I think I'm just going to cut it off at that.
Okay. Thank you, Angie. I appreciate you sharing, especially when you're not feeling well. Candace.
You're welcome. So I think the big things for the department are like a lot of people, the Student Success Act is really holds a lot of time and energy and excitement from the families and K-12. I think that the big thing is the $1 billion of student investment account that goes directly to schools and districts, and there's a lot of support in that. But maybe, just as exciting are the programs that are not that big monster yet. And so highlighting some of those is really, we have a part of the unit of creation is the safe, inclusive, and welcoming schools. And so this is a lot of parts and pieces on social emotional learning, trauma-informed care, the safe schools, and the task force around school safety, and really thinking about school safety from the inside, how we keep our classrooms really inclusive and safe. And that's how we create safety in our community and our schools. And so I think that is it's probably one of the most exciting and under-talked about parts of the bill that we are really looking forward to growing and moving. I think the other big piece that we're looking at is the Department of Ed has awarded a federal grant for supporting all of our EIEPSE partnerships towards inclusion. And thinking about how we start with the premise and understanding that all students belong first instead of some students belong, and we use a lot of language in the state around, if a student can be included instead of starting with all students should be included, and we have resource and capability and availability to make that happen. When we look at that, how that manifests into the K-12, if we isolate and think about students with cognitive disabilities, or students who experience Down syndrome, only 1 in 10 are fully included in their education. And that has nothing to do other than people's mindsets, because it's not a disability that prevents inclusive practice. But we know that families, as they experience exclusionary practices and segregation in preschool settings, are more likely to feel comfort and safety in that practice as they enter into a K-12 setting. So we're really excited about this federal partnership to be able to support and create sustainability projects and mini grants and training opportunities around all of our partnerships in the state to really help people shift how they think about including every learner first. And that's the outgrowth and benefit of that is huge in our long-term efforts. Those are our exciting things.
Okay, awesome. Thank you, Candace. Appreciate the sharing. I'll be really quick because we are way out of time. I'm just finding that the system development and integration of early learning into just about every meeting I go to these days, whether it's at OCF with philanthropy, where they're talking about childcare, even not just in the education committee, but in their strategic opportunities committee. They know childcare is a huge issue in the state. I'm involved in a foster care project with Liesel and some of her peers, and early learning and healthcare and just all that wraparound to get kids out of foster care faster is on every agenda. I spend a lot of time at OMSI, and they're focused on a lot of the professional development that we're doing and talking about, and trying to find a role to play to support that. So it's getting integrated, and I guess that's just what I want to share. I think we're just at the beginning point where we're going to see this popping up. Sort of what George was saying too, that we have a lot to communicate, and there are a lot of different arenas and partners where we can do that communicating. So let's go into roles.
Yeah.
Carrie, what are we going
And
to
Remy,
do?
can you pull up the PowerPoint? And I think actually the conversation we just had is going to help the roles conversation, because I think you guys all gave very concrete examples of your work, of where you're already at an expertise, where do you already have a relationship to do the kinds of work that you expressed at the retreat of what you're hoping to do as an early learning council member. So Remy, if you can take us to the next slide. We just wanted to kind of start off with a reminder of what roles you developed for yourselves for as a council member, of what are your roles. And so we would just wanted to remind you of the breadth that you identified, and that you identified kind of 6 roles. And the key one that I think you were most excited, and you can correct me during our discussion, about being a champion for the broad early childhood or early learning system for Oregon, and that you really want to work with both government and public partners as well as communities to raise awareness and build public will for the kinds of investments and services and programs that we heard as examples in your updates during this morning's conversation. And that really, to do that, you have roles 2 and 3, which is to develop a common understanding of Raise Up Oregon, as well as starting to really identify and elevate successes, opportunities, barriers, and roadblocks, because that will give you concrete things to champion where you can promote the successes and help tackle barriers and roadblocks. You also really talked about wanting to identify what success looks like, right? This is a 5-year strategic plan. So I think you were asking us to think with you about how will you know how Raise Up Oregon is going in a couple of years of implementation, and then how do we know how far we got by the time we're at the 5-year mark. And that you really want to ultimately also engage and coordinate with agencies on specific policies and coordination. So you identify that there's a lot of policy boards or other complementary issues where early childhood might be a subset of a broader mission and vision, and so how can you collaborate and coordinate on the early childhood part that you share in common. And then there's a specific role that you have that's connected to how you were formed, that really says you adopt the rules specific to the early learning division. So that's kind of the big picture. The conversation we wanted to have with you today, and Remy, if you can help me just go through the next couple of slides, and then we'll get to one that we're going to sit on for a while, right, is today we really wanted to focus on what does it mean to be a champion, and what do you want to do to increase your capacity to be a champion for the early learning system and Raise Up Oregon. All of you come to the table with expertise, and I think this is how do we continue to think in small chunks over time. We expand your knowledge and expertise to be a little more representative of the early learning system while relying on your expertise and what you're bringing to the table already. You should have a handout in your packet for all 6 roles, but we're going to just focus on the first couple today. That also gives you the kind of activities you were thinking about. What does it mean? How do I become a champion in year 1 of the council? And so what you can see is that you brainstorm kind of 2 types of activities that you could do. One is how do you just champion Raise Up Oregon overall and the implementation that's happening. And then as key opportunities happen with communities and the legislative session and working with the executive branch, how can you support and deliver key messages and champion specific strategies, initiatives, and legislation over time. So if we go to the next slide, what this is about is really, I think role 2 and 3 is actually supportive of becoming the strongest champions you can become. So one role, right, you identify was to develop a common understanding across all of you around Raise Up Oregon because of the different kinds of expertise. And the kinds of activities that you thought about was, how do we review written material? How do we meet outside of council time in time-limited small groups to engage in specific topics or with content experts? And how do we engage with state agencies around sector deep dives? And we've kind of talked about that the issues seem complex enough, or that our state agencies deal with a lot of different areas in early childhood. It would probably never be just one deep dive from them. And then the second one is how this third role is really how are you learning about how are things going. So you have your areas of expertise where you're hearing and knowing about successes and barriers, and then what could the council then therefore champion. But I think you're also trying to think about how do I hear about the broader early learning system, and so you talked about you wanted to hear updates from state agencies, that you also wanted to go to your communities and you wanted to have an opportunity to hear from them about what are the opportunities and gaps. And I think today's conversation with you is about how to best do this. We will be honest with you that in forming your council agenda today, the time disappears like that. And so we want to kind of think about how's the best way to do this. So if you'll go to the next, and then go to the next slide. So what we wanted to do, and Sue started the conversation really with you in her phone calls ahead of today's meeting, to hear about where do you have priorities, to start shape kind of where do we start, because there's like no wrong answer really about where and how we start. And I think that's why I think this morning's conversation where you're giving updates already jump starts this conversation. What we wanted to explore with you is, could we select 2 or 3 of the objectives from Raise Up Oregon where you might not have the strongest expertise or you know the most, and explore what would be a good way that would be efficient and a good use of your time to expand your knowledge or go deeper, or where you have a start of knowledge, where could we go be more nuanced. And so we were trying to think about, how about just the time between now and the April 30th next council meeting? What's a reasonable thing to expect of you? Yeah, eventually we'll talk to you by the end. Is it something like 1 2-hour webinar, or is it actually 2 1-hour webinars, because it'll be easier to think? Is it like a couple of you would like to get together in person with a content expertise? So you can start percolating with us that we don't want to burden you. We know that we're asking you to commit a lot during the council meeting time. So what is reasonable? So if you'll go to the next page. So also in one of your handouts, you have the objectives and strategies at a glance, because we think the strategies really help bring to life what we mean by each of the objectives in Raise Up Oregon. And you identified as across a group, I believe it's 8 objectives that are priorities that are reflected by what you guys communicated to Sue. So you already took the 14 and kind of cut them in half for us in just your conversations. And so you can see under goal 1 for children arrive ready for kindergarten, you highlighted objectives 2, 3, 4, and 6. In the goal 2 around children raised in healthy, stable, and attached families, you identified goal 7. And then in goal 3, you identified objectives 10, 11, and 14. And so we can take this conversation a couple of different ways. One is that you could share, did you pick priorities where you had a lot of comfort? Did you pick priorities where, in hearing some of your conversations, you're seeing high need in the communities that you're representing, and that you really want to think deeper about those needs, and what's the good news of what's being addressed and how things are going, and then how do you understand kind of the next steps and what might need to be championed, and see if this makes sense to you, and is it a useful use of your time, that if we did a couple of things with a few of you between now and April, in between the meetings, to deepen knowledge, does that feel right, and is something you're interested in? So let me pause there and get initial reader reaction from the room about either these we can go a little bit deeper and look at the strategy so you understand what these 8 objectives are, or just a general conversation about what resonates you, especially after hearing your colleagues' updates that we just had.
So what you're wanting us to do, Carrie, if I understand it, is to, basically we can look at all 14. I hope I sort of captured some of our conversations in the last few days, and then see if we can agree that there are a top 2 or 3 that we want to focus on either this year or at least in the next several months.
Right, we wanted to at least convene maybe on 2 topics in the next 3 months so that when you come back as a council, you can say, was that useful? Was that an efficient use of my time? Is that a way that I can augment my knowledge and understanding around policy and practices, successes and challenges in certain areas of Raise Up Oregon where I'm not already coming to the table with a deep expertise? So I think we're trying to figure out an efficient and easy way to augment your knowledge so that you feel even more confident as a champion over time across the breadth of the plan, but also not do it so quickly that you always feel like your knowledge stays at kind of the shallow or initial level.
Yeah, and I'm guessing it may also, our conversation may also reflect, sort of what's going on in our lives in the next 3 months.
Well, yeah, and that too.
So,
and I think that's right. I think that's why we wanted to pick that time period so we could be really concrete about it.
3 months.
Of what's really possible.
Yeah. Peter.
Yeah. It seems to me that the strategy number 6, really because we're now in this transition into the Student Success Act, and there's hopefully, as George was saying, more willingness to have discussions between early childhood and K-12. It seems like having a discussion on the transition and continuity of services across early childhood education and K-12, that'd be a very timely discussion to have. People are starting to put into place their ideas of what the transition is going to look like for the kids that are going into kindergarten next year. So I would be very interested in delving into that between now and April if possible.
Okay, good point.
And I think that's inextricably linked with number 3.
It is.
Yeah. So that we make sure that when we're talking about families, it's not just people who are already in the system or any one segment, that it's there's equity in how we're talking about it and how we're reaching out and describing what this transition looks like. So it's understandable and accessible.
And you're talking about the workforce, Katie?
Correct.
Number 3?
Yep.
I would even say, within each bucket, the goal 1 bucket, the goal 2 bucket, the goal 3 bucket, that you have, I love the idea of number 6 on goal 1 being it's highly relevant, it's highly, the sense of urgency is pretty high right now. The readiness to benefit for a bunch of people is pretty strong right now. So that's like a buzz one right now, or a hot topic. But same thing for goal 2, which one is the hot topic, which is the most relevant, which is the most impactful today, tomorrow, in the next 3 months, next 6 months. Same thing for goal 3. And if it doesn't have to be, it can be what the council thinks too, but I think the people that are doing the work probably know as well what's happening and what's has the most sense of urgency or readiness to benefit for the state or for our regions. But I do think that just a lot, not just a lot of I'm telling you, but a lot of I'm listening to you and I'm working with you and I'm trying to figure it out with you is what I'm looking for from our organization, from K-12, but also from the Early Learning Division, just to make sure that, the perspective of schools for the most part is we like what we've been doing and we don't really want to change everything that we've been doing and we don't want to be told that you have to change. But if we are going to change, work with us or give us time or let us, I think they're using the word grandfather. There's a lot of things going on that people are trying to okay, over time we're going to get to the quality that folks are looking for. Over time we're going to learn and grow with you and do different things. And it has to be that level of understanding, I think, from districts, but also an understanding from ELD that if you're doing something that's good, we're not going to just try to change you if you've been doing something that's been working out as well too. I think that kind of stuff for a variety of things we should be exploring. I'll stop.
I see a sense of urgency for number 3, partly because that's downstream. That if we're going to be offering more opportunities for childcare, we've got to have the workforce in place to deliver that quality care. And that's going to take some time.
Yeah.
It's not something I know very much about, except that I know that our community is really stressed as far as capacity to expand because of that problem.
We have a-
With goal 3, number 10, I think is a really important one because we're talking at a state level about regional systems, and I don't know where the tether is to the regional conversations, and I know our local leadership is hungry for how do I engage, what are the priorities, so we're developing a matrix for that. But given that there's so many resources, my concern if we wait too long on that one is that we will have spent resources in a scattershot approach as opposed to a line. And really it's those local folks that are making those decisions and know best what works in community. And so I'd really like to try to figure out how do we have a conversation between maybe some folks from this group and some of the local leadership and pick maybe a region or two to really figure out how to sort through that alignment.
To build on that a little bit, Liesl, I appreciate you saying that. I think that that's probably an area where we need to do kind of more design and more development in the context of Raise Up Oregon, because I think about our early learning hub system as being a tremendous resource for the same kind of sort of governance and cross-system, cross-sector initiatives that are happening here that are represented, I think, in this council and in Raise Up Oregon, happening regionally and more locally. There's some, great examples of that. I mean, I think as Pat was talking about the universally offered visiting program and Family Connects, just to think about how many hubs are supporting and doing that work with local public health. I think work in partnerships around K-12, the sector planning that hubs were able to do, and bringing just families, but a lot of their K-12 partners, Head Start, childcare providers. But I think it's that connection between, and I think a lot of the conversation we've been having kind of from the ELD right now with our hub partners has been really focused on kind of early care and education and sort of one sector. But I think as we talk about mental health and some of these other systems and cross-sector, there's a broader vision in Raise Up Oregon than the priorities that are being driven by right now around early care and education and expanding quality supply. So I think being able to come back to that. Housing, I know there's some hubs that are working deeply also on the housing issues. So how do we spend some time, I think, understanding that better and be doing some more development of what's going to be the relationship, I think, between this council and the hubs more around the cross-sector priorities of Raise Up Oregon would be great, extending beyond ECP.
So in that example, I think what we were picturing, and we can definitely modify it based on your input, is to have that kind of development design conversation and how to champion the next level of what should the local services alignment be and the role of the early learning hubs as well as the other regional systems. What we thought is then what we maybe need to do is, do we need to spend an hour or two in between a meeting saying, what are the hubs? What was their history? What's driving their work right now? Have an opportunity to talk to not only the people who are helping and supporting their early learning hubs, but maybe hear from some hubs. So you have your experience in your communities about how your particular hub works, but then there could be examples of where are they similar across the board, where are they differently, and then what does that have implications for next steps and where we want to champion, where they go next. And so that's kind of like, that's why I think the updates really help, because we can think about where we want to get everybody on the council, so then you feel like you can participate in that kind of conversation.
Yep.
The thing about number 3 that I think, if we're going to delve into that in depth, one of the things we need to think about is that every group anywhere talking about anything, if you sub out the reference to early childhood education, has that exact statement on their list, no matter what they're talking about, and they can't all succeed. Right? So, I mean, thinking about sort of the global element of that, I don't think anybody's doing that right now. They're all saying, we need more people that are more diverse, and we need to pay more money. Right? So I think we need to figure out how to get a little bit deeper than that.
Right, and I think that's, there's the corollary, right, because 3 is focused on the early care and education workforce, but 12 is this cross-sector of what is the power, and this is what some of the conversations we've just even barely touched on with our Raise Up Oregon Agency Implementation Coordination team, of the common issues and the power of if health, human services, and education came together and said, we actually all need workforce that works with kids and families, that's diverse, well compensated, that has the kind of education from our community colleges and universities that have a shared baseline knowledge. How can we come together to more powerfully try to make some of that happen than each of us trying to pick it off? So I agree with you, 3 and 12 are complementary. 12 is thinking about the power across the sectors that have the same need around an early childhood workforce, and 3 is the deep dive on what does it mean for early care and education, and what does high quality look like in that kind of setting.
And the thing about thinking about those things together is that it forces us to back up and say, what's the infrastructure that we have that is training people generally? What are our community colleges doing? How well equipped are they to do that? And it forces us to look at the system that does that, as opposed to, I just need more childcare providers, and how do I get those trained? Because we have a major infrastructure and training capacity dilemma that affects all of us across all of those systems. And the power of this early learning council is to be able to take that step back and look at the infrastructure that we have in this state and how to figure out how to raise it up to perform all of those functions for all of the needs that we have.
Well, and from your earlier comments, Anne, it sounds as if there might be alignment with some of the work you're doing with the FBO.
Yes.
And if they're going to focus on workforce or as one topic, maybe that's a piece that we could kind of work together.
Yeah, I think there are lots of constituencies that are ready to dive in, as Pat suggests, and really make something coherent out of it rather than having it all be siloed.
But part of my point is 3 is a problem because we don't have enough people.
Yeah,
Right.
that's true.
I mean, my local Subway closes in the middle of the day periodically because no one showed up to work because they can't recruit enough workers.
Right.
And so whether it's psychiatrists or people making sandwiches, there just aren't enough people at
Classroom
3.7% unemployment.
Yeah, that issue times 100 in every rural community.
Exactly.
Yeah.
Mm-hmm.
So figuring out what in that huge global space would be a council,
Right. Right.
right?
Mm-hmm.
I don't have the answer to that, I'm just saying, we could spend a lot of time.
But just that theme, to me, is one of those, like, schools are now starting to talk or work with or understand job shadows, work studies, different experiences that children can get into pathways for early learning or for Oregon Teacher Pathway. So there's all of these things, and they're, I'll just say in the inception or in this somewhat, some are dabbling in that. And just to get to that, what's going on in schools, what's going on in colleges, what's going on in workforce, how are they doing growth or expansion, and having, I mean, if we did pick, I'll just say 2 or 3 things that have the most sense of urgency right now that we have to get ready, that would be good to have reports and presentations, or even, I'll just say focused targets towards.
Right. And maybe one of the first steps is to figure out, who else is in this space and what's going on already.
And I just want to refer back to, I mentioned it just quickly, but in Douglas County, we are doing an infant mental health endorsement that is in partnership with PSU for 12 people. So 12 people, I mean, it doesn't sound like a lot, but in Douglas County, that's a lot of people.
More than 0.
That's a lot of people.
Yeah.
Actually.
Can I say something? This is muted, so I was trying to talk, but no one could hear me.
Aw.
There was something, I'm sorry to interrupt. I've been listening, and I kept saying, excuse me. But you said something that, thank you, that I really, before it lives, like, I gotta hurry. I was like, say something. You had talked about access. Gentleman had talked about, you had talked about infrastructure, and then someone else had sort of also back that up in terms of workforce, and I just wanted to add that the access points, like infrastructure is step 1, but we're not looking at access points. Even when the infrastructure is there, sometimes people don't have access, whole communities don't have access to that infrastructure. Correct. So looking at, I think there has to be really good analysis on what the barriers are because I think the conversation is often around infrastructure. If we don't have the numbers, you guys were talking about there's not, you know, sandwiches making, and, and I thought, well, that might be an access issue as well. Like, what is, people are informed, so in high school, yes, people are getting exposed, but that doesn't, there is still a breakdown between the exposure and the access to the actual training and opportunities that lead to the job. And I think there's not enough analysis of that piece, and so we're not able to sort of stem the tide, or create the tide that we need. So, anyway, I think that's important. I was like dying that I could not.
You can now take off your coat and appreciate you running up the stairs. Participate.
Carrie, I wonder if just the conversation needs maybe the emphasis being on 12 and broader, because I think some of that will be inclusive of ECE. I think it's some of the opportunities that we have for next year.
Yeah. And the other thing I was hearing in the conversation, and I was trying to figure out what's the balance for what kind of conversation you would want to have, right? Because I'm hearing two different things. One is, what would be some kind of baseline conversation you would like to have with a couple of people who know in Oregon the history of, like, what's the workforce, what is it that we have, why did this make it into Raise Up Oregon, what's the intent behind the strategies, what's our history around investments, policies, and practices, right? Like, kind of baseline knowledge. And then the other part of the conversation that I'm hearing you from is what knowledge is in the room, and maybe some experts that big picture, if Oregon was to think about workforce development, here are, like, right, kind of here's access points to training and opportunities, here's, you know, barriers that we've done, created for key populations across the country, and then how do we apply that to Oregon? You know what I mean? It's kind of more of that kind of, what are some frameworks or ways to think about some of these issues with some experts, and how to apply that knowledge to the Oregon context. So there's kind of, where is Oregon, how did it make it into Raise Up, or, you know, how did it make it up into the strategic plan, and what's kind of current status and intent for going forward. And then there's kind of this more like content expertise around like workforce development, and how do we tackle things like access and opportunity and compensation, and core competencies and that kind of thing. So, and so do people think there's a sequence there, that if we were to attempt something between now and April on these three that kind of raise to the top at the moment, that a baseline of how did it end up in Raise Up Oregon, what do we know about the Oregon context? So then if we wanted to do the next step around opportunities, barriers, what do we want to hear from communities, how do we figure out strategies? I just want to make sure, because I hear both kind of conversations going on at the same time.
I'm not averse to that sequence. I'm thinking here that I'm much more interested in the second part of
Okay.
that. Just because, you know, every meeting that I'm in now is about workforce.
Right.
So it's like, I know it's a problem.
Well,
I know how we got here.
Right.
So
that's helpful.
You know, we've disinvested. We have not invested at the level we needed to.
Mm-hmm.
So that's pretty clear.
Right.
But so I'm not sure it's the second part.
Okay.
And I'm kind of in the, what's the short-term thing we're trying to do, what's the long-term thing we're trying to do, and are we making progress towards it? And if I get updates like that, then I'll be, oh, okay. And then we can ask questions along the way.
Right.
Right, that's
You
a
know where
helpful
we're
frame
going.
too.
Or where we're going. And obviously, higher ed is part of this conversation. So, but we don't have a higher ed rep per se on our council, so something else to think about. So I think there's real interest in the whole workforce, but more focused on where are we and where are we going,
Right.
as opposed to where have we been, or how did we
Right,
get
exactly.
here.
It's more, I think it's clarifying the short term and the long term. Maybe that's captured in Raise Up Oregon, but then more of this like what are the strategies, what can we learn from others, and then how does that fit into an Oregon context that we might consider. For the one on,
And I would even just add, and then how is it impacting? How is it impacting ELD? How is it impacting preschools? How is it impacting communities? How is it impacting schools? How is it impacting university systems? I mean, I want to hear that and understand that kind of stuff too, so that it influences us
and more long-term decision-making.
Yeah. George, I agree with that, and especially in the context of your previous comment of short-term, long-term, because those two things will have very different metrics, I think. So maybe understanding what the short-term metrics are so we can identify whether or not we're being successful at the very get-go and get out of our own way to try and make this thing happen as quickly and as effectively as possible. Disseminating the funds are generating the things that we want to achieve with the Student Success Act. And so I'm really interested in that as well. And because it's one of my underlying worries. I love you people at the state. I used to be one, but it's really hard to get programs of this magnitude out on the street effectively with some modicum of local control, of regional control, but I'd really be interested in those early metrics as opposed to the long term. And also, how does that align with all the work that the hubs have been doing in asking these questions over the last few months of what is the need, and are we scratching the surface?
Well, and I like the idea of taking maybe some of the family voice perspective and shadowing that, because I think to Kali's point, we also risk a target audience that we're trying to serve, and what are their barriers to accessing employment, childcare, the transition from early childhood to K-12. I think if we could take those two in tandem, we're building an infrastructure system, and how are parents actually able to intersect with it, and what are their barriers to accessing. I think we sometimes forget about the family piece of it, and if we can take a two-prong approach, and what are those short-term wins or success measures, I think we'll learn a lot, as opposed to waiting and asking families what the barriers were on the back end.
And Lisa, if we go back to your earlier comment when we were doing, sort of going around the table, and you were talking about the regional focus and kind of that local input, were you thinking of workforce or program rollout, or could you talk a little bit more about what your regional?
I was talking more about program focus, although I do want to echo what Pat said. Literally insert anything into workforce and it's an issue, whether it's the facilities where we're trying to build up capacity, whether it's our own workforce. We have a huge turnover in child welfare right now, and it's difficult to recruit and retain staff. So I just want to echo that comment. I think as a state, we really have to look at workforce issues. So it's my editorial comment aside. I was really talking about the programmatic piece, because I think you have CCO work happening, I think you have DHS work happening, you have work systems, workforce happening, you have early learning, and I think if we could help incentivize the coordination at the local level, to Katie's point, how do we take a state initiative and roll it out? It's all about how the local folks are working together, and I don't think we collectively have provided that scaffolding for folks to see the connections between the two systems. We did some regional convenings with the CCOs a couple of months back, and I think that was just some beginning, and I think it was well received, and I think more we can add to that and perhaps add the hubs to those conversations, the better.
Yeah. I totally agree with that. I completely second that. And if we're thinking about scale and implementing at scale, that's the only way we have to prioritize that.
And I think we try to do things in Oregon with, do it the local way, but if we don't give the tools and support and the barrier busting for that to happen, then I think that's sometimes where we miss at that local implementation.
Are there other comments that if you participated in the kind of state community connections and the use of the regional systems, are there other reflections of what you would like to know or hear about? It sounded like a lot of you have individual relationships with specific hubs, and so what would be the kind of broader up conversation that we would start?
It's a really important question, because it's something that we've talked about, staff's talked about, and I've talked with them about since July, is what relationship do we as a council want to have with our hubs? And how are we going to get their voice at our meetings? And when we say hub,
it doesn't always have to mean the hub directors, right? The hubs are these, multi-sector, cross-sector governance councils and family voice and all of that. So I think figuring that out or brainstorming what are some options of how we want to work with the hubs would be really helpful. George?
I was just thinking, I was doing my drive yesterday, and I was thinking about my own learning and my own growth, and how it's exciting to be a part of something that's at a state level, and how you understand the bigger picture of things, and how I don't really understand the machine all that well yet, and I still need to keep growing and learning the system, and as I keep growing and learning the system, I'll someday be a better human being and all those kind of things. But my point was just this kind of like, my view of our role, for me at least, has been I need to really understand at a big picture how the machine works and the priorities within that, and how this thing influences that thing so that it creates this better outcome. And back to us, like, I think for me, I need to be able to articulate to my constituents often, here's what people are trying to accomplish. I know there's a lot of things that get in the way, but here's the outcome that we're looking for over time. And what they're going to say is, well, do we have the money? Do we have the infrastructure? Do we have the staffing? Do we have all of that? They're going to do all the second order, third order consequences of everything, and we have to just try to understand all of that and how it impacts kids or impacts providers. So my sense is us just really getting good at the big picture, but also listening and hearing to the constituents about what their issues are, and then us trying to back and forth communicate, like, do we have the funds? Do we have the resources? Do you have the capacity? How is it working in this machine that we have here to impact that machine? It seems to me what I'm saying is very confusing, so I'm sorry if it is, but just that piece of it for me has been, I think our role is to just really help inform people about what we're trying to accomplish and listen to them, and then apply resources or strategies along the way. And that's what I would do in an early learning hub, but there's regional hubs too, or RAP hubs, and I don't even think that they really know what we're trying to do in early learning, because they're doing all of the other things that they're trying to do for system support for older kids or younger kids or families, and even having that much more communication. And it can't be probably that our council members can go to every one of those meetings, because I know that I can't.
Right.
There you go.
Yeah.
One of the things, as someone who's been on the council for a little bit, I think in the past we've had hubs present and they've been able to talk about opportunities and challenges, and that has been very helpful to me as a council member to hear firsthand from the hubs. I know logistically they were long days and lots of presentations, but it was the only glimpse I had into some of the communities that I don't personally spend time in, and understanding the unique challenges that they face and the opportunities. The way they collaborate is different in different communities. And then the cultural communities within those communities have different needs. So I found that very helpful. If there was a way to do an element of that where hubs people, and representing, like as you suggest, not just the directors, but a cross-section of the hub and the diverse sort of stakeholders that are part of the hub, having them be able to talk about, here's what we feel really good about, and here are the things that have been really challenging. I think that was some of the most powerful sessions I had as a council member, and certainly informs how I think about policy and policy making in this position. So that would be my...
So maybe building them into our agendas as we go forward.
I agree. I think that works well for us to get educated about the hubs, but maybe not so much for the hubs to understand what we're doing or connecting with one another. Yeah. And I don't know, are they connected? I sit on a hub, but I don't know how they're connected to one another.
I want to connect it to one another. Yeah, sure.
Do you want to answer that?
Yeah, so hopefully this is helpful, but we, as the Early Learning Division, we administer a set of funds that go to each hub to do that sort of coordination, systems integration, system alignment work, and we provide them technical assistance around sort of local and regional kind of early childhood systems work.
So they know what a neighboring hub or a hub in
they're convened, right. So there's ways for them to be.
So that's
through the TA we provide as sort of a community of practice. we create, we provide through the TA a lot of time, space, and opportunity for them to come together, share updates, share information, sort of learn together around kind of community systems work. The other thing to, I think, note as we go into this conversation is there are some funding streams that the Early Learning Division is responsible for administering that are co-administered with the hubs that are outside of those resources that are about being able to do hub and sort of systems work, right? So I think we can dive a little bit more into that as Carrie was suggesting as we talk about this. Just want to say something that I've heard from hubs since I've been back in Oregon and in this role that I think is important for us to think about as a council is that they, right now, I think that different hubs see different opportunities for cross-sector work relative to their context. Sometimes they're backbone agency. So if a hub, for example, has a backbone agency that's a CCO, that's created different opportunities. If their hub is an ESD, that's created different opportunities for sort of systems alignment and integration. There's some of that. There's also just opportunities that arise in the community, right? So we have, for example, in Kali's community, there's been a big effort around preschool for all, right? And the hub has played a very important role in that. And I think that's an important aspect of what we need to preserve, right? There are strategic opportunities, there are different needs across our state, different community needs, and hubs are responsive, I think, and opportunistic to those system building opportunities than the assets that they have. But what I think has been missing somewhat, and I think sometimes, and I've heard hub, this articulate, the governance council's directors, staff, is more clarity from the state. So now we're really talking sort of this body is sort of our governance body over the early learning system, and their governance bodies around what the state priorities and direction is. I mean, we have raised up Oregon, but it's big, and I think that's where Carrie's trying to get us to, is if we dive into 10, what are we really talking about and what are those levers? So what kind of support do we offer and say prioritize, and what levers do we have to say alignment with what are the priorities of human services and kind of regionally, right? And how do we communicate that to hubs? How do they communicate back to us about, Margaret in her update talked about the relationship between community action agencies, right? And there's already some where the backbone of the hub is a community action agency. Again, another example of where they might have strategic opportunities.
Right.
But what, to your point, Peg, do we want to say across the hub system, right, relative to state priorities is where we have some alignment. And I think then what are our levers and where do we want to really be intentional about that? Not to diminish their local or regional needs or what opportunities that they have, but as we try to build, ultimately, I think, our North Star is that, across our state, for families with young children, these services should be more seamless, they should be more integrated, families should know and be able to expect something to happen across in every community relative to the supports that they receive, right? So I think maybe, Carrie, understanding a bit more about that, I think starts with understanding our own, it's going from some of what the agency priorities are and the relative to, as well as what is happening with local entities and aligning those, I think, to Raise Up Oregon, and then talking a little bit more about levers and talking with hubs about that. Obviously, as we think about what it would mean to have the hub system supporting some state sort of systems building work.
Right.
Hopefully that made sense.
Yeah.
I think we have an opportunity, as council members involved with our hubs, to bring some of this to the hub. I mean, I feel like one of the things I talk about with our hub with the preschool for all is let's make sure if we're talking about high quality that it's aligned with how the state is looking at this. Like, there are things that we can tether in the conversations that come up to this and our own objectives. I think we have opportunities to be bridges in that way and sort of repeat a message, because I think they read this, but they're not thinking of it in every decision that they're making, and so we get to be the echoing. Of course.
Which is why I think trying to figure out, some focus, at least for these, either 3
Right.
months or 12 months,
Right.
may help with that
Right.
as well.
I'm going to just say this, and it'll be my last comment.
Oh, no, it won't be.
Well, it'll be on this topic. Thank you.
Oh. That's why you're here.
No, just I would say from a K-12 person at least, the behavior, social, emotional learning, trauma things as a big theme across the state is a big theme. The workforce pathway development, anything that creates more development for future staffing and support services, that's a big theme for me. And then the high quality standards / the role of K-12 within that is, and we have our own preschools, we have our own systems, we have our own things, and we're a big player, I'd say, in kids coming into school, and we want to make sure that we're in alignment or we're working together on this. And for early learning not to focus on that too is bad. This opportunity is the time to create a better system.
What do you mean when you say that? What do you mean early learning not to focus on?
The needs of K-12 for 5-year-olds to come into kinder. The needs of K-12 for the system of early learning to coordinate with that system when there's an infusion of money with more resources and more infrastructure to be able to communicate on standards or communicate on transitioning or communicate on behavior.
And do you feel like there isn't?
I would say, yeah, I don't feel that there is a strong.
It's a two-way street.
I think so.
Well, there you
too.
go. Then that goes back to
so,
that,
yeah.
just that issue.
Because,
And
sorry, I was just telling Sue yesterday that I failed miserably at, getting Lucas registered for kindergarten in the appropriate timeline. I thought that by doing certain steps that I did, that I had checked those boxes, but I had missed some other things. And even though I'm in this conversation, I didn't know the proper way to connect with the school that's less than a mile away from me. And even though I go, we would go and play on the playground on the weekend or whatever. But, so I immediately started thinking, well, the county delivers books through the library to childcare on a, some regular basis. Why isn't the school district partnering with the county to deliver things that are like zip code specific about school? So there are connections that aren't being made on it's a two-way street. There's
very much so, and I
would
think that the K-12 system, as someone who spends a lot of time in the K-12 system, the posture is somewhat what you've articulated. Well, early childhood needs to communicate with us. Doesn't go both ways, I think, and they have to meet our standards. I actually think early childhood does a better job of supporting young children than the K-12 system does. And in fact, the early childhood system does a better job of supporting diverse young children better than the K-12 system does. So I feel like the posture should be, what can we learn from early childhood to better support young children? The way kindergartners are shifting to be more standards-based and academic is not based on early childhood research on what's best in the developing child, in the developing child's brain. And yet we sort of, I'll consider myself part of the K-12 piece because that's where I spend a lot of my time. We're not thinking about what is best for children in learning, the role of play, the role of social emotional development. Just now K-12 starts to talk about it. But they could have been learning from early childhood all along. So I do think K-12 has to begin to pivot their posture to see, you know what, we have something we need to learn from this early learning space, and particularly the kinder and first grade years, those transition years, there needs to be effort made by K-12 to lean into early childhood and not necessarily the other way around. And I don't know how to create that shift because I sit at tables with people probably similar to you where it's just not there. And I think because I sit on both sides, I'm like, oh, you guys have so much to learn. And I don't know how we change it. It's a paradigm shift. But I think that's part of what has to happen.
Mm-hmm. Yes, and I think we're in the middle of that paradigm shift.
And I think it is happening in some places. We have some shared curriculum between Head Start and the public schools around social emotional development so the kids are seeing the same thing, whether they're in their last year of Head Start or their first year of kindergarten.
That's great.
Well, and part of it seems like a through line in Raise Up Oregon and Student Success Act and everything else is stop thinking of them as two systems that have got this hard break between them and think of it as one system that incorporates health and other things that we've talked about that are taking kids from prenatal on through and not have that big division line that I think is part of the challenge.
You're right, and I do think the Student Success Act gives us that opportunity, and I think we should look at it that way, to really start building these bridges and communications back and forth in a positive way. So we just need to kind of reset the conversation.
And I think part of, to your point, Pat, part of thinking about it as kind of one system would mean also recognizing from the K-12 perspective that it isn't, that the system isn't just the programs that we operate in control at the district level, but the system is the programs that are provided by childcare, by culturally specific organizations. We have a mixed delivery system of early care and education in our state, and so those that, understanding what child care resource and referral entities are, the role that they play, sort of community colleges. I think as we think about ECE specifically, home visiting programs in communities, right? So this is a system that is broader than programs, not to, that programs that are offered by my district or in partnership in my schools, right?
So in our last few minutes, what I think I'm going to do is, because each of these topics are so rich, is that I'm going to work with the team to take these initial topics that you've identified as priorities and say what would be the next 3 months chunk of the conversation, and then not lose the ideas that you've already talked and show where we think the sequence of where would we start with this topic and where are we trying to go to reflect the breadth of the conversation that we just had, because I think these are complex enough issues that the initial baseline experiment that we want to do between now and April is not sufficient for where you want to take the conversation. So I think my last question for you guys as we wrap up is, what's a reasonable amount of time? So if we came back to you in a week or so and said, okay, here are your 3 options of signing up for a small time limited baseline conversation between now and April, so you can both learn information but then give us feedback about how best to do this. Is it something like, are we talking like I start this off with a couple of hours? Like when you think about, basically we're talking about the months of February, March, and April. Well, we'll need some time to set some things up, figure out who should be joining you in the conversation, work with them, and give you an opportunity to give feedback to an draft agenda of what would be the initial conversation. So we're probably aiming to do these things, actually deliver them in March or early April, so that at the April 30th meeting, you can give us feedback about both the content of the conversation as well as this being a strategy on how to do some of your roles. Is it a couple hours you're thinking is reasonable, less, more? What? I just wanted to get a sense, because we know you're all busy. So.
With enough of the advance notice, a couple hours is worth.
Yeah, not more than 2.
Okay.
You can wait till session.
Yes. Yes. Yeah. After session,
background
couple
material too.
Yeah.
I mean, I value the time together, but I just think realistically, if there's some briefings or things we can do,
right.
that would be helpful.
And I think it depends on the topic and the focus, right, of whether written materials exist or what would be the focus of the written materials.
Well, and I think if any of you know of background materials, great idea, Lisa, or key people that we ought to be bringing into the conversation or getting information from in advance, it would be really helpful to just feed those names to Miriam or Carrie or me, whomever, just to provide some of that basis for building that. There's certainly here interest in the hub system as a system. I think we do need to figure out how do we pull that information together, knowing we've got 16 hubs, but there's certainly some commonalities. I know several of us have talked about the local planned community planning that they've just completed, I think in December. So what did we learn from that? And it would be really great for the council to have sort of a synthesis of what were the takeaways, especially with the family voice, which I know is a big focus. And someone mentioned they had 400.
That's us.
Was that Peter?
Yeah.
Yeah.
It was pretty detailed feedback in terms of what obstacles were in the way of accessing services, and not a lot of surprises. Money, transportation, time of offerings.
Right.
Yeah.
Right.
Right.
So I think getting that kind of baseline material to
Yeah,
us
that
would
would be
be
great.
really informative, and help us figure out, so what are the barriers that they're seeing at the local level? And is there something, at our level that we could try to influence that? It was interesting, the bill that Miriam mentioned, the Senate Bill 1518 for the out-of-state people moving in wanting to provide childcare. I heard that, Katie, when I was at your childcare convening in August, whenever we were
September,
there.
yeah.
So it's exciting to hear that there's a bill that might focus on that could get people certified way faster. Months and months.
On the workforce issue, we have a work group that's focused on that, and the issue of background checks keeps coming up too, that it takes so long to get a background check done on someone who wants to be working in preschool or daycare that we're losing those employees. They can't wait 2 to 4 weeks to get a background check, so it's another obstacle.
Peter, and that bill will help with that issue.
Good.
Oh, it will?
Yes, that's what.
It's not just out of state, it's.
Well, it's the out-of-state part is what I think significantly increased the wait times for individuals who've lived out of the state for 5 years or in the previous 5 years in multiple states. Is that what you meant?
No,
or just in
so
general?
we're talking about people who graduate from Southern Oregon University and they have a degree in early childhood development, and they offered a job by Head Start, but the background check takes 4 to 6 weeks.
Oh.
And they get picked up, and then now they're working for a CCO instead of working for Head
Yep.
Start.
I'm okay with
This
that.
too.
So what's the
Oh, let's look on the bright side.
Yes.
But why, you haven't run into that? I'm hearing other.
Not that long, but I do know that we do both City of Portland background checks because they're quicker as a stopgap. So I know that the state background check takes longer. That horizon is a lot longer, like 6 weeks. I don't think it's ever taken that long, but you can get the city one much quicker, and it's like, I don't know, we can
The
allow
school
someone to
district
be.
one or something?
Yeah, like
Yeah,
there's
'cause-
another one that's quicker.
Yeah, like when
So I know we do both. We'll pay for both if we don't have a lot of time.
Yeah, I know when
But
I
that's
registered
really
as a
low.
volunteer for the school, like, I did a background check and like through that portal, I was approved like right there, like on the spot or something like that, I don't know.
Nice.
And
Well, Portland Police has one too. I remember, like, I don't know, years ago we researched all the different options on background checks. And the state definitely takes the longest, but 4 to 6 weeks seems very long. I don't remember anything
Well, and I
that
think
long in the metro area.
Okay, well, that should be one of those barriers or roadblocks that should be.
Yeah, this is
lessable.
a deeper conversation,
Yeah.
I think, because we're implementing federal requirements, and the state background check process is much more rigorous and involves an FBI background check, and so
Got it.
we're dependent on kind of some of those timelines, obviously. So, this fall we did see an uptick, and then there's been a specific barrier now around federal regulations around out-of-state. Anybody who's lived out of state for 5 years, that's sort of made it longer. So I think that it's an issue that's also being discussed at the federal level in terms of what some of their requirements are. So I think it's an ongoing, evolving conversation. But I think I would want our folks, and Joyce, our acting director, to talk specifically, and we can present some information and share with folks around what we've seen in terms of upticks in the wait times.
Okay, that'd be great. We could just tie that in, just, we can tie
Yeah,
that into our.
everything in 2 hours.
Yeah.
But we'll keep that in so we can figure out sequence and put that in the conversation.
Okay.
for it to tie in this and the culturally specific, I don't know if we've had a way to track providers who may or may not be documented and how implementation of the fingerprinting and the more robust background check may have kept people from continuing to stay in business. Because I know that we had been very mindful in our deliberations about making sure that, there wasn't an immigration question, but when you go to get your fingerprinting, the very first question that's asked, are you a citizen of the United States?
Yeah.
And
That's a huge barrier.
It is a huge barrier, and it's a great loss for many communities because owning a business is not, citizenship is not a requirement of owning a business. And, it's
Okay, let's
deeply upsetting and troubling that.
roll in immigration policies.
In the 2 hours.
We're gonna conquer it all.
It's solved.
It is background check.
Not only
talk about it, but solve it.
Do something. Okay, Carrie, thank you very much. I appreciate you. All right, council, we have a 15-minute break, and we're right on time. So let's take a break. We will come back at 10:30 and talk about data, measuring success, which many of you have talked about historically. So, thank you.
Does every county have
Great
to do a
conversation.
community health assessment?
Measure. And so the Early Learning Division, and David Mandel has been our lead for years in trying to address that issue. We have a committee called the Measuring Success Committee that is a cross-sector committee sort of in abeyance right now while the new council's getting formed, but has been doing a lot of work in this arena as well. So we now are going to get updated on that, and I'll let David introduce our guests who have lots to say about this. So thank you for being here.
Well, thank you. And after Sue's introduction, I'm going to begin by lowering expectations.
Frequently happens.
Sorry. And actually, I have a whole slide on what I'm not presenting. So what I'm going to be a little bit presenting today is about work that sort of happened a little bit under the auspices of the old council. And what I am not going to be sharing is data. So this will be a presentation about the work that's been about to identify measurement aligned with the objectives in the plan. So I apologize in advance for what's a rather processy presentation, but I think it's just to help folks understand some of the work that's been done and to sort of help you think about what you might want to be doing with that work moving forward. But I am also really fortunate to have Catherine and Alicia with me today because simultaneously to this work, the Early Learning Division received a preschool development grant, and part of what that grant asks states to do is strengthen needs assessments, and we were able to work with great research partners in Oregon to help pull that data together. So at the same time, while we were going to be seeing work from two separate projects, there was also really intentional work to make sure that these projects weren't happening in isolation. So we were lucky to have Beth Green, Catherine's co-principal, investigator, and the work was also on the Measuring Success Committee. So I think this was a lot of effort to have alignment up front. And so I thought it would be really nice, since I know you guys are really interested in data, I wanted to make sure that we didn't have a data presentation that was completely devoid of actual data.
Thank you for Thank you, David. Or Catherine.
And in addition, Catherine brought her own clicker. So now we have to move slides forward.
I will get out of the way.
So again, just a little bit of a preamble, and I won't dwell on these slides too long. I think one of the things that came up during your retreat was the importance of how do you want to look at measuring success over 2 to 5 years for the Early Learning System, Raise Up Oregon, and Early Learning Council. So again, in the spirit of lowering expectations, I think what you're going to see today doesn't get at all of the kinds of measurements that you sort of talked about, and what this is really sort of focused on is sort of thinking about how we measure progress towards these objectives within the Raise Up Oregon plan. And again, in addition to being aligned with the Raise Up Oregon plan, it also addresses one of the strategies within the plan around creating and use an early learning system dashboard to create shared cross-sector accountability for outcomes for young children and their families. Both to use that to monitor, but also to make sure that we're incorporating specific data on children of color from historically underserved populations as a specific goal of that work. Wanted to start with that goal, not only because we always take things back up to Raise Up Oregon, but I think that sort of gets at, I think, some of the guiding principles about thinking about that sort of cross-sector shared accountability that I think has been sort of key to the work. Again, I promised you I was going to talk about what I'm not going to present. So I just wanted to, I think it's just helpful to start with some of the clarity. So I think the library that was developed around Raise Up Oregon is about trying to measure progress towards the objectives in the plan. It's not about tracking progress on implementation of specific strategies or action items within the plan. It's also about that shared cross-system responsibility for outcomes, but it's also not really, at this point, was not developed as a tool for accountability for accomplishing specific tasks. So it's really focused on, are we collectively making a difference, rather than addressing the question, are we doing the actions we said we would do? Right. Not to say that those other questions aren't crucial and important and we need work to answer those questions, but I also just wanted to be clear that this work was not aimed at answering those questions. And so I think there's also additional work to make sure those questions are getting answered. And then I think it's also important just to note that this is really about leveraging existing data resources to align with Raise Up Oregon and not about creating new data collections. And I apologize for folks who were on the previous council who've seen some of this before. So I think one of the things that we started with on that committee is really thinking about the theory of change of what we were trying to accomplish with the measurement. And I won't read through this, but I think the basic idea is that if all the sectors and partners can see themselves in the measurements, if they can see what their contribution is in those measurements to that work, and they can have a commitment to that, then that will both spur greater alignment, greater commitment, and help us identify where we need to work together in a different way. So again, I think in some sense, well, this is focused on data. In some sense, I think it's also a little bit the theory of change of Raise Up Oregon in general. And what I should also, this is really a reflection of the people who did this work. The committee has been a little bit on hold for quite a while, so in this transition period. But wanted to sort of put this up because I think there was a real effort to try to think about bringing folks together with both sort of policy and data knowledge from different sectors, from the hubs, but also people from within agencies who have actual knowledge of what the data is and what the data sources are and how they work. And part of what we also tried to do was make a distinction between what are the sort of long-term goals that we're trying to achieve, really sort of focused on those. What are the sort of true population level changes that impact children and families? I sort of think of these as, these are the reasons that we get up in the morning goals, like why we come together, but also want to start with a real acknowledgement that these long-term goals, it may be 5 to 10 years that it takes to get there. So these are the things that we come together to help us remember what we're trying to achieve and the direction. But that's also why we need things even at the medium-term level that we could maybe more realistically expect to see 2 to 3 year changes that are more, that can be sometimes more specifically for a specific program or sector, but also really importantly have those buy-ins from those sectors, but help us know that we're really getting towards those objectives that'll lead us towards those long-term goals. Part of what we also did is try to sort of look at the data that was out there from 3 different perspectives. So one of the things that the committee did first was sort of thinking about those two goals of children arriving at school ready to succeed, children living in healthy, stable, attached families. What are the sort of developmental domains within those that we sort of care about? And then we also looked at it from the perspective of the different sectors. So what are the things that folks in Oregon Health Authority are looking at and care about? What are the things that folks within the health within K-12 are also looking at, and within human services? And then finally, really try to organize it around that objective level of the plan. Right, so I think that was also very intentional. That's not at the level of the particular strategies, lower than those high-level goals, but those kind of outcomes that have been developed, objectives that have been identified as part of sort of Raise Up Oregon. So I wasn't planning to sort of walk you through this. We could come back at a further council if people wanted to delve in deeper. But just give you a sort of sense of the sort of library. And I think we started calling it a library because, I think to do all those things, this is not the 3 measures, right, or 5 measures. I didn't do a count, which I should have. It's a lot of measures, right? So I think, so I think that's why we started referring it to as the sort of Raise Up Oregon Measures Library. So I think there's also going to be additional work as we think about actually gathering and collecting the data and operationalizing it, how to actually make it a useful tool for all of you, which I think may mean that, when we do sort of like an annual review, making some decisions about where we want to do a deep dive or what really seems to be sort of rising at the top. Because I don't think it's going to provide that, here's 6 things that we sort of look at and that provides all the answers. So we are also still in the process of doing some additional work, thanks to Alicia. I'm going through these actual measures, I think, pretty quickly, but I don't know. I think that's something we can kind of come back to at another point and do a little bit more detailed dive into the actual measures. So I just wanted to give you a sort of sense of the approach before we actually got into the measures. What I would say is all of these have existing data sources. As you can just see through the list, they include all of the different agency partners. They have different levels of periodicity. We've tried to make sure, as best as possible, that all of the data sources can be broken down by racial and ethnic and other demographic categories. So that's additional analysis that we've been doing, and when we're able to actually start gathering the data, we present that in that form. But you can see basically sort of the alignment and for each of the objectives and the data sources. And then for each of them, what we're also in the process of developing is a more in-depth information about what's the data source, what's the definition, what's the research basis for why this was included, but also, and I think this is also really important, what was the sort of policy discussion and rationale for inclusion, because I think one of the things I've learned by mistake from previous work on data and data measurement, it's not simply about having the world's greatest data set, it's about having a shared understanding about why things were selected, and over the course of more than a year, some really thoughtful, rich conversations that came out of that committee, and so we're doing our best to actually trying to document what those discussions were, because I think that's really important for having any purchase after, what after that process is. So with that, I will actually hand it over and provide some actual data.
Okay, great, thank you. So, I'm going to wait for our. Perfect, thank you. Just to give you, so while the Measuring Success Committee was happening, sort of in parallel to that work, or we started a little bit later, the state received a preschool development grant, and as part of that, the federal agency wanted to have a strengths and needs assessment done in the state. And so we... not
Will you
moving.
just introduce?
Yes, we'll start there. My name is Catherine Pears. I'm a senior research scientist at the Oregon Social Learning Center in Eugene. I do a lot of work with kindergarten transition and early learning. My colleague is Alicia Miao, who is working with us in Eugene and actually spent last year on a postdoctoral fellowship with the ELD. Alicia is one of the best methodologists and data people that I know, and without her, we couldn't have put together the large data sets that we'll be talking about. Do you want to say anything else about yourself?
That's pretty nice.
Okay.
I'll just leave it at that.
Yes.
Before you jump into this, you used a lot of acronyms. What are the main data tools that you are talking about, assessment tools that you're talking about?
I'll talk about them as we go through. What we ended up doing, and in fact, if you'll bear with me for just a little bit, because we will talk about them, let me sort of explain the foundation of what we were doing, and then I think it will become clearer. If it doesn't, stop me again.
So the last slide, though.
I think that was on that. Yeah, so it's really a variety of existing data sets.
I was going to say you referenced a couple different things.
Yeah, and for the library, it's basically, what we did is we basically did a survey of what's the existing data in Oregon. So it's a variety of sometimes administrative data from agencies. We ended up relying pretty heavily on what's called the PRAM survey, and I'm going to forget how to do the pregnancy risk assessment. Thank you. Which is a survey that comes out of public health. Because for some of these questions, the best thing to do is actually ask parents. So that ended up being a major data source. So I would say if you looked at the whole library, there's probably 20 different data sources across the whole library.
So what's a little confusing is that, like you were talking about the child behavior rating scale, the last one as being, but all of them are not, so I'm interested in what's the validity of all of them. Like you talked about wide usage of one of many. And they're not the same in terms of the quality of the assessment tool themselves. And so are you going to talk, so it's like that we got a snapshot of a partial thing and I think the assessment tool really matters in terms of the inferences we can make on the data itself.
Yeah, and I think that, yes, and the final slide was an example of work that's in progress to document that for every single one of the measures.
Okay, so
my
you're
apologies for not
moving in that
So that's
direction.
part of the work that's in process, is to actually have all that information in a form of which that allow people to look at that in more depth. So my apologies for not making that clearer.
I just wanted to say that part of what David was talking about with documenting the policy rationales is tied into this piece. Because the Measuring Success Committee really had these deep discussions about various measures, the pros and cons of each, why some measures might be more applicable to the Raise Up Oregon objective and strategy that they were really targeted to support. So it's a much longer conversation about the validity, and I definitely hear what you're saying. It's super important.
Okay, thank you.
Well, and I saw a place go by on that last place where data limitations looks like could be called out. So for instance, I saw one measure of ours where race ethnicity comes out of Medicaid data, which is terribly unreliable because of the high refusal rate. And so you could note that kind of thing in a spot like that.
Yeah,
Is that the thought? Okay.
Yeah, and I think the honest answer is every single data measure we have is less than what we would ultimately hope for. So I think part of our goal is also just to be clear about what you can and can't do with the data. So, but again, as I should have made clear, that's sort of part of what we're in the process of trying to sort of document.
So David or Catherine, will one of you sort of do the bridge between what you just presented, David, with the library and what we're going to hear from Catherine? So what's the connection, alignment, whatever?
So as I was saying in the beginning, these were sort of two separate but processes that were happening together, and there was an effort to sort of coordinate. So part of what we did for today's presentation is pull out data from the PDG needs assessment that sort of matches up with what's in the library. There were a couple places where the measurement's a little bit different from what ended up being in PDG for various reasons. So this is basically an effort to give you a little bit of sort of first taste of, if you start to look at the data, what are we seeing about how children and families are doing in Oregon. So it's an effort to give you sort of a window, if we actually had the Measuring Success Library populated with data at this point, what are some of the things that you would start to see?
Okay.
Thank you.
Yes, thank you.
Catherine, back to you.
So I was all proud of having my little clicker, and it's not clicking. Yeah, do you mind? So the preschool development grant was granted by the federal government, and so as part of the requirements of that grant, the state needed to do a strength and needs assessment. And so sort of understanding the overlap, why doesn't this overlap with the Measuring Success Committee? There were certain things that the federal government required to have in here for information that are, that we needed to get for them. But it is very close, and as David said, when we get into the actual data, we'll show you where the overlap is. We were really tasked with finding out about it's a current snapshot. So as of 2019, what is the reach and quality of the current programs that are available to families birth to age 5 in Oregon, and particularly with a lens on the most historically underserved populations, as well as also understanding not only what the programs are, but what the current workforce to serve those programs looks like. So in terms of education, demographics, and also in terms of what they're receiving for professional development. And with the idea that this should become a tool that could then inform both local and statewide planning. It will inform the upcoming, or the preschool development grant that we're now in, as well as we wanted it to be useful to other localities. So the folks that participated in this were Ann Morrison here at the ELD, my colleague Beth Green, who was also, I don't know if you caught it, but she was on the Measuring Success Committee. I represent OSLC down in Eugene. And then there was also, again, in that spirit of cross-sector involvement, there were work groups that we went out and got information from in order to inform what we were doing. So we had an agency work group that was made up of state agency heads, the community work group, which had membership from both agencies, from foundations, from programs that served a variety of communities. And then we have what a subgroup of that was the Family Voice Work Group, which were folks who were able to provide information about specifically underserved populations. And really our approach here has been to build on existing data wherever there was already, as David said, data extant that we could pull. We did, and this again took a very cross-sector approach, in that we needed to call HOA and we needed to call various divisions to send us their data, which they did, bless them. But we also knew that we were going to need to get some new data, because there are areas where we just don't know necessarily what's happening. So in the spring and summer of last year, we fielded a provider survey, which went out to providers in child care centers, home-based providers, directors of those centers, to really get an idea about who those folks were and what they were doing in terms of professional development, what they were doing in terms of curricula in their programs, and a really broad-based view. And then we're just finishing up now a household survey that went out to families across the state to ask them about their child care experiences and what they know about availability of child care, how they make decisions about child care. And in order to really make sure that we are getting all family voices in there, we have also incorporated family listening sessions where we've gone out and reached out to communities, tribal communities, communities of color, communities of recent immigrants, parents of children with differing abilities, parents, incarcerated parents, a variety of groups of people who might not be reachable on the phone or might not usually participate in a survey. We've had these family listening sessions that we've done for community agencies across the state. And that is part of this equity lens, that what we're trying to do is elevate the needs of and voices of all children, so that even those who don't necessarily get caught in these data nets or respond to the surveys, we're going to hear from them. And last but not least, really with the idea that we want to make this useful. That it's not, we don't want this to be something that sits on the shelf. Oh yeah, they did it, it's really exciting, isn't it pretty, bye. We want this to be something that can serve as a framework that could match or sort of dovetail into the measuring success ideas and become something that can be updated and is sustainable and ongoing. And you'll see, I'll show you in just a minute, one of the products. Yes?
Could I just ask one question on the getting the family listening sessions and so on? Was one of the groups rural? Did you specifically cut down?
Yes, there were a number of rural groups, and then within that rural groups, maybe families who tend to be migrant. Yes, there's a very large range there. And we'll have that information out by the end of next month in a series of listening briefs. So that will be available.
Oh, great.
Can I
yes,
ask a quick
ma'am.
question? Do you feel like you had adequate participation from like a sample size standpoint that you, across all of the different, I mean, the rural areas are quite large and varied. And so you collected things from all the different sort of hub-esque areas, and you had good participation in each?
Yeah, I was really, I mean, being a researcher, right, I send something out and I go, oh, what's our response rate? We got a very good response rate on the provider survey, and when we looked at the breadth of representation, it's really quite remarkable. I wouldn't have necessarily expected it, but it is in the entire state, and it is smaller, smaller home care places out in the rural areas as well as very large centers. So I was pleased and a bit surprised that we got as much response. So the way we've sort of broken this down for you is David had, he had broken things down is into system goals, those big long-term goals, and then the intermediate goals. And so what I want to talk about is what we know about those big system goals at the moment, with the idea that we'll then look at some of those intermediate goals coming up. And so what we did as an approach to be able to make the data, again, useful to folks, is that we looked at data and then we put it onto these, what we call static maps. And the maps indicate, as you'll see, there's a legend over here that gives you sort of a range. And these are quartiles, and we broke the data down into quartiles. You'll see the lowest corresponding to this really light color and the highest corresponding to the darker color. The things to sort of think about as we flip through the data here, and it'll start to go fast, is that with each quartile you're going to begin at a new spot. That may be 0. In this case, for the approaches to learning, it's not. And that the top spot is not always 100. Sometimes it's below 100, sometimes it is 100, but those vary. Really, again, what this gives you is sort of an idea of relative to each other, what do the counties look like across Oregon in terms of any given measure.
So 46.8% of what?
Right, and I will tell you,
Okay,
sorry,
all right.
each of these. It's a good point.
And what's OKA?
In this case, it's the OKA, but it is whatever the measurement source is, and I will let you know. In this case, it's OKA, and it's the number of students who met according to ODE.
Everybody knows.
The Oregon Kindergarten Assessment.
Okay, great.
That is given to kindergartners in the fall of every year by the state. And in this particular case, it's a number of children who meet according to ODE's interpretive guidance, who are demonstrating competence on approaches to learning. And approaches to learning encompasses both social skills and self-regulatory skills.
The highest was 46.8%.
Yes, ma'am. So, again, when you're looking at a map of this, and I'm going to flip through quite a few, maybe not all of them today, but to sort of orient you to to what they look like, yes, this is the quartiles are going to vary. I also want to point out before we jump into this more is that quartiles vary, but then depending on the size of a county, right, whether it's rural, whether it's urban, more urban, the percentage of children really do mean different absolute numbers. So here we have several counties that have about the same sorts of percentages in terms of kids who are meeting the benchmark for ATL, but who we're talking about different numbers of children. Yes, ma'am.
So there were big issues around the data collection of the assessment tool itself. Have those been corrected, or because I feel like those numbers don't mean a lot to me if they haven't improved how they're collecting the information to begin with?
Is it collecting or administering the OKA?
It was administering, but the observation, I mean, there were issues from an equity standpoint in terms of language and sort of racial bias. Like, none of those were factored in initially. There was not training on the people administering them. So I asked that question because it's really hard to take seriously the numbers if they have not improved the administration of that tool, particularly this piece around approaches to learning. And it's not clear to me. I'm asking the question. I haven't engaged in it in a few years. I'm like, why are you looking at me?
I'm like, yeah, I think that I would want to make sure that we could bring somebody from ODE and the assessment team to be able to talk about what has happened to improve kind of administration. I do think I want to underscore your point as well around the limitations right now of this data and even what we're looking at, especially for emergent bilingual children. So that is definitely, I think, we have researchers here, but I would say, take these some of this data and interpret with caution because of that's at least a quarter of the children in the state. And certainly more in certain communities as we think about this math. So I think what I'm hearing is we should get an update and at some point from what have been the supports since the initial rollout and over time around administration. Second, I think just note that myself, Colt, Deputy Director Rubina at ODE, and other stakeholders are also talking about those issues around OKA for emergent bilingual children, as well as other, like looking at the instruments themselves and looking at some of these other issues.
Mariam, this is Candace.
You want to jump in, Candace? Right.
Hi, Candace.
Yeah, so I was going to say, it's also important about the administration, and we're kind of mentioning that, there's some limitations that are really critical when we talk about the design of the kindergarten assessment as it is, and then implementing and what educators can really grasp on that to push forward. And so there's a lot we need to consider when using that as a metric for improvement, because I think there's high variability, and always what we're looking at is not always what's coming out of that assessment. Right? And so it's both the administration of that, but also the support. And all the things that you mentioned about language acquisition, about family support, students of color, students who speak the language other than English, none of that is accounted for and controlled in that assessment.
Should I assume that it's the data validity issues that Kili raises and the small sample size that explain what looks like a really atypical geographic pattern to this data?
Can I address a larger issue beforehand? Because I think that so I totally agree. There are always questions, and particularly I know that there has been a lot of very valid concerns about the OKA data. In this, for what we were doing as the PDG needs assessment, and as David said, we all would love more valid measures, and there are concerns about it. I would say that, one of the things that pulling together cross-sector data has allowed us to do is to not necessarily have to rely on one measure and to be able to look at things. So I'm giving you sort of a false view here of the breadth of data that we were able to collect in terms of we've pulled out some things right here to say, okay, these are the kinds of things that we did, but there are a great many indicators in the actual report that go beyond, say, just reliance on the OKA. And in fact, we were able to put some indicators together to look at child well-being that then build on the strengths of all the indicators. As a researcher, I would never rely on just one data point to tell me anything. So, I mean, just with that in mind as we go forward, because there are definitely difficulties in all of these particular pieces of measures. None of them are perfect.
Respectfully, though,
Yeah.
like this goes beyond sort of perfection when you don't have inter-rater reliability on the data collection.
Right.
Like that is a very pivotal piece, and I guess the bias piece, cultural bias piece in particular, is a issue for me. And yes, no tool is perfect. Yes, there are validity issues, but this is a little different in terms of some basic infrastructure, and that's why I was hoping that there had been improvement on that, because it was an issue in the beginning, but I think it has been called out. And so my curiosity was around, what has been done over the last few years to sort of rectify that issue.
Right. And I can't speak to that exactly. I will say that for this particular measure, and one of the reasons we decided to present it, is this isn't administered to the child. This is teacher report. So
yeah, exactly.
It could have
observation based on their
right.
perception.
It could have implicit bias in it for sure, and probably does. But the inter-rater, it isn't. They didn't need to be. Yeah.
So what year is this based on?
This is this past year. 2018. 2018. The data that were available.
Okay. So figuring out what has happened to the OKA since 16 or whenever it started to 18 would be helpful to know, because you're right. Lots of concerns have been raised.
Yeah.
Okay,
absolutely.
so to some extent, sort of the relativity, I guess.
Would it be worth showing some of the other types
Yeah,
of data?
I think if we could look at kinds of the other things that we have available, just to
Sure.
give you a sense.
One more.
So that was one example of a data point for System Goal 1. We have a couple of others, 3 others, that aligned with some of the objectives under System Goal 2, or excuse me, some of the long-term measures identified by the Measuring Success Committee that are in support of System Goal 2 long-term, so children raised in healthy, stable, and attached families. And so 3 that we're going to show you or share with you from the Preschool Development Grant are children under 6 in poverty, food insecurity, and severe rent burden. So Remy, good. So this, as Catherine mentioned, there's a legend on the left-hand side showing the quartiles. Oh, I see. So, again, this is children under 6 living in poverty, and the source is the U.S. Census Bureau's American Community Survey. They release updates annually, and this is at the level of the child. So the American Community Survey has different types of estimates. This is an estimate of the 5 years, 2017 through 2013, which tends to be an estimate. The reason why we use this is because it's more stable over time, but that it also comes with it a number of course, an inability to capture certain variation that happens. But the reason why we chose this estimate is because it does give us a snapshot of what's happening in rural counties, which is not available in the smaller one-year estimates because the numbers are so small. And so for this particular data point, we can see that overall as a state, there are over 58,000 children in Oregon living below the federal poverty level. That's about 22% of our children. Compared to the national estimate, we're a little bit higher. The national estimate is around 19%. And these are the ranges. So some of these colored counties here in the lower quartiles, from 12.5% to 20% of the children living in those counties are living in poverty. Whereas in this darker quartile, over a third, and up to just under 50% of children are living in poverty.
I presume the color for Sherman and Gillum is that the size is suppressed because it's too small.
That's exactly what I was just going to say next. Thank you so much for bringing that up, yes. And so even though we do have this 5-year estimate that's more stable and it gives us some of this other data in these rural and frontier areas, yes, it's too small to show up there. And so that's not available, unfortunately. And then we did look at this census data for each ethnic and racial group that's provided by the census. And so what we're looking at here is for all children under 6 years old within each racial or ethnic group that the census provides, the percentage of children who are living in poverty. So out of all of the children who are under 6 years old, who are African American and Black in Oregon, 44.7% are living in poverty. And for all children under 6 who are Asian, and this is the census's categorization of Asian, 15.8% of those children in Oregon are living in poverty. Another area that Measuring Success identified is food security. For the preschool development grant, we were able to get food insecurity from MAP the Meal Gap, which is a nationwide effort that relies on USDA, current population survey, and census data to look at food insecurity across the nation. They also map it for each county across the nation. It's released annually, and it's for children under 18. This is where the measure is a little bit different from what we have for measuring success, because this is not able to be broken down by racial and ethnic groups. And so that's something to work on moving forward, I would say, for measuring success, when David pointed out that there's still work to be done. But this can give you an idea of what we're looking at in terms of food insecurity in the state for 2017. And so you'll see that we have some higher, 22.8 to 24.1% of children under 18 living or experiencing food insecurity, living in food insecure households.
Is the county level data based on direct data or is it imputed data?
So this data from MAP the Meal Gap comes from many sources, and the current population survey has a really in-depth interview that they do with families, and they ask about things like they ask about amounts of money spent on food, they ask about amounts of money coming in. It's direct.
Yeah, so what I'm getting at is, for instance, I know in the case of unemployment data, which is survey data, they don't survey enough people in each county in Oregon to actually do a rate, so they take each county and map it to what's its county like nationwide and project a number onto the county based on that. Is this that kind of, given that it's nationwide survey data, for instance, they've got a number for Sherman County, that seems almost impossible.
You were saying it's from the current, they derive in part from current population survey, which probably gets you at the county level.
Yeah.
Okay.
It's census data.
Yeah, so it's not a, it does rely on census data. It's not data that's taken, I think this is.
So the nationwide survey would have to be several tens of thousands of people?
Yeah. Yes.
Okay.
Yes.
All right.
Yeah.
If we can just go back to the slide before real quick. Do you have like the N for all of those? I think this highlights to me disproportionality, but it doesn't give me numbers. So even though like the white non-Hispanic is 16.6%, my guess is just given the racial demographics of the state, that's still a lot of kids.
Yeah.
So it would be helpful. I like seeing the disproportionality, and I'm actually really grateful that you separated Pacific Islander from Asian, because they're sometimes lumped and it's clearly very different. But I would love to know the raw number for for each, if possible?
Yeah, I don't have the raw numbers
Okay.
on me, but we could definitely.
I think that would be helpful
get
to
into
see like how many
that.
kids, because
Yeah. I have percentages, just kind of like the overall, so like, the overall of all of the children living in poverty, rather than within each group, 5% of all children living in poverty are African American or Black. I have those types of percentages.
yeah, but I mean that number is probably like 1,000 compared to
Yes.
40,000 white kids. I mean, I think it is important to understand
The relative.
like the number of kids we're talking about.
For sure.
Okay, we
Thank
need
you.
to roll through this.
Sorry.
No, good questions, and we'll just take time out of the next
Do
item.
you want to give us an amount of time? And then, because I think they'll just help them of
Yeah.
how much time left.
Well, how much time is left according to the agenda is,
Are we over?
yeah,
Okay.
-7 minutes. Just for a time check. So, we just need to,
Let's
yeah,
go.
go through this a little bit.
Let me talk about one more, just to give you, because we've looked at a wide variety of data. This sort of gets to health questions in terms of, and again, this is under goal 1, right? And the objectives for the Raise Up Oregon. This gets to the young children with social, emotional, developmental, and healthcare needs are identified early and supported to reach their full potential. So this came from the CCNOs, the Oregon Health Authority, and the census. And that data updates by request and annually, so this is pretty current, and the level of the data then is child. So how many children who are receiving Medicaid? So these kids then are at 185% of the poverty level. How many of these children have then received developmental screening in the past year? Higher is going to be better because that means that more children are receiving these screenings. And as you can see, there's some counties here. The happy news is that there are some counties here who are quite high, and some counties that are not.
So the incentive metric we've been using is screening by age 2. And I'm curious why it's within the last 12 months at age 7, because in theory, 0 would be the right number.
Right, exactly. Because they should have, exactly.
And this is one of those places where the measure that we were able to obtain doesn't line up with the incentive metric that you're talking about, which was identified by the Measuring Success Committee.
But would you be able to obtain the incentive measure that we're already tracking and paying based on?
Which he hasn't.
We do have that metric.
We could have been unable to attain it at the point at which this was being put together.
Been a metric for 6 years.
Yeah, but we weren't always able to actually get it from the agencies, or it could have been that we were looking to divide it by race and ethnicity. That is a good question, and I can find out the answer for you.
Yeah, race ethnicity would be completely unreliable, and
Yeah.
we've actually suspended reporting based on race ethnicity because the data is so bad.
Wow. That's a really good question, and we can find that out. And the Medicators question?
Yeah, we'll look on that.
Okay, yeah, getting back on that. would
Okay.
be
Do you want to just
helpful.
end with?
So what I
discussion?
wanted to end was just talk about the interactive map.
Yeah.
Okay.
So you're seeing here are static maps. The exciting thing, or we think it's exciting that is going to come out of this, is that we were able to contract with some folks who are going to make the data into interactive maps. So what you will be able to do is to look at, say, any county, bring up a map. If you wanted to find out the number of children receiving Medicaid in a county, you could do that in real time. The nice thing is that then you can overlay a number of things on it, including demographics, including how many kids are, if you wanted to know, say, how many kids are under 5 in a given county and how many childcare slots are available. That will be possible so that you can get the interplay between those two numbers. And that will be available at the county level, when possible at the census tract level and at the district level, so that you can see the catchment areas for the different schools. That map also will allow people to extract information and make a scatter plot out of it. So again, if you wanted to know the relative number of children under 5 in an area and then the number of available childcare slots, you could see that plotted on a plot, and then you can highlight each of those dots and find out where that is. So again, that will map back to a particular county, a particular census tract, a particular school district, which will again allow folks in terms of planning to understand where they are in the universe and also figure out your exemplars. So you can think about, okay, people that are doing a given thing particularly well or have an adequate number of slots, what is it that they're doing? And so that should be up and running by the end of February. And will be available. I don't know if it'll be available completely publicly, but it will be done. And yeah,
So
sorry.
what are the data points in that you can click on?
The data points will be what is included in the PDG needs, strengths and needs assessment. So we're giving you a very small slice here. There are a range of risk and resilience factors from the numbers of years of education in center personnel through developmental screenings, through immunization, through prenatal care. There's a wide range. And that data will all be put into this map so that you can, again, look at it either this way, go to a county and find out, say, what the average number of childcare slots are, or you can do a scatter plot where you take different pieces of information and put them together so that you can, again, see of the counties in Oregon, let's say, what do they look like in terms of ratio of children under 5 to childcare availability.
And how are you going to keep that current?
That is a question.
This is already 2 years old, right?
Mm-hmm.
So of what value, especially on childcare slots or something like that? I'm just not sure how that works.
Childcare slots is yearly data, actually, because that's gathered by the OSU.
Because we have that data.
Yeah, we have that data. Some of, it will provide, we hope, what it will do is allow folks to do some planning and some ability to get snapshots. I mean, any data, unless we collect it internally right at the moment, I mean, the ACS data and that kind of data, it is bound by those age limitations sometimes. But it will provide, we hope that the most up-to-date data that are available will be in that map and will allow people to get snapshots to really look at relative position, and then you can see how you move over time.
Okay, Anne?
Can I just, are you working with the Oregon Explorer to get these kinds of data? What's the relationship between this and all of the data in the Oregon Explorer at OSU?
The Oregon Child Integrated Data Set?
No, the Oregon Community Explorer that's been building these data systems at OSU for 20-some years.
We're working directly with them.
So do you get the data
So
from
we got
them?
the data from them, yes.
I
The
see.
data that are available in that set of factors that they track are all in here. Yes.
I see. So you pulled from them.
Yes.
For some of the basic
Right.
data, and then you're adding in some other ones that are really important
Exactly.
for this. Like,
Yes.
say, childcare slots,
Right.
I'm
Right.
assuming they probably
Right.
So you
do.
could actually,
They have
so you
that,
could basically
yes.
take their data and see exactly where the childcare facilities are in the state overlaid on that data is one way to think about it.
Okay, so you sort of started from that and are adding to it.
Thank you, that's a very good way to explain
Okay,
it. So
very good,
this
that's
will
helpful.
build upon what has existed already.
Yeah, that's helpful. Thank you.
Any other questions of Catherine and Alicia? Okay, beginning point for future conversations, I'm sure. Thank you. We appreciate you. And several things to follow up on, obviously. All right. So we, it's 11:30. Public testimony needs to start in 10 minutes. I think we want to stay on that timeline. So David, shall we start the committee conversation, sort of the high level, and then we'll see how much more time we need after the public testimony. Remy, how many people have signed up to speak?
Right now we have 2.
2. Okay.
I haven't collected the sheet.
Okay.
And there may be others on the phone, I don't know. If they are, I hope we can hear them better.
And I need to go spend the afternoon arguing about my budget, so I'm going to slip out.
Okay, thank you, Pat.
Good luck.
Thanks.
Yeah, thanks a lot. Good luck to you. So in our packets, as you know, there is a document that presents some suggested principles for committees that the council may want to consider for the future. And the agenda today isn't to start deciding what committees do we think we should have or want to have. So it's really trying to establish the foundation on which we would make those decisions in the future. And this certainly ties in with the RUAC, the Raise Up, or our strategic plan. The agency implementation team is discussing this also, and is going to be presenting some suggestions and ideas for us at our April meeting. And that's obviously, as you remember, they're the ones who did the gallery walk for us at our retreat. And so that's a cross-sector team that is figuring out from each of the agency's perspectives what kind of cross-sector committees would be of value to them from the council, tying into the council. So as you look at these principles.
Can I add just one very fast note? It was really,
you don't have to be fast.
that conversation sort of, we had a chance to sort of begin that conversation with that group, and it was wonderful listening to the morning conversation around priorities, because the conversation seemed to be completely aligned. So I think a couple of things that started to percolate out is there's all of these sort of state sponsored efforts to sort of help with regional planning, but the state-sponsored efforts are not coordinated, so we need to think about how to coordinate that coordination. There was the same conversation about, there's these these workforce issues across sectors and agencies that everyone is struggling with. So just wanted to say that it was very exciting to hear this morning conversation.
Okay, so we aren't in left field and they're in right field. Good, that would be nice. Very nice alignment. So as you look at this document and the suggested principles, I think in light of our time, what I would ask is, are there any of these principles you disagree with and you think they're sort of off base as far as what we would want to see as foundations for our committees? Are there principles that are missing from this list that you think we should consider adding to this? And I know every one of us has been on a multitude of committees, whether they're standing, ad hoc, task forces, work groups, et cetera. So we all have lots of experience on what's effective, what works, what do you want to show up for, and which are those that you wish you hadn't said yes to. So just trying to get a sense as we launch this and to give any feedback back to the agency implementation team as far as where the council's coming from and sort of what we're hoping to get out of committees that we would want to appoint and work with. And any principles that you think are super important or not important. Are you not finding this, Kelly?
It's a memo, right?
Yeah, I see it now.
Yeah, we're going to figure out a better way in the future to try to identify where things are in these packets.
So Sue, I read this over. My preference is not to spend a long time on governance issues, if possible. And I think these principles make sense. We've discussed a lot of these different ideas already. I'm ready to make a motion if you need a motion.
Okay, thank you, Peter. Let's go ahead and put a motion on the table, and then we'll discuss the motion.
I move the committee adopt principles as proposed in the packet provided to the Early Learning Council dated January 16th, 2020.
All right, is there a second for that? And then we'll have discussion.
Second.
Thank you. All right, discussion. Anne, did you have a comment? Or you were going to? Yes.
No, right now, we're just talking about the principals, we're not talking about the committees themselves.
Exactly.
Okay, I do not have a comment.
Okay. I think the first one that's listed here, these are not in priority order by any means, but I think the cross-sector piece is one that we've been pretty intentional about even in the past. And it's going to be more so as we look to our future, recognizing and really focusing on the fact that we're building a system. This is not an early learning division effort, it's that system building. So this will lay the basis then for sort of how we look at committees and what committees we might want in the future. But one of the principles here that's really important to keep in mind is that, as we all know, for committees to be successful, it requires staff support. And so we'll need to be very attuned to that as we look at, in April, at potential committees and who has the capacity to staff those. So we'll probably have to do sort of the exercise we did this morning as far as priorities go, and say what committees are going to align with the priorities that we've set, and then try to integrate those conversations. So I'm looking both at David and Carrie as we look ahead to the April agenda. Any other discussion about the committees, the motion on the table? If not, those in favor say aye.
Aye.
The only thing I would have added is if we do get updates from those committees on work that they've done or the direction that things are going in, and if those are done whether in this format or in the updating piece that we get before meetings at times, that would be good.
Okay. Yes. That would be an excellent principle if that's not embedded.
No, yeah, and I'm more in the communication systems alignment part of it for us just to be on the same page.
Yes. No, really good point, George. So let's embed that in here, and we'll assume that who made Peter, the motion maker, and the second, and Ann agree that that's a great addition to these principles. Okay, thumbs up. So all those in favor with that amendment say aye. Aye. Opposed? Motion carries. We'll assume the phone is happy too. Okay, great. Thank you all very much. That was a quick conversation. And George, thanks. That's a great addition. I think both for the council to be updated and so the committees know that we're getting updated. We care about what they're doing, so both ways. Let's go then to, actually we're a few minutes early, but let's go to the public testimony part of our agenda. We always appreciate people joining us at our council meetings, so thank you for being here. And we will look forward to the input that we're going to hear. So let's start with Sierra Pryor, who's representing the Oregon Coalition of Local Health Officials. So welcome, Sierra.
Hi, my name is Sierra Pryor. I actually thought that was just a regular sign-in, but I will take this opportunity.
That's so funny.
Yeah.
I did it multiple times before.
So as was just said, I'm with the Oregon Coalition of Local Health Officials. Our members are the local public health authorities across Oregon. And the one thing that I will share is that we had a convening of public health administrators from across the state back in September. And Terry Talhofer, who's the administrator for North Central Public Health District, was there, and she presented to everyone in the coalition, Raise Up Oregon, and we looked at different ways in which there's alignment between public health work and then also the objectives and strategies of the plan in Raise Up Oregon. And so for that reason, the Oregon Coalition of Local Health Officials is hoping to stay up to speed on the work of the Early Learning Council, and you can expect to have our presence at meetings in the future. Thank you.
Great. Thanks. Wow. That's great news, Sierra. Thank you for being here, and say hi to Terry for all of us, too.
Will do.
Thanks. Autumn has signed up from AFSCME, Autumn David. And then following Autumn will be Carissa Palmer from Albina Head Start. Sure. Come on up. Hi, Autumn, welcome.
Hello. Okay, I've got, I have two things that I'm going to go over, but my name's Autumn David. I'm the president for AFSCME Local 132, and I'm a certified 5-star preschool promise provider in Northeast Salem. I've been in business for 23 years. I'm here on behalf of our family child care providers that we represent. I have many providers reach out to me about preschool promise rules. I know some of them have sent in electronic testimony also. Many of the rules have been confusing language, and we had to shuffle through and guess the intent on some. I think it's hard to understand without being given the opportunity for questions and answers from the division. I called on January 21st to give public comment on behalf of myself and other providers that reached out to me. At that time, I had not reread House Bill 2013 and 2025. The concern was about the requirement for the bachelor's degree in a step 10 being equivalent, as that is what we fought for in House Bill 2013. When I spoke about the rules, the 414-470-0040, 5C, I think it is, I didn't know it covered this until I reread the House Bill 2013. I'd been out of the country for a month, so I was trying to catch up when these rules came out, so trying to catch up and stuff. I found out that it was close to the same language that was proposed on the revision, the rules for the January 16th. After knowing this, we understood where this came from, and we were okay with it. I also spoke about Rule 5D and asked the paragraph get striked out as it's no longer relevant since House Bill 2013 passed, and I asked for it to be taken. It was taken out of House Bill 2013. The Rule 5C, II and III made sense at that time, so until the revision that came out on January 28th, I worked with Sarah to revise III, but we still feel that it's not representing family child care in a fair manner. The first proposed rule on the 16th was the providers to have a CDA or equivalent, which is a step 7 according to ORO. On January 28th, it was proposed to have only a CDA until the division could work on it and add language. The division would partner with Teaching Standards and Practices Commission and Educator Advancement Council. On January 29th, after talking with Sarah, they proposed that it would be a CDA or at least a step 8, but partner with the Educator Advancement Council. We feel that the TSPC and the EAC is not best entities to represent family child care. Our goal after the first draft of January 16th and re-looking at House Bill 2013 and 2025 was to strike out all of D and not have any changes to I or I don't know how to do that. The recommendation that we are giving is to leave the language, so there's two recommendations. Either leave the language the same as January 16th proposed rules, striking 5D and adding or to the end of I. And then if we keep the language from the 29th, then the 29th is the email between, so you guys I don't think have that. So it was an email between Sarah and I. If we keep that language to add in that family child care is in the work group to basically look at what the standard will be. Because right now it was just the Educator Advancement Council. And so we want to make sure that family child care is in that conversation. And then, so that's our recommendations for that, is just striking out 5D, and I think they did that on the revision, and then adding or, which they did, but either keeping the language from the 16th, or if we keep the language from the 29th, adding that family child care will be in that work group. The other thing I wanted to talk about was speaking about the contracts and moving them to subcontracting with the ELD. From the very beginning of Preschool Promise 4 years ago, I didn't understand why this wasn't done in the first place. After talking with providers around the state and the discrepancies between each program, I learned was huge between all the different hubs, the different entities. The providers were just really hard understanding, and there was a lot of discrepancy between them. And so by everybody contracting out. The budget was never right from the beginning. I always voiced my opinion on that, and whoever I talked to, I was like, come look at my budget. It's not right. It was never right. So hopefully that's going to be taken care of. I will open my books to anybody if they want to see it, to understand that it's not right. And family child care has never been at the table for that. I personally like my hub. I feel really supported, but some providers don't feel the same. And like I said, we're representing all the providers, not just my own opinion. But by subcontracting with the ELD directly, it will allow providers to have more dollars in their program that will support the needs of the children in the care. We're optimistic that the ELD will continue funding much needed support and connections the hubs have given us. I feel that by having one entity for all the providers to go through will help with more consistency of running the program and the dollars that are being spent.
Okay. Thank you, Autumn. Council members, just in case you had a hard time tracking the 5 I's, I, and I. When we get to that point on the agenda, there is a handout, and Miriam and Gwen will take us through that. So they've been talking with Autumn, so they know how all of that adds up, and we'll have this to look at. So, thank you.
Is that different than what's in here?
Yeah, this is hot off the press this
There's
morning.
a recommendation. So, yeah, thank you, Autumn. We've been considering the input that the testimony, so we've been working with Autumn and appreciate that. So we have some recommendations on how to address the changes that Autumn was just talking about when we get to that part of the agenda.
Right, staff had a conference call, or not sure what it was exactly, yesterday with some providers, just to continue gathering input on the preschool promise rules. So we'll get updated on that this afternoon when we start reviewing those and adopting them. Thanks, Autumn. Okay, Carissa, welcome.
Thank you.
From Albina Head Start, nice to see you. Thanks for being here.
Likewise. Good morning. We know we can learn. We know we are smart. Excellence is our purpose. We are proud of ourselves, our families, and our communities. This is the Albina Head Start Pledge of Excellence that is expressed from nearly 600 children daily, while preschool teachers work hard providing high quality and comprehensive services to children and families within rich learning environments. My name is Carissa Palmer, and I appreciate your time this morning as I share a little bit about my experience obtaining my AA in early childhood education, as well as my BS in social science, as well as some of the innovative programs and trainings that we have within Albina Head Start. Albina Head Start is a multifaceted program that includes several models of high-quality service to children and families within Portland: prenatal, home-based, center-based, serving children and families with children of 6 weeks to 5 years old. And that would be families whose incomes are at or below income guidelines. This is our target population. Our preschool teachers and education staff are highly trained, analyze classroom data, and use it to improve mastery skill throughout individualizing and careful lesson planning. They use literacy-based curriculum, health, nutrition, social, emotional, multicultural, STEM, reading, and Mandarin lessons as a platform for instruction and teaching. Many of our children leave Albina Head Start knowing how to read and have advanced learning levels. In the area of cognition and general knowledge, out of 300, almost 400 students, about 90% of those students graduated with advanced learning levels within Albina Head Start. That would include levels of math and science. Language and literacy, about 92% graduated at advanced learning levels. Most of these outcomes were obtained attained with preschool teachers who hold an associate's degree in early childhood education, or have a child development associate, a CDA, and or a center training associate graduate. Albina's self-sustaining training programs have graduated many high-quality teachers that do not have a BA. In addition, Albina has multiple Oregon Center for Career Development master trainers and have more that are coming up through the training process. Along with the associate degree in early childhood education and internal training model, this system should be replicated in other ECE programs and be considered in place of a BA mandate on preschool teachers. While the research generally concludes that more education is better, the research does not indicate how much formal education teachers should have in order to achieve high-quality learning environments. Calderon, 2005.
Calderon. I know a Calderon.
Is that you?
I'm sitting next to one.
The expectation of obtaining a bachelor degree presents additional challenges for skillful but marginalized minority, language, and low-income ECE professionals, preschool classrooms, resulting in increased turnover and skilled preschool teachers leaving the field. Albina serves the highest number of diverse families of color within the state of Oregon. We take pride in hiring staff from within the community we serve and hold dear to our hearts the longevity of preschool teachers within our school community. The proposed Student Success Act rule mandating a BA for preschool teachers is harmful as it could disrupt the continuity of care and cause quality teachers to be displaced. I'm a recent graduate and now hold a BS in social science and an associate in child development or early childhood education. This was attained during my 21 years of working for Albina Head Start. Although I am very proud of that accomplishment, and I'm grateful to have had the opportunity, I can't fail to mention that as a full-time employee and taking upper-level college classes to earn my Bachelor's of Science, at times it was challenging to deliver best practices in the classroom. Many preschool teachers work full-time, earning wages that would limit or disqualify them from grants, which would result in additional college loan debt with no wage compensation after graduation. The lack of affordability and accessibility is another challenge with the Student Act Success rule requiring preschool teachers to get a BA. In closing, I'd like to share that only a fraction of my classes required for my BS have any relation to ECE. As a matter of fact, out of 32 classes, only 8 of them had a related title. Please consider or reconsider the Student Success Act rule of mandating BAs for preschool teachers. Thank you so much for hearing my testimony.
And thank you for your testimony, and I just want our director to clarify this BA issue before we go any further.
Join by phone, sorry.
Okay, thanks, Eva. Because it's not a requirement. So before you leave, I just want to, and we'll talk about that when we get to the rules, but I just want you to clarify.
Yeah. Thank you so much, Carissa, for your testimony and raising the important issues. When we consider the preschool promise rules later, you'll, I think, be pleased to see, and this is following what is current law and legislation around preschool promise, that there is the the requirements and qualifications have a BA named in early childhood education or a bachelor's degree with some experience or coursework that is related, or an AA also counts as meeting the highly qualified requirement for preschool promise, or what we'll talk about later is language specifically from statute that says sufficient alternative credentialing. I want to read it exactly to indicate that the teacher is highly trained. So all of those are or, so there are options about that. And then later on when we consider rules, we'll building on the testimony that we just had from Autumn, we'll look at some languages to make more clear what that means to have to meet the sufficient alternative credential for highly qualified. So I think that flexibility in our current statute that is reflected in the rules that you have before there is acknowledging a lot of what you touched on around the different ways in which we can support and teachers can demonstrate their skill at working with preschool age children and being qualified. So
Thank you for that clarification.
sure,
Okay.
absolutely.
Great.
Thank you, and thanks for the work you're doing.
Thank you.
We appreciate
That's a very
Albina
immediate
has
impact
learned
on
a lot.
policy.
Yes, yes.
From testimony to change.
Yeah.
right?
Well, yeah,
Just joking.
Right.
But, yeah, Rick, thanks.
We are in action mode here.
Exactly.
Good point, Ann. Sandy Stevens, also from Albina, has.
Can I ask a question?
Sure, yes.
She referenced the number of coursework that actually has early childhood as like a reference point. That's striking to me. Is that true across the board? That like the coursework on early ed with a bachelor's track doesn't actually have, there are not many options in the training around
Right.
early learning?
Yeah, I think that's also a really important point. That's some of
That's
what the
huge.
work that we want to do, and I think we will have the opportunity to do with some of the resources that are available to us in the Student Success Act around professional learning and sort of our preparation programs for early childhood educators. I would say that anticipate variance sort of across, because this is a sort of policy area where we could do more to create that alignment, and it's important for a lot of different ways. Both, I think, the skills that individuals leave with and their knowledge of sort of child development and practices, and also to make it easier for there to be articulation sort of across, and how we're all kind of anchored around a set of kind of agreed upon knowledge, skills, and competencies, and then how coursework does or doesn't reflect that.
Mhm.
I think is some of the work we have to do in our system in partnership with higher ed. So yeah, I think those are issues. And we have some time in our agenda today to sort of dive in a bit to in our Student Success Act update to talk about the professional learning plan for those dollars.
Okay, great. Thanks, Miriam. Is Sandy Stevens here? Yes, welcome.
Good morning, and thank you for the opportunity to allow Albina's, thank you for the opportunity to express Albina's concern with mandating and providing increased compensation for early childhood educators with bachelor's degrees. So from the same perspective that Carissa has had. My name is Sandy Stevens, and I am representing Albina Head Start. Albina serves prenatal moms and children up to the age of 5. We serve more African American preschoolers in the state of Oregon than any other program. We have the most diverse early childhood staff as well. We have staff from 35 different countries that speak 27 different languages. This has been invaluable for our program. Preschool teachers play a critical role in children's development. In our view, there is a serious mismatch between the professional credentialing being proposed, a BA for early childhood teachers, and an effective preparation associated with classroom responsibilities. I have worked in the field for over 35 years, and I hold a bachelor's and a master's degree in the field of education, with a specialization in early childhood education. At one point, I held an education license with the state of Oregon as well. The hands-on classroom experience that I have received at Albina, along with knowledge I have obtained while pursuing my ECE-AA degree from Mount Hood Community College, form the best foundations for my career. I enrolled in a bachelor's teacher prep program. It did not focus on the early childhood years. These programs are geared towards elementary education. Early childhood and elementary education are two very different fields. I was insulted that I was required to student teach in an elementary setting after having taught at Albina Head Start for 20 years. Other than sending my family into further debt, I didn't learn one teaching strategy that I could take back to my career. I'm still paying off student loans, as well as loans for my 2 adult children. Albina's over 50 years of Head Start experience has shown no correlation between a VA and a proficient Head Start teacher. Our best teachers have had several years of on-the-job training in Albina's classroom, as well as ECE classes at Mount Hood Community College. Albina's in-house training program functions much like a multi-year craft apprenticeship program. We also offer classes to help all teacher assistants obtain their CDA, their Child Development Associate. Our Albina teaching staff have the opportunity to obtain an AA degree in early childhood education. Staff attend classes on in-service days and complete their student practicum in our Albina Head Start classrooms. Albina pays for tuition and textbooks. There is no out-of-pocket fee. We also have an ECE pathway for parents that want to enter the field. It's a year-long program. These incentives help Albina retain staff and reduce staff turnover, which we all know is important. Both are essential in quality services for children. Well over 80% of Albina classroom staff are current or former Head Start parents. Well over 90% of Albina's teaching staff are women of color. While many Oregon Head Start programs report an annual teaching staff turnover rate between 30 and 40%, Albina's turnover rate is 8%. Any approach to teacher preparation is ultimately judged on child outcomes. Albina's triennial federal Head Start reviews have resulted in no deficiency or non-compliant findings for well over a decade. We agree with focusing on infusing much-needed investments in Oregon preschool programs and designing financial structures that support teachers moving up the career ladder, that pays them appropriately. Let me repeat this, and that pays them appropriately for their work. This is why our program supports an AA degree pathway rather than a BA degree. In addition to no evidence that a BA ensures better teacher performance, that requirement will ensure that fewer and fewer women of color become preschool teachers. We are dedicated to changing lives and making sure that all children are ready for their next educational journey. Let us all remember our common ground in this debate. We only want the best for our children.
Well said. Thank you very much. Appreciate your input and all the work you're doing with kids. All right, Dana Hefner from the Children's Institute.
Is this more public testimony, or can I say, am I allowed to? Okay.
Sure.
I just want to say, I think she brings up a lot of issues that are important to the workforce conversation that we've had. And I have not analyzed the higher ed, what they're offering, but it sounds like there is an issue with actual quality training opportunities in early childhood, even though things are put under the umbrella of that they're actually not focused on that. And so in the earlier conversation we had around workforce training and development and access, this just seems like a very big issue that needs to be addressed, that the council may have an opportunity to impact, as well as the wage issue that she brought up in the beginning and the correlation between what things do we pay for and what not. Like what do we pay people, compensate people for in terms of training? And I think it sounds like there's an opportunity for the council to impact that too. So I just wanted to lift those up, because those are huge issues. And I know we've heard about them in the rural areas as well, and I just think it's really important.
Thanks, Kelly. And with one of your other hats on, FBO, that may be an area where they could provide some help too in researching that. Yeah. Yep. Dana, welcome. Nice to see you.
Thank you. Happy to be here. My name is Dana Hepper. I'm the Director of Policy and Advocacy at the Children's Institute, and I'm just here to raise awareness of, among the early learning council members of an issue you don't have direct authority over, but I think interacts pretty closely with the stuff that you work on. And specifically, it's preschools that are funded with K-12 funds. And this is becoming an emerging kind of, there have been school districts running preschools for many years in Oregon. In fact, Children's Institute did a survey of school district-run and funded preschools a number of years ago and found there were about 55 school districts in the state serving about 1,300 children across Oregon. School districts, like all of us, are seeing that we have not financed a preschool system in Oregon adequately, and many kids who are even eligible for the programs we do have don't have access due to lack of funding. And so they've been nobly trying to step in and help fill some of those gaps. And with the Student Success Act, more school and the new funding going to districts, there are more schools looking at preschool as one possible investment among many, including among many in the early learning space, that might be worthy of investment for their new funds. And so that's really exciting. We know even with the new investments in Head Start OPK and Preschool Promise, there's still going to be more than 20,000 young children who are eligible for publicly funded preschool, but we do not have a spot for in publicly funded preschool. So we think it's great to see school districts stepping up in this way. But the question is, what is in place to support some level of quality, best practice, inclusion, culturally specific or responsive approaches in those preschools? How are we communicating with school districts what we hope to see in that regard, and how are we supporting school districts to move toward that over time? And so I wanted you to know that there have been a number of early childhood advocates who've been engaging in this question. We wrote a letter to Holt Gill and included Miriam and Sue and the governor's education policy advisors, asking them to set some standard for what district-funded preschools should reach, and work with school districts who want to use their new district funds for preschool to figure out the details and specifics underneath those standards, to figure out how we would put a system in place to support progress toward those standards, and to figure out, reasonable, non-onerous ways to demonstrate and monitor those standards over time. So happy to answer further questions or share the letter with the council, but just wanted you to be aware that there have been a number of us kind of working on this issue.
Thank you, Dana, and I think it would be great to share that letter with the council if the council hasn't seen that.
Yeah, we can make the letter available to council members.
Okay, great. Thanks, Dana, and thank you to the Institute for all the research and advocacy that you all have done. We are all indebted to you. You played a big role in the Student Success Act and our $200 million. So, thanks. Is there anyone else who would like to speak to the council? These are the only people who've signed up, but anyone else either here or on the phone? Okay, if not, we will close the public testimony.
I just want to say one thing based on Dana's testimony. I
Yes.
think all the testimonies raising issues for the council to consider, and I think figuring out how we engage in what Dana is bringing up and being able to make a recommendation, how we might be able, particularly to, the governor and the department around quality. I think that's a very important role that we can play as the early learning policy group. And so I just don't want to, all of these, I'm like, what is it that we can do to actually create change or be catalytic towards change in these areas around quality, workforce, all the things that are coming up with the testimony. Those feel like really important to who we are and what we do. So,
yeah, and I would say, Kali, I appreciate that I really do feel like the fact that these issues that are being raised and we're talking about them is demonstration that we have been already catalytic in some regards. But clearly, I know you're saying, what is the pathway then to resolving them? So
Yeah.
first step is like raising them and talking about them, which I think is a step forward I don't want to miss. And I think, again, when we get to sort of the Student Success Act implementation, and I think some of our roles and sort of priorities conversations seem to be teeing us up. Like you noted, the workforce will be ways to do that. And I think specifically on the issue of the requirements for district-funded pre-K and stuff, it's something that Director Cole-Gill has been sort of a great partner on, and I think it is, is a high priority we'll keep working together on. And I think your point, thinking about potentially, the ways that the council and the State Board of Ed can be more involved in these conversations too. That's great.
Has there been discussions of a work group of getting a preschool, early childhood, K-12 work group together?
Yes, I think that those are areas that have been discussed. I think right now the governor's office is doing some, I think, engagement as well, and I've had an opportunity to be part of some conversations with superintendents. I know Director Gill is doing the same thing, so I think the mechanism is sort of still being determined about that, but we can have, again, more updates for the council member, I think council including in between the meetings and such, and share more information as it's being developed.
Appreciate it. It almost seems like there needs to be some kind of summit between early childhood, K-12, and behavioral health too, because behavioral health is having the same struggle with how to work into the Student Success Act in a way that makes sense and is effective.
Sure. Yeah, absolutely.
Good point, Peter. Okay. Any other comments before we go? Are our lunches outside running?
Yes, they are.
Okay, so lunch is right around the corner, and as you know from the agenda, there's no time to pick them up. Because we're now starting the Student Success Act update 10 minutes late. So if you don't mind literally grabbing your lunch and coming back in, and Mary, you can hear.
Yeah, hopefully I can answer that question. Hi, good afternoon, I think it is already, everybody. Nice to be with you all, and welcome to your first meeting. Look forward to speaking with you quarterly. So I guess before I get started, I'll acknowledge that we have a lot of information. There's a lot of information about the Student Success Act that we could cover. Tried to keep it within time. I hope you'll feel free to interrupt me as I'm presenting with any questions, and also, of course, at the end. I'm also just want to offer up front, I'm happy to come back during the rules portion. So many of those rules, or the last sort of 3 sets will pass, will relate to this, so that we can do that. And if we don't get through sufficient detail for any of you today, I think we're happy to figure out a way to kind of talk more. But we'll just get started and see how in-depth we can get. So the first slide is really, it's a pie chart about what was in the Early Learning of the Student Success Act. I think you've probably heard us say before, but it's worth saying again for emphasis on magnitude, that this really did double the budget of the Early Learning Division. And it made the state really a much more equal funder of early childhood compared to the federal government. And it's I guess we like to say it's a good start on getting where we need to go. It's a huge step in the right direction. So the majority of funding went to our largest program, no surprise, at Oregon Pre-Kindergarten. And if you look next to Oregon Pre-Kindergarten, you see OPK infants and toddlers, which is really the early Head Start investment. So together, that's a big lift for educators. All Head Start educators in the state will get a raise as a result of this investment. We'll see a lot more infant and toddler slots across the state in Head Start. So lots of exciting stuff here. I'll talk about most of these investments, or at least the 3 we're really focusing on today throughout the presentation. But as you see here, really a diversity of programs. What the early learning account did, instead of sort of investing in one area, lots of states, when they started this work several years ago, said we're going to do this incrementally. We'll just focus on 4-year-olds in pre-K, then 3-year-olds, and then, maybe in the year 3000 we'll get to infants and toddlers. And we tried to do something a little bit different, I think, in concert with the governor and the legislature, and is really say we need to seed all parts of the system and grow those over time. And so you'll see a little bit for infrastructure as well. So we'll get more into those. Of course, I want to highlight that early intervention and early childhood special education received a large investment of $37.5 million, and these are annual numbers. And so that's to get to adequate service levels for children, and we do not administer that program. So just want you to know that that's our partners at ODE, so we won't talk more about that today. You can go to the next slide. We're just going to skip over the next two. I know they're huge, but we could spend all day digging into each of those, so I wanted to provide those for you so you kind of see the investments broken down in a little more detail. So today, our plan was really just to focus on where we're at right now, what we have done, and what's most urgent moving forward, and kind of give you an update on where we are. So implementation timeline, this is now, or rather last month through the kind of end of October or beginning of September, when our target is for services to begin. This is really focused on Preschool Promise, Oregon pre-kindergarten, including infants and toddlers up to preschool, and the Equity Fund, since those three have been our major focus thus far. So we have had some great work happen. I know council members were on the Equity Fund Rules Advisory Committee. You'll have those rules today. I think it was really great to have the community input. One thing we want to highlight is that all 16 early learning hubs, which we'll talk more about in a second, completed early care and education sector plans, really looking at defining priority populations of young children in their community. And as you are very aware of, there's some rule adoption going on, hopefully today, around these key programs. And that is, when those are adopted, we can release requests for applications for these three programs, and we anticipate, upon passage of the rules, releasing those today. And you see this is what the next kind of 9 months, 7 months will look like for folks here. We'll select programs in April once the application closes, with a target to begin services in September. So we'll get into each of those as we go along a little bit. So as I mentioned, all 16 early learning hubs completed early care and education sector plans. Here is a total random assortment. Don't take any meaning of the plans on here, but just to give you a sense of that these are real now, which is so exciting, and they contain an incredible amount of robust information. Essentially the process that each hub went through, and I know some of you were involved in this process, was they had a stewardship committee, which was families, must include families, included providers, included other folks in the early learning space and they solicited input from families that looked a lot of different ways. We received input, if you total it all together, from several thousand families across the state as part of these plans, whether that was through surveys that were pushed out through various networks, whether that was going to events and talking to parents, whether that was focus groups. There was a lot of really robust input. I pulled out a few things that I think represented what we saw across plans, but there were a lot of themes. They are all, if you're really hankering for 16 things to read, they are all up on our website under each hub's website. So we might be most interested in those that are related to your region, but I would really recommend digging in. They're really exciting. So here's a few quotes. We saw high program cost and transportation to and from preschool to daycare are my primary barriers to accessing care. I almost couldn't do preschool with my youngest because of transportation issues due to my work schedule. So we saw a lot about having to leave during the day, transport children to and from, and not having that support. That was a direct quote from a parent. Other plans kind of summarized input, so parents want to have caregivers speak their native language. There's a call for cultural sensitivity and diversity that came up, and those were both themes across a number, along with lots of other themes, but these have been incredible sources of information and will continue to be, both for implementing these investments and as we continue to design policy, and even as we continue to think about resourcing hubs to do a lot more engagement with families. I think it's truly incredible to see the work that they completed in what was a really short timeline after the passage of the act. So if we'll just keep going, yeah.
Some of that daycare, transportation issue is going to be addressed by the incredible increase in the number of full-day slots that are available, as opposed to the half-day, which for working parents just doesn't compute.
Yeah.
Sarah, Eva said she was having a hard time hearing a little bit.
Yeah, sorry, I was trying to
maybe move the mic a little closer.
Okay, I'll do that now.
No, Eva,
or the phone a little closer? Yeah, okay. You're fine. I will speak very loudly. I just always feel silly, like I'm yelling at George and Katie here, but that's okay. You won't take it personally. So just want to go through Preschool Promise, OPK, and the Equity Fund to give you an update in addition to the rules, what's been going on. So just as a quick highlight and reminder, our Preschool Promise investment as part of the Student Success Act invests in about 2,500 additional children served statewide. That's about a $30 million additional investment, and then that is and then $3 million on top of that for local support in instructional coaching, technical assistance, and funding for us to both monitor and evaluate the program. So go to the next slide. Here's some of the biggest highlights, and I'll show you the slot distribution plan. So that was really about equitably distributing slots across the state. What we saw in the first Preschool Promise sort of statewide competition was that there were some hubs that received Preschool Promise. Of course, it was a small number of slots as well, for context, others that didn't. And then even among those that did, there was a very different kind of number of slots based on their application itself. And so we learned from that, heard from folks as well, and this time are testing or doing an approach of really distributing based on a range, based on the number of eligible children and the current number of Preschool Promise slots, and trying to get each hub region up to a similar percentage, if not the same percentage. Other things that have been going on, there has been engagement on the standards or the program requirements with current providers to make some adjustments there. And that will be ongoing for a little while longer. And then, of course, we've been working on the request for applications, both for providers and for fiscal agents, those are ready for release. And we have been working with child care resource and referral entities across the state to fund them to support applicants in applying to this, as well as putting together some resource lists on existing state resources, like small business centers and other things that can be accessed to help folks respond to the RFA. I'll go next. Here, just quickly, is the slot distribution. This is both on our website and will be included as part of the request for application. Again, this was really a math problem of looking at the number of eligible children, i.e. children at 200% of federal poverty level or below, in the number of current Preschool Promise slots, and looking at and just for detail of how we say this is a good step, that still, those ranges get us to about 5% of eligible children served through this program. In concert with Head Start, it's much higher than that, but just so you have a sense of the target. Not really a surprise that a lot of this is by size, because it is a percentage of number of children served. So I won't read that all out. And this was the original map of Preschool Promise to give you a sense of who received it, who hasn't, and who doesn't have it. Yes, so that's the current state, and on the left you'll see what will go to each of those hubs there. So
So that map's gonna.
that will look,
After the 6.
everyone will be bright green.
Yes.
Okay.
Yes.
I think as you're seeing here, one goal through that's allowed that the slot distribution plan helps to achieve is for all of the different hub regions in our state to have access to preschool promise funding.
And this is just one overlay of which those plans we talked about before name they name priority populations, and that will factor in as well. But this is really just about the number or range, the number that we anticipate.
And how was the range determined?
It was really number of eligible children and current preschool promise slots and getting to a 5% target.
So are these just new slots, or are these?
These are
on
just
top?
new
Oh,
slots.
just.
These are just new slots. Yeah.
I just, maybe this might be some context that would be helpful. Last time it was a competition, the competition was among different hub regions, so with the number of slots that we had, so we ended up with, I was not here, but I'm imagining maybe some, all hubs applied. I think it's true, not all hubs applied, but not all hubs were also awarded that applied. So this transition now is with this expansion is a goal that all hub regions will have some preschool promise funding, and so while it's still a competitive application, the application is within regions, not between regions, in terms of the providers that are selected. So unfortunately, we don't have the resources for everybody that applies. And Sarah's point with the way this distribution is could we get all hub regions in our state to have enough slots to get to at least 5% of their eligible population served?
So the anticipated range is on top of what that region has
Yes.
currently?
Yes.
Okay.
Anything you want to say about tribal?
Right. So in consultation with tribes, we pulled out from the sort of hub region, and we sort of talked through, should we do individual or just one line? And in consultation, we determined one line and one range. So those applications will be considered as an entity, I guess. I don't know if that's clear, rather than in their hub region, given that they are sovereign land. So, yeah.
So, for the hubs that have no promised slots currently, will essentially more dollars be going into those areas to sort of hit targets?
Exactly. Yeah. Yep. So proportionally, they're going to be getting more slots, right? So if you see one that seems like, wait, that's as big as that other region, it's likely an awarded hub, and they're just to get to 5%, they needed sort of less.
Okay. So can I clarify, when you say 5% of eligible, what does that actually mean?
5% of the number of children who are 3 or 4 within the region who live in families with qualifying income, so 200% of federal poverty level or below.
So promoting regions.
Yay. I know, it's hard to celebrate, I agree. But we can get you the numbers of, and actually that's in the needs assessment you saw earlier, that paints a little bit of a bleaker picture. I'm certainly not going to be one to say we have enough early childhood funding in the state, but that it's, in addition to Head Start, those numbers are more in the 50s. But still, that's not a yay really either.
Okay.
All right. So I just wanted to highlight, because I know this has come up, so I just wanted folks to be aware of, in addition to the slot allocation, so what we just saw will be money per child, and those RFAs are about money per child to offer services. There was that other additional part of the budget that we added $3 million to on top of a number that escapes me right now. That's really about wraparound support. So while the per child cost builds in some costs to do self-determined professional learning, that's really about what your individual program might need. You send your you send your teachers to the curriculum training for the curriculum you have, or et cetera. I won't go too deep down that rabbit hole. This is the additional supports that would be going to providers. So it's organized by who administers these supports. So we'll start with the the least cool supports, I feel like, on the right with the early learning division, which is really about technical assistance for program administration. So we will monitor and sort of provide oversight, give grant management and technical assistance, support for data collection and reporting, and providing other statewide training and technical assistance is sort of identified. Hub's role with Preschool Promise, it will be coordinating enrollment within their community. So we're working with Hubs right now through resources both through the Student Success Act and the current and future preschool development grant to have staffing to do this and to develop systems and approaches to coordinating enrollment. This year really focused on Preschool Promise, so that providers have that support. And families have that centralized place to go and understand opportunities within their region or within their community. So you'll see that just kind of outlays, I won't read all of those to you, what that kind of entails for Preschool Promise duties. CCR&Rs will, as we were very excited through the Student Success Act to receive an investment in instructional coaching. So those instructional coaches, which focus on quality instruction, I guess, if that wasn't clear by the names, but will be employed at CCR&Rs and work directly with programs. There's also technical assistance on the quality standards. So really more, I think of these as the TA is to administrators, the principal, the director, and sometimes in the classroom, and the coach is really so the person in the classroom has that focus. And again, this will build on our current approach of facilitating professional learning communities, supporting programs to develop individualized PD plans, supporting inclusive practices and environments, instructional leadership, and sort of other things that are individualized based off of providers within a community and their common needs.
Well, Sarah, on the Early Learning Hub column, it's true that there could be a few more bullets.
Yes.
As well, right?
Yes, this is not accounting for subcontracting. This is what will the state direct from a state to this entity, kind of what will we directly have them do for all providers, regardless of the subcontracting relationship.
Okay.
Yes.
So I'm sure we'll talk about that when we get to the rules.
Yes. Yep.
Okay.
Awesome. Okay, so I need to speed it up, so I will try. But so the Early Childhood Equity Fund, these numbers are the number of families and children. I feel like is a pretty estimate because this is a brand new program that is about support for culturally specific programs and organizations and tribes to offer all of the above. So we estimate with this investment we'll reach about 2,500 families and children statewide. It's a $10 million annual investment, and there's about an additional $800,000 for technical assistance, other supports, and evaluation. Yeah, go ahead.
I should know this because I was on the rules committee, but the 800,000, is that going to the department, or is it going? Who's providing the technical assistance?
We imagine that those will go out in contracts to someone to do all of that for, in addition to kind of like preschool, the individual money. Right. Folks will have to do what they need, but this would be like a statewide evaluation, statewide technical assistance and supports, but administered by a third party, for lack of a better way to say it now.
So that's more the fund as a whole, if I remember correctly,
yes.
As opposed to the
this individual program and that, yeah. So just quick updates here. We completed had an initial survey pushed out, thanks to many of you and other of our partners. We received some great feedback that helped us develop the RFA, I think, in a way that's hopefully more accessible and understandable. You all will know about the Rules Advisory Committee and you'll learn more, so I'll skip over that. And we have put out support for CCR&Rs and are working with other partners in community to help with the sort of application process itself and questions. And we will I think you'll see in the RFA, I do want to highlight this, so folks will be able, for all programs for Preschool Promise and the Equity Fund, to apply in English and Spanish. There will be from ELD, because I think as a lot of you know, in the RFA process, you can ask questions and do all that sort of stuff to the state as a potential bidder. So we'll have an after hours line that's available in multiple languages through the state language line, and then Saturday hours as well. So I just want to call that out because that's staff here at the ELD really, I think, have been really great and are willing to, as we should be, but have done that work. So that will all be included in the RFA. We'll also be going out to communities as staff to do bidders conferences in the technical language in person across the state too. So in addition to those supports, they can come ask some of those questions and get more information about the opportunity from the early learning division. So
and Sarah, as those staff go around the state providing that kind of support, I assume they or some of their co-staff members could also be providing support on the other grants?
Yes.
Like the preschool promise grants as well, so it's not just equity?
Right, yes. There are different dates for each in the same communities, but they could ask questions of different folks as well.
Okay, because I'm guessing there will be a lot of questions around preschool.
Yes, so we do have in-person conferences for those. So, awesome. Okay.
Excuse me, this is Angie.
Yep.
Hi, Angie. Go ahead.
Would it be possible to share the presentation in Zoom or put it in a Dropbox so those of us on the phone can also view it?
Zoom, make sure the screen is shared. Yes, we will work on both of those options as we speak. Yes, thanks Angie for doing that.
Okay, Sarah, we are super behind.
Yes, I'm going to talk so fast right now. Okay, so I try really hard not to, but now I will. Yes, and please interrupt. So the Oregon Pre-Kindergarten Program, which we're now calling OPK Prenatal to 5 temporarily, or maybe forever, I don't know. So it's 8,100 slots enhanced for 3 to 5-year-olds. So what does enhancement mean? That means every slot will be enhanced. Currently, most of our slots are half day with a teacher and teacher assistant salary addition, options for transportation dollars, and within that bucket in the RFA, folks can then propose other things related to compensation for all staff in their program and other kind of retention related investments. So that. We'll talk a little bit more about that. That also, oh, sorry, don't go next. It's okay. I appreciate the bump. And that includes about 30% of those slots becoming full day. So what in Head Start, the lingo is duration, but so we're trying to move over time to have all slots move towards full day. And so this year, or this biennium, we're targeting 30%. At least. The 1,280 slots represent new slots for infants and toddlers, so that's super exciting across the state. Right now, the state funds 64, so by order of magnitude, that is a lot more. So you see that there. Now we can go to the next.
And is that all through Early Head Start, Sarah?
Yes, those are all Early Head Start slots through current grantees. So those, but they could look very different based off the program and community need. So they could be full. We're targeting full day, full year center based because we know that's what families have expressed need for and want. We know because of facilities issues and other sort of capacity issues, and when there is parent need, Early Head Start can be delivered in a home-based model, so an educator going to the home, or in a combination. So they come in some days, they go others, or other locally designed options.
Center-based even for very young children, kids less than 3?
Yes. Yeah. Okay, so we've done a lot of engagement. The Roy will be here. Folks at ELD have done a lot of engagement on salary and transportation investments to make sure those are structured in a way that works for programs, and on Early Head Start models to kind of get to the information I just shared with you. And that RFA will be ready for release to go out hopefully today.
And the eligibility for OPK, the additional slots, is going to be no different than it is currently, is that right?
Yes, it will follow the federal eligibility. And yeah, go ahead.
This is what Head Start has lobbied for
Yeah.
what, 3 sessions, I think?
Yeah.
To get more slots for, well, more early Head Start, but also to get the salary increase, the transportation back. So this was a huge win.
Yeah.
And we're going from, I guess you probably remember from our October meeting, just 6 state-funded early Head Start slots, 63 slots to over 1,000.
That's great.
Yeah.
Awesome.
Yeah, as a former Head Start teacher, I'm really always open with the salaries. Yeah, it's crucial. This is a really big one, and I don't think I'll be able to do it justice, so I think we can dig in more either on a separate or now. But I will just say we are, it's incredible to have $12.5 million. Again, it's divided by 25,000, so we have a long way to go to build our professional learning system, as you heard in the testimony and for your conversation this morning. So it is great to have this investment. I'll talk a little bit about what we're proposing to the legislature if we go to the next slide. That I believe will be testifying to a joint Ways and Means Ed subcommittee in either the second or the third week, I think, of February. Not totally sure, to get approval to move forward with spending these funds when they're available. So just how we did this plan, I think many of you were engaged. There were engagement with probably about 60 to 80 people, like losing the number, across this. And then we had previously engaged educators in 8 focus groups across the state and received some really great and very humbling, feedback, but incredibly helpful, and that all went into figuring out how we're proposing to make these investments. If we go to the next slide, I'll just highlight some of the, so we submitted this report. You may have read it. I know there's not a lot of spending detail in it, so I think that's what I'd love to be able to share in the future with you all before we seek approval. So just some highlights. I would say that we're kind of trying to do 3 things. Is one, create what we need foundationally, which is a set of robust competencies about what the workforce should know and be able to do, and that's inclusive of all of the things that we know are really important. Because I think to the issues before about coursework doesn't do this, this will help us align and say, where are the gaps? Filling really key gaps in the current system. So right now it's sort of based on, we know our CCR and ours don't have the capacity to do this, we haven't funded them to do it, and for educators navigating all these different pathways is really based on the strength of their administrator or someone they know. So exploring approaches to really advising and centralizing or having a structure to advise and help folks explore adapting pathways across the education continuum. So we're going to, we have proposed investments in everything from GEDs that are relevant to early learning to associate's degrees and bachelor's degrees. We want to explore a apprenticeship pathway, I'm just losing that word, and some other alternative ways to learn more that is applicable to the work that you do every day. Supporting educators through scholarships, and not just through scholarships. We know that's really important. No educator or early childhood educator making minimum wage should have student debt. And people coming into the field shouldn't, because we do have a long way to go in compensation, even though we're trying. And those scholarships will not work if programs don't actually meet the needs of the current workforce and the future workforce, whether that's the curriculum itself or the wraparound supports or having childcare or support for transportation. So we have built in some grants to work with programs. We're hoping to explore being the first applied bachelor's degree program under the newly passed law for that. So, and then the third would be, there are gaps, but we know that there's some great stuff going on across the state. Many, at least one of you around this table has been funding, helping to support that going on, and lots of you have been involved. And so what we know is there hasn't been state funding to help scale that. So it's really looking at expanding consortia approaches and more those are just 2 examples, job embedded professional learning.
You mentioned investment in applied baccalaureate. Are you also looking at investment in community colleges around this? Okay.
Yes, yeah.
And is there any program for like loan repayment or incentivizing people to go to rural areas that have the education, or supporting that?
That's a great point. I would say a lot of what we're proposing is to spend the money to plan and do that. And so I think, thank you for that question and put that into what to consider and who to have around the table to really make sure this works for all of Oregon.
Just add, part of in filling gaps in the current system is also more resources and pathways for CDA for our workforce teams.
Yeah, very relevant to today. So.
You know, Carrie, thinking of April, this sort of fleshing this out, using this as a template, I think to help with that workforce conversation might make a lot of sense. We all did get the plan, I think it's 30 pages or something, so we've got some of the resource in front of us, but I think trying to figure out, so how's this getting translated? Could be
it's down from 100 pages.
Oh, this is the exact
107.
Yeah. Okay, I didn't fully appreciate that. Thanks.
Should have accidentally sent you that one first. Okay, so yeah, we can come back in April and I'd love to dig more into that conversation.
Very exciting. I mean, this is just a huge piece of what we were talking about this morning.
Right, and I would just build on what you said, Sue, around the follow-up conversations is, as mentioned this morning, the preschool development grant, renewal grant also provides more resources. I think once we know and have approval from the legislature around the spending plan priorities for these dollars, I think how we view the sort of whole picture, thinking about our PDG grant dollars as well, which are very aligned with this.
Yes, yeah, I think about.
You just for the council to understand all the different opportunities around, I think, addressing some of the issues we heard in testimony and what you all know in your communities and are needed to really grow the workforce and support the workforce.
And seeing that we still need approval from Ways and Means to do this makes me think of you, Troy. And I think it would be really helpful, thanks for being here. I think it would be really helpful if you could keep council members informed of when some of these hearings are coming up. So we could either attend or listen in or weigh in if we happen to know people who sit on some of these committees and subcommittees. To sort of use council members for some leverage as well and support.
Is there concern that they will not approve?
I have no idea if there's any sense of
where they are.
How excited, I mean, the money's already approved, right?
Yeah,
In the
that's
SSA.
Yeah.
So this is just the spending.
Yes.
Outline.
Occasionally you'll get a member that just finds something that bothers them and they'll delay it because they have one issue with the package. But for the most part, when the legislature asks for a report to come back in the next session, they're ready to accept it and go with it, assuming the work's been done.
Yeah.
If we have a problem, we'll just take care of it. No problem.
Yes,
Okay.
perfect. So this is just the last slide. It's just to highlight where what's most important now.
Sorry, I know we're behind. I have one other question though. How is this aligned with the Advancement Council work?
Yeah, so we...
the professional one.
Yes, yeah. This line, this wavy timeline. No, so we sought input, so we presented to the Educator Advancement Council, got their input, spent a lot of time with especially folks around the higher ed pieces. So I would say in alignment, it's sort of created with the same principle and directionness, that's not a word, that the EAC is going towards. I think what has been great in the past few months, I think we've made progress. It might not show here right now, but of where to figure out the overlap. That was a really, I would say, I mean, Miriam, say more or just look at me and say stuff. But it felt like we were kind of like not really getting to a combined conversation or kind of in a Venn diagram, like what's in the middle for us. And I think that with the higher ed investments, especially, and alternative sort of pathways and credentialing, there is that there. So I think you'll see in our proposed rule language, working together on that. But
they weren't accepting of the?
I can build on that a little bit. I would say that the Educator Advancement Council, in a lot of their past work, I think, in the past year or so since I've had an opportunity to join this effort, and as they've made the transition from a governance council, has been really focused on standing up some investments that are specific to the K-12 resource. I mean, K-12 workforce in terms of funding, and but there is a very much an interest in understanding more about the needs of the early learning workforce amongst that council, and I think also a real commitment to things that are shared between issues that we have and values we have in the workforce around diversity and equity, and also issues of diversity and equity within the K-12 workforce. So I think what Sarah's saying is as they're more established and as we have this professional learning plan, I think a common area of interest to guide our work going forward is maybe around partnership with higher ed, capacity around issues around equity, and some of what we've talked about with alternative credentialing. So I think what's coming into focus is shared priorities in areas where we could be working more collaboratively between the early learning division staff and the new executive director, and between the council and the EAC. So I think that's one area, sort of partnership with higher ed. And the other, I think, is one that we've talked about before with the Educator Advancement Council. So I had an opportunity to sit on that, and Sarah's does as well. As my designee is related to alignment with sort of professional learning opportunities pre-K through early grades.
Yeah.
That's another
That's what I
area
was
that's
hoping.
emerged as an interest,
Yeah.
So I think what we're saying is it's coming into focus. They've had a lot of work to get going on and some of the immediate priorities that they've had, but a collaboration and a desire to align with early learning and work together is something that has come up a lot as I've sat with the EAC around their interest in working with us.
Okay.
Does that mean?
Yeah, it just seems like, I mean, our whole earlier conversation around alignment of early childhood, like as it being a singular continuum, if the frame is they're okay with working with us, it doesn't seem like there's an actual intentional interest of the full continuum. Do you know what I mean? Like why, I don't understand why there would be any hesitation, and maybe you would know more, but I hear teachers talk about how they wish they could do more professional development with preschool teachers, particularly K1, 2, grade school teachers. So it surprises me that that it's not like this, oh, this is perfect, like we've been waiting for this.
No, I don't mean to say that it's not, I think that there is.
Okay.
I think that they have had, they're working to give dollars out to communities that are specific for
So
K-12
in terms of dollar
educators.
allocation, okay.
Yes, and I think the other thing to keep in mind is probably some of the points of intersection as we grow this and it
Right.
evolves is that we also have to think about the professional learning system for educators in all settings, and a mixed delivery system, Head
Right.
Start, child care.
Right.
So that's also a little bit outside of where they want to be supportive. That's broader than their work. So.
Okay.
And is this only going to be available for preschool educators as opposed to preschool providers? It's come up recently that it's very difficult to have good training for childcare providers that are providing care for kids regardless of their ages that have special behavioral needs. That's really challenging, and for the safety of the other children and for the safety of that child, that the provider really needs to be trained.
Absolutely. Those are, I think, both as we talked about the plan, looking at those sort of competencies and then thinking about professional learning and including that as an area where we need to provide more training that's relevant around inclusion practices and serving children and child educators is one part of what we can do sort of on the professional learning side. I think in some of our other opportunities as we think about our publicly funded programs and what kind of coaching support and technical assistance is available for providers that participate in Preschool Promise, for example. It's another area. And then exploring more collaboration with education service districts who administer EI and EC and those resources. I think as we understand how those dollars will be out in communities. I know I had to step out, so I'm not sure if Candace spoke about also some grant dollars that they've received to look at specifically at inclusion and what kind of supports are needed is, I think, another opportunity to see ADIs, CSC, and MSDs. I go over and I just say, there's some actions in March at our meeting. I just want to flag for the council as we think about where you fit in kind of along this timeline in some actions that will be before you. So we obviously rules is this meeting today, some updates on the spending plan, and probably after that some more work to define, given where our priorities are around that. The March meeting, looking at salary guidelines, as well as the scoring committees and the selection of providers will be some actions that we're looking for you. I'm just putting those out in front so you know what's kind of coming ahead at the March virtual meeting.
And is the idea that once salary guidelines are established, the discussion will then move on to, is there a way to create that kind of pathway to get higher salaries over 5 years to kind of match up with K-12?
Well, I think, that our idea is to, in our publicly funded programs, to look at how we can have the most alignment and those are the grant programs that we administer. I think the challenge is that that's a very sort of narrow solution to a much bigger problem. Our public dollars don't reach all of those providers, right? And all of those settings where parents, as we talked about in our October meeting, parents are the largest funder of early education. It's what they can afford to pay, and we don't yet have an investment or a policy that's helping those providers working in those entirely private pay. But it's a step forward, I think, and it's an important stance that we can take when we have the opportunity with some public funds.
And just real quick, at least for a point of clarity for me, as you get into the salary discussion, and if and when public schools get into that, and they have their own structures and their own funding mechanisms for how they pay, and if we do the BA or not do the BA, all of those things. So my point is, if schools are in that discussion, or if you have K-12 representation into how that'll impact them, their unions and their collective bargaining agreements and their salary schedules, there'll be a lot with that.
Absolutely. Yes, and I think we've learned a lot through the preschool promise in these years with the participation of schools and what some of those issues are.
Quick reminder, what's the second issue for March besides salary guidelines?
The scoring committee, representation on the scoring committees.
Okay. I'm guessing you would like some suggestions around that sooner rather than later?
Yeah, we'll be reaching out.
Yes. Okay. Okay. I know we could spend the next 2 hours on Student Success Act, but we don't have it. So, Sarah, thank you very much for the overview, and obviously we will be hearing about this at every single meeting. Fortunately, we're excited to have that be a standing item. So let's go to the Ad hoc Portal Committee recommendations and welcome Amy Joyce and Angela Rodriguez. Thank you for being with us. Council members, I just want to let you know Amy came in 2 months ago. Is that right? Is our acting?
Coming up on 4, it was October 1.
Oh, time flies when you're having a great time, huh, Amy? So Amy has come over as our acting child care director, and we're very, very fortunate to have her here and stepping into that role, which we all know is very complex, lots of pieces to it. So thanks for joining the Early Learning Division. And Angela, thank you for your great work on this proposal we're about to look at.
Well, thank you, Chair Miller. Again, Amy Joyce, the interim OCC director, and thank you for your gracious words. It's an honor and a privilege to do this important work, so I thank you. We're here to report today on the Ad hoc Portal Committee. So for background, in March of 2019, Governor Brown directed the ELC to lead a public process to improve parents' access to child safety information. So in response, the Early Learning Council and the Early Learning Division created an ad hoc committee to look at the child care safety portal. And the charge was to look at the challenges, expectations related to providing accurate, timely, and relevant information to parents via the portal. Key principles guiding the committee, we're providing information that is both clear and easy to access, is helpful to families, but also balances privacy and transparency. Committee membership, our chair Sue Miller. Ava Ripito was also a member, and then we also had parents, child care providers, law enforcement, a district attorney, and other stakeholders in the child care world. So we are here to present you with the culmination of that work and the committee's recommendations to improve parents' access to child safety information. And I'll turn it over to Angela.
Hello. Thank you for your attention, and I'm excited to present this final report. The recommendations put forward today to you are a result of work that took place over the course of 6 meetings that occurred from May to October of 2019. The first meeting in May laid the foundation for the structure of all the future meetings and included a request that from the committee members themselves that the Office of Child Care staff provide in each of the subsequent meetings recommendations that included pros and cons, as well as the background material needed to come to an agreement on recommendations. The ideal was to have full consensus from each of the committee members or each of the ad hoc members that would be put forward to the Early Learning Council. So the committee achieved consensus on recommendations for all but one of the policy questions that was considered by the committee. The recommendations for the Early Learning Council for you all to consider today are the following. The invalid complaints related to licensed child care should continue to be omitted from the portal. That licensing history should be displayed for 5 years. Guidelines regarding the submission of provider response letters should be given to providers. Information for both licensed and not licensed entities, which not licensed entities refer to recorded programs, regulated subsidy providers, and as well as any facilities or entities, I should say, that have been cited for an illegal care violation. So information for both of those groups, licensed and not licensed entities, should be made available on the Early Learning Division website in a way that's easily understandable, that ensures types of care is easily distinguished by parents. In addition, another recommendation put forward today is information for programs that do not have a current license should be made available on the Early Learning Division website with a clear description of why the program's license is not current. When a child fatality occurs in child care, the Early Learning Division should make available the date of the death, facility name, license number, owner, provider name, city, and zip code within 48 hours of the Early Learning Division's notification, barring any extenuating circumstances. In addition, the committee recommends adding a statement to a provider's history when no Office of Child Care violations were found during the Office of Child Care investigation. Information should be made available as part of a provider's portal history when there is a substantiated incident of child abuse in regulated care. It is recommended that the information include whether the child abuse finding was assigned to an individual or a facility, the type of abuse, and the date the substantiation was determined by final order, as well as a short summary describing the circumstances. The one item that the committee did not reach consensus on was whether the portal should display licensed care complaints that were found unable to substantiate. Current practice is to post them on the portal, and because the ad hoc committee did not come to consensus, the ELD will keep the status quo.
Can I ask a quick question?
Definitely.
With the invalid complaints related to licensed care should be omitted, and that's when I guess when I saw that one too, like, so this one's, if they're not substantiated, and that one that were invalid complaints were to be omitted from the portal, I wanted to have clarity on that, or more clarity.
Sure. So when complaints are found invalid, that means they were confirmed to have not occurred. And Amy, jump in too if you want to add any clarity. But when a complaint has been found unable to substantiate, that means that there wasn't enough information to make a determination as to whether it was actually not valid at all or whether it was valid. And so current practice is to show that information. It shows the allegation as well as that statement of unable to substantiate. So not showing invalids means that we've confirmed it definitely didn't happen, and so we're not showing those on the portal. The recommendation is to continue to not show those on the portal. But when investigation has determined that it's been, there's not enough evidence either way, that we show them is currently what we do.
I actually think that's good because it shows trends over time. You know, if parents have similar concerns. It shows trends. I mean, just being an advocate, trying to kind of keep kids safe, I think that's not a bad thing. You certainly hate to have somebody be falsely accused, but.
I think that I like that bucket, at least that helped me to understand it better, because one is like we did everything, all the due process, all the fact finding didn't happen. This one we did it, but we don't have enough facts or details to know if it's true or not true. And then you live there, I guess. But at first I was just, for schools it tends to be whether it was substantiated or not substantiated. If it's not substantiated, that's it. You don't wind up doing kind of another bucket.
Mm-hmm. And the point Peg made is exactly what the parents said at the portal. They were very vocal about that, wanting to know if there's a pattern. So,
What's illegal care complaints?
Those are complaints of a person who's providing care outside of, usually it's for children 3 or more than 3 children.
Okay. Outside
and
of
they're
their
not licensed.
licensure.
Yeah,
Got it.
so
Thank you.
they don't fall in that exempt category, but they're providing care anyways.
Basically, they should be licensed under our regulations, but they're not.
Got it.
All right. Any questions from council members? Yes, Katie?
So when somebody goes on the portal to register a complaint, because I know there's a piece of legislation about this right now and I don't have clarity, are you required to give your name, or can it be an anonymous complaint through the portal? How does that reporting happen if you are the person reporting?
Well, then if it's going to count against you and it's not, you don't have, I'll just say, if you have details on the person that made the complaint, I know we have protections and laws to allow for that too, but if there's not a checks and balances, if that's what you're getting at, that is a concern. To be able to just, hey,
So
that one disgruntled employee.
We don't require persons' identifiable information, though we ask for it. And at least we're currently in the process of making some improvements to make it clearer that we're asking for that information, and to make it clear for people that are submitting complaints online that their information will be kept confidential. So forgive me, I think it's a statute. One of some regulatory information that's been set forth makes it clear that information by people submitting complaints will be kept confidential. However, it's an interesting point, the distinction between being anonymous and keeping your information confidential.
Yes.
So we want to let people know that your information will be kept confidential, but it is very helpful to know who you are so that we can follow up and get additional information and be able to actually investigate the complaint appropriately.
Yeah. So the answer is that it's not required to give your own identity when you call.
It's not.
Okay.
Mm-hmm.
So I have a question. This is Angie.
Hi.
Could you please describe or explain what recorded programs are?
Yes. Explain what recorded programs are.
They are programs that are required to notify
the Office of Child Care, that they are, so they're exempt because they are a district entity that's providing either preschool programming or school-age programming. But they are required to tell us that they're doing that. But beyond that, that is the only engagement that the Office of Child Care has with them.
We don't have any jurisdiction over them.
Correct.
Whatever. Right. Okay, any other questions about this report and the recommendations that are in it? I think the one comment I would make, just so we're all aware of it, and I think I've said this to many of you individually, this is sort of a beginning point for the council. This isn't going to be the end point as far as our involvement in the portal. As you read through the recommendations, and I love the piece where it says the technology considerations. There are a lot of technology considerations to really make the portable and that entire part of our website more user-friendly. And we heard that at every single portal committee meeting, both from the parents and from the caregiver, the providers, that it just needs to be, the information needs to be easier to get and more accessible. So we will be hearing more about it, and if you read the PDG, the second grant that we've just gotten, there's a significant focus on portal improvements in that PDG grant. So there's some added resources that can be used to make some of these technology updates, which I was delighted to see. So. Okay, if there are no other questions, I would love a motion to approve this report and the recommendations.
I'll move to adopt Oregon Administrative Rules, Chapter 414, Division 061, as proposed in the packet provided to the Early Learning Council dated January 16, 2020.
Is that the portal?
Oops, no, it isn't. I'm sorry.
You're
I'm one ahead. I'm on the wrong page here.
You can make that too.
How about that?
We'll start with the portal.
So that's the central background.
Amy will be happy to hear that one also.
Can I rescind that motion?
Yeah, you can make it in a minute.
Right, let's see.
This is the.
I'm looking for the portal. Committees.
I don't find it either.
I'll read it for you.
12:30 to 12:30.
I move to adopt the recommendations of the Child Care Safety Portal Ad Hoc Committee contained in the January 2020 report. That would be the motion, if someone would make that.
Make a motion to move what the Chair Miller said.
Sorry if it's not in packets.
I don't see it.
Okay, so want me to reread that?
No, I'm good for it.
Thank you. So Kelly's making that motion.
I'll second.
You'll second it, Peg. Thank you very much. Further discussion? Those in favor say aye. Aye. Opposed? Motion carries. All right. Thank you. Angela, are you still here? Thank you. Nice work, Angela. Angela and Jay, and we just had an amazing staff support for from May to October. Yeah, so thanks a lot. Excited to move that forward. And the governor will be very happy to see that as well. Let's go then to, Amy, are you coming back? Thank you. We are ready to head into our rules adoption. And we will start with the Central Background Registry, right?
That's correct.
Okay.
Thank you, Chair Miller. Again, Amy Joyce, Interim Director of the Office of Child Care, here today about the Central Background Registry, or the CBR, which is the database into which a person must be enrolled to legally provide care in licensed settings. The OAR's, or Oregon Administrative Rules, set forth crimes that prevent a person from being enrolled for either a set number of years or permanently disqualified from enrollment in the CBR, what we call the DQ crimes. Department of Human Services, for the sake of child care subsidies, has a similar system with similar standards. But review, assisted through a Secretary of State audit, found that there are some spots where our disqualifying crimes preventing a person from ever providing care do not exactly match those for DHS, doing regulated subsidy. And so in an effort to more closely align these two standards, we propose adding 6 crimes to the list of those that permanently disqualify a person from entry into Early Learning Division's Central Background Registry. And just to be clear, those crimes being asked to be elevated to permanent disqualification certainly are looked at today. It's not as if they aren't looked at, but they would become under this rule a permanently disqualifying crime. So that's the overview of the rules.
And that aligns us with DHS.
It gets us in far better alignment with DHS.
Any questions? If not, George?
Just what exact crimes?
Sure.
I do remember seeing one where it was like second degree kidnapping or something. I just thought like struck out.
So, the secondary degree kidnapping actually was found twice in the administrative rules. It's already a disqualifying crime, and then it showed up again in a different set where there's limited number of years. So the strike through you see takes it out of that portion of the rule that has a limited number of years. So it's just clarifying that is and remains to be a permanently disqualifying crime. So the 6 that are being added today via rule: sodomy 3, purchasing sex with a minor, sexual misconduct, incest, certain other sex crimes that are contained under one particular ORS, and sexual assault of an animal. Those are the 6 ORSs that are being added as permanently disqualifying.
Okay. Sounds like a good addition. How about a motion?
Katie's moving that one.
I'll do this. I move to adopt.
Thanks, George.
Oregon Administrative Rules, Chapter
Thanks,
414, Division 061, as proposed in the packet provided to the Early Learning Council dated January 16, 2020.
Thank you. Is there a second for that?
I'll second.
Thanks, Katie. Any further discussion? Those in favor say aye.
Aye.
Aye. Opposed? Motion carries. All right, Amy, you're up again.
Thank you so much, Chair Miller.
Thank you so much. That really helps.
Doing my part to get us back on time. So this has to do with the regulated subsidy program. So regulated subsidy rules are foundational health and safety requirements for license-exempt child care providers who accept federal child care subsidy payments through the state. So examples of regulated subsidy license-exempt providers would be caring for 3 or fewer children in the home, the sort of typical friend and neighbor care, certain school-based care, and certain preschool programs that only run for a couple of hours a day. So those are some examples. In 2019, the legislature adopted House Bill 2027, which provided new and clearer ELD authority to adopt health and safety rules for regulated subsidy providers. So today, all we propose is to readopt the existing health and safety rules for regulated subsidy under this new statutory authority, and that's all that is before you.
Discussion, motion.
To readopt the existing rules governing regulated subsidies in the Office of Child Care.
Is there a second for that?
Second.
Okay, any discussion?
Those in favor say aye.
Aye.
Aye. Opposed? Thank you, Angie. All right, motion carries. How about OPK? Gwen, welcome. Gwen Bacall. Thanks for joining us today.
Thank you. And it came to my attention that maybe the packet did not include the rule set for OPKs dated January 16th. I just wanted to double check.
It's in the packet that got
On-
emailed to us.
Okay. Does
I
anyone?
would love a hard copy. Thank you.
I'll take one too.
Okay.
Easier to read than my
Pass those
tiny
down.
text.
And good afternoon, Chair Miller and council members. I'm Gwen Backel, the Early Learning Programs Director. Maybe I should wait till those come around.
Sorry, there you go.
I'm not sure.
I think I printed it out yesterday.
Today I'll be sharing information with you pertaining to the rule revisions for both OPK and the Preschool Promise Program. But I'll be starting with the Oregon Pre-Kindergarten Program. And this program adheres to the federal Head Start standards, serving children and families whose income is at or below the poverty level. And Preschool Promise is our mixed delivery preschool program that serves children and families whose income level is at or below 200% of the federal poverty level. The mixed delivery model means that a variety of early learning providers and settings can offer the program, and this supports family choice and recognizes that high-quality programming can occur in many settings. The 2019 legislature passed legislation that affects both of these programs. The Student Success Act, Early Investment Account, expands the programming for both programs, and the House Bill 2025 requires the ELD to update the rules for both. Okay. So first on the agenda, OPK. These rules have not been revised since 1988. So due to this, many of the revisions were technical and ensure alignment with statutes. And the new legislation aligns the OPK program with the current federal Head Start standards by expanding services to pregnant families, infants, and toddlers, making this now a prenatal through kindergarten entry program, provides extended day option, and requires salary guidelines for both the lead and assistant teachers. These changes will benefit the parents, children, and early learning educators working in this program. So starting in October, the Early Learning Division staff members began a stakeholder engagement activity plan. These activities included in-person meetings with the members of the Oregon Head Start Association and current Oregon pre-kindergarten parents. We also provided a preview of the rule set to current grantees and solicited feedback through an online survey. And staff also held multiple focus group webinars on each of those topics, on the early Head Start modeling, program models, and also the salary guidelines and the extended day model. During the public comment period, we received 2 comments. As indicated on the public comments received document, there weren't many concerns about expanding services and increasing salaries, so that was great. The comment related to mandatory, the one comment that related to mandatory reporting requirements did signal modifications to the proposed rule set, and the ELD does not have any recommendations or does not recommend changes to the proposed rule set for the second comment related to the application review process. So the rules that you received in your packet or today, dated January 16, 2020, reflect all the changes that have been made since the filing with the Secretary of State and reflect the final input from public comment. And I recommend you adopt these rules or any comments,
Or comments about these rules for OPK, which definitely needs to be renamed now, but no longer is pre-K.
We have some suggestions, but I'll let that be introduced later by some others.
All right. If there are no questions, I'd love a motion to adopt these.
To adopt Oregon the standards, the rules for the thing that is to be renamed.
So I think that's this motion here. Oregon Administrative Rules, Chapter 414, Division 460, dated January 16, 2020. Thank you, Colleen. Is there a second for that motion?
Second.
Thanks, Peter. Any further discussion? If not, all those in favor, please say aye. 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 And I bet Angie's an aye.
Aye.
Thanks, Angie. Any opposed? Motion carries. All right, thank you. Let's go to
This is Eva. I just want to get a sign that I was one of the ayes that you may have heard.
Oh, great. Thanks, Eva. Nice to have you on the phone.
She did.
Thank you.
I'm here and I'm aye also.
Thanks, Angie. All right, it's unanimous. Woo. Okay. Then thanks, Eva and Angie. We appreciate you hanging in there with us. So let's go to preschool promise program rules, and let's see, we've got another handout on these hot off the press this morning that relates to the testimony that we heard from Autumn. So we know we're going to need some explanation on some parts of this rule.
Sure. And I think that for those who are not here in person, I believe that Remy has made this available to them as well.
Okay, and be sure, Gwen, if you will, to speak loudly,
Okay.
So people on the phone can also hear this. Gwen?
For everyone on the phone, I emailed this link out a little bit earlier during the meeting. So you can go to the top of your inbox and click on the link and see the document that we're looking at right now.
Great, thanks, Remy. Okay.
On to preschool promise. The new legislation for preschool promise required updates to the rules that are substantive and include expanding eligibility to include children in foster care, adding teacher assistant salary guidelines, and expanding the list of eligible providers. The changes that have received the most public comments are related to the shift in direct granting with the ELD with providers, subcontracting options, and educational requirements. ELD staff members have engaged in a variety of stakeholder activities. The activities include in-person meetings and remote webinar meetings with early learning hubs, child care resource and referral agencies, current and potential providers, AFSCME, COSA, Education Service District directors, and Head Start directors. We also provided a preview of the rule set to early learning partners and solicited feedback through an online survey. During the public comment period, we received many comments, as indicated on the public comments received document that has been distributed to you. And the ELB has been committed to being responsive. And as you can tell from the late changes as of this morning, last night, so right to the end, making sure that we had these in the best shape possible for you today. And so due to the volume of comments, I will not go through them individually, but I will note some of those trends. As indicated earlier, we received a lot of comments on the shift from contracting contracting with the early learning hubs to offering direct grants with providers. The educational level requirements, I know there was some public testimony today on that, and also our quality standards. And it's been a little bit, I think, confusing for the public in regard to our quality standards because two things are happening at parallel times, our rulemaking and also quality standards that'll be a part of our operation manual for the program itself. And so I think that we've been getting a lot of comments through the public comment period on the standards that'll sit in our operating guidelines and also some on the standards that are in the rule set. So we've had to kind of tease those out. And I just wanted to clarify the standards that we added into this rule set were actually in statute from previous legislation. And we just thought that it would be that many people go to the rules and not the statute. And so we thought moving those forward and putting them in the rule kind of makes it more clear where our standards that'll go in the operating guidelines come from. So it's actually from previous legislation.
And let's get specific because there have been so much input on this. When you're talking about standards in the rules that we're looking at and adopting today, is that the 0040, page 6 of our rules that you're referring to?
Yes. Yep, all the way through. Yes, that is pretty much just sort of a little bit of a cut and paste from the statute.
Okay, so 1 through 7. So these are the standards. And then, if I'm hearing you correctly.
Well, 1 through, I would say, through, it's on page 8M. And then we've added 6 and 7.
Got it. Okay. So 1 through 5M.
Mm-hmm.
And then there's a whole nother document that are guidelines.
That take these standards and put them into sort of a set of standards that have indicators and sort of a pathway to reaching quality that will be part of the operating guidelines for the program itself.
And then how do those guidelines relate to the RFAs that are going out soon?
Yeah, so everything. So in the RFA, we have listed out sort of kind of the standards, but in more in a draft form. I mean, they're not draft, but it's like these will be the requirements, and they really have to do with ratios, staff qualifications, as we finalize this, class size, and also requirements around use of curriculum, assessment, screenings, and doing family engagement. So really reflective of what's in the legislation.
So the guidelines will help guide applicants in what we're expecting of them. And they will be published when?
Well, they need to be published by June 30th, but we're hoping to have that done sooner. We'll need to go through an adoption process on the standards.
With us? Adoption?
No, I think it'll be an ELD.
Okay, but that doesn't align if applications are due in April. June doesn't work, right?
We're hoping to have that. The operating manual will include the standards, the operating guidelines that are more like the technical aspects of the program, and then also all the forms and resources necessary to implement the program. So we're hoping it's done. I mean, our goal would be to have it done, and I think I have the timelines for it, but that's the end deadline would be because the issue is that we won't have new providers under contract until July 1st because that's when the funds are available. So we really, for our start with providers, it needs to be available by the end of June. But for our preliminary work on getting all sorts of technical assistance up and running and prepared, it'll need to be, we're already working on all of that.
Okay. All right, lots to do.
Could I ask a different question?
Yeah, sure.
About the contracting.
Mm-hmm.
So where, help me understand where you ended up. Is the ELD going to be doing all of the contracting directly with the service providers? What happened with the early learning hubs and so on? Where did that land?
Right, so we will be contracting directly with all providers, but what we did offer, in the new rule language around subcontracting, is that an entity, a large entity, whether it's a K-12 and ESD, because the question came also from ESDs around, would we be able to have a contract or a grant with the division and then work with multiple K-12s in the implementation of the program model?
Yeah.
And so we now have that language for subcontracting. But if like an ESD were to apply to be a provider of the Preschool Promise program, they would actually have a direct grant with the ELD, and then they could subcontract out for other services.
I see, so it's sort of both and.
Mm-hmm.
So you'll have the direct contract, but the ESDs or the early learning hubs can apply for some amount of money that they would then recontract or subcontract.
Right, to subcontract out.
So you've got both in it.
Mm-hmm. Right.
Okay.
I also want to build on what Gwen said, and is that the subcontracting can work a variety of different ways. So amongst all of the eligible providers. So, for example, I think the model we're most familiar with right now and sort of what we currently have is funds going through the early learning hub and then there being a separate provider selection process and then subcontracts and the subcontracting relationship between the hub and the provider of preschool. The legislation and what the rules are now allowing for is for all eligible providers, a broader set of providers to apply directly to the state, including early learning hubs, and then subcontracting to happen amongst all of those providers. So it's not, as Gwen is pointing out, not just hubs or ESDs. So it could be, for example, that a particular, say a community-based organization that received a grant wanted to subcontract for transportation services with an entity or for nutrition assistance or something. So the subcontracting applies to all of our eligible providers for Preschool Promise. It looks like I made more.
No,
maybe more confusing.
but the example of subcontracting you gave was for something very administrative and operational as opposed to the design of the program or the actual delivery of the program.
Well, we would consider those part of meeting the program standards requirements.
Yeah.
It's the nutrition, meals. It could be training.
Okay, that helps. I want to just tell you what the things that I've heard, the issues that I've heard about, and you can tell me whether what you've done in response to.
With help from Gwen.
One of them was sort of the centralization of control in Salem is contrary to the spirit of trying to push out the responsiveness of programming to local communities and to local institutions, and to make sure that we're hearing from the community and being responsive there. And so the feeling that if it was all centralized in Salem, that was taking some of that responsiveness away. That was one concern I heard. Okay. And the second one was, how do you scale if you're responsible for sort of all of the contracts with 200 plus, whatever it is, communities? So did the solution address both of those things?
Good question. Yes, I'm going to feel confident about that one. Yeah. So I'd say, I think that the ability for an entity to work with other providers, or whether it's for the direct instruction, classroom services, or whether it's like Miriam says for like transportation or food services, I think that provides a lot of local flexibility on how they deliver and how they might have sort of like a group of providers that are sort of professional learning group that they're working together in support of the program model, and it can also provide maybe some infrastructure for some of the, our smaller or, providers that are, kind of coming into a state-funded program. So I think that it does allow for that. The one thing that it was very clear to us, though, is that we're not, it cannot be sort of just a pass-through, right? That that whoever is offered the grant for Preschool Promise, that they will need to be like who we interface with around like individual child level data reporting. And so it is sort of a direct line for us. And that actually solves some of the challenges that we have had, is sort of like getting all the data that we need, especially on child level data. And also that the parents would actually, whoever we have the grant with, that the parent actually has sort of it's an agreement with that provider. So the families might be placed in a particular setting or environment, but that whoever is that kind of larger entity would actually have responsibilities to the family in ensuring that the program is delivered appropriately. So, and we actually think that's a kind of a family that actually offers sort of a infrastructure for some family supports and engagement.
And that would be true across the entire state, in every single location.
It's an option. And then for the direct granting, we've been, like I said, meeting with a lot of different stakeholder groups, and we've learned a lot. And we meet monthly now with ASME, and it's been very, inspiring to hear a lot of our smaller in-home providers, really wanting to have a direct grant and a direct fiscal relationship with the state. And so, this will stretch us. And then there are some providers who say, we'd like the support of a fiscal agent, or there's some other options. So I think that we've tried to address through this option of subcontracting or direct granting, providing some ability to customize locally. I don't know if I actually, did I answer you? Sorry.
And do you have a follow-up?
So how many grants or contracts do you think that you're going to hold to deliver these services now?
I think that it'll be over 300.
You all know better than I know about whether that makes sense, so.
I think the ability to grant, not contract, will help us because we'll be able to hold the solicitation process in-house, and also we've been building capacity to do this. So,
can you speak to a little bit about why the grant? Because I had someone ask me recently, just community provider, why would you do grants? Why would the department choose grants over contracts? And I tried to explain that I thought it was better because less administrative components, and apparently there was sort of your reimbursal on contracts versus allocation of dollars outright on grants. But I'd love to hear sort of.
Yeah, and I might lean in on some of my ELD team members with this. But my understanding would be that if we were to do a contract, that we would need to go through ODE procurement. Okay. And so choosing a grant option allows us to hold those in-house, and then also, to your point, we're able to then look at, instead of like a reimbursement, look at some like advanced payment options to help some of our smaller providers who might not have the reserves to cover through reimbursement.
And so linked to that, thinking about sort of the home-based providers, do you think that reporting will be a little bit easier on this new proposed allocation?
Reporting on service delivery or fiscal or
reporting requirements.
Reporting requirements.
Do you think there'll be less or more? It occurs to me with reporting, I mean, there are already home-based providers use EDRC, and there's other things that they're doing, but they never have the administrative capacity that some of the larger center-based. Right. And so I just don't want, I'd like to see home-based providers have access to these dollars, and I'm just thinking through what are some of the deterrents.
Right. So there is an option for providers to ask for a fiscal agent to support them on some of the fiscal requirements and the reporting that's necessary there, helping them maybe with their profit loss statements, with payroll. So there's supports there, and also around developing business acumen, so that, and that would be an option for them to join at the beginning or any time during the program year, or to potentially leave in the program.
Do you give suggested fiscal agents, or are they supposed to find them?
So Great question. So fiscal agents, we have an RFA that'll be released hopefully today for a fiscal agent as well.
Okay.
So we are, yes. So we are seeking fiscal agents who are interested in providing this type of support, and then they'll go through the same type of an application process. It's competitive. And then we will be on the RFA for the preschool promise providers. There's an they're able to check a box that says, yes, I'd like to work with a fiscal agent. And so then we'll have to do a little bit of matchmaking though, once we get everything in, so.
I would also say too that subcontracting, the flexibility about subcontracting also will also allow for providers to subcontract for some of those sort of business services or administrative services if they want to do that, whether that's through a fiscal agent or some other kind of arrangement. I think Anne, you had talked about shared services, or Katie, you had talked about looking at that. I mean, I think some through the fiscal agent process or through just providers kind of self-determining their own needs, they have flexibility through subcontracting to be able to look at, get some of those services where they need support.
One of the questions I have on the subcontracting, the instructional services, the teaching element to it, is you obviously aren't going to just let a school district subcontract with somebody that you don't feel is a qualified preschool. Is that correct?
Right.
And I don't know if that's written in there. I mean, it's
Yeah.
not just says teaching, but you probably want a licensed or a pre-approved.
Through the grant process and in the RFA, it indicates that the ELD would have to approve of any subcontractor. Yeah. Yeah.
I
Yeah.
subcontract with anyone, I
Yeah.
guess. It might be easy, but I'm sure you don't want that.
This is Angie.
Yeah, Angie, go ahead.
Sorry about that. I didn't know how to kind of jump in.
Yeah, nope, that's good.
So I'm trying to I read the proposed rules when I was in the conference call a week or two ago. I understand what the proposed rules are. I just don't understand why the proposed rules are. I'm trying to grasp if it's not broke, don't fix it. And so I'm trying to figure out what are we trying to fix here? Or what about the old system didn't work that we're trying to fix? Because it seems very different from the method that has been used since its inception.
Good question. We'll let somebody take that one. Miriam, do you want to talk about that?
You can go, and I
sure.
can build on your comments.
Yeah, I would say first that there was nothing necessarily wrong, and in that our I call them sort of our our initial implementers of Preschool Promise, the 9 early learning hubs that have been working with us, have done an amazing job, and we've learned a lot from them. What we've learned though also is that there's there's a certain level of community implementation that is allowable, and then there's also a certain amount of consistency that the state needs to maintain, right? But I think it was recognizing that as we expand and thinking about a scalable model is that we work with in-home providers, small businesses, culturally specific organizations, and also some large agencies like K-12s, Head Start grantees, and that we already have direct grants with some of these providers. And so it was more like, how do we have the option, to do, to sort of look at both, like that we would be able to grant directly with some of those entities that we already hold direct contracts or grants with, and instead of having those entities maybe, working through an early learning hub, which, isn't, not to say that that was bad, it was just that it made sense to us that that we should have that ability to be able to grant directly. And then I think that the subcontracting language that was added kind of speaks to wanting to kind of have the ability to support certain models that maybe already exist, or new models that maybe we haven't thought of yet, that might be more appropriate in some of our more rural or more spread out.
Quite a bit.
Right, and that's what we wanted to, because when we looked at it, we're like, wait, our current providers and our current early learning hubs are doing a lot of subcontracting for services. And so we wanted to make sure that we weren't in any way sort of restricting any access to sort of what supports and services are already being resourced and connected to the quality programming. So, but if you wanted to.
Thank you, Gwen. That was great. I think the only things I would add, Angie, is one is we are in these rules and in that option implementing legislation that was passed this session to provide for the flexibility. So council members remembering that the legislation that passed this session expanded the list of eligible entities that could receive funds directly from the state through the Preschool Promise program, and now those will be grants, as been described. So we are both expanding that list to allow for that flexibility, I think as Gwen talked about, and then through subcontracting, still having an option for partnerships to happen between providers to be able to share services, whether those be services around teaching and learning or things that are related to other aspects of the program, screening and referrals or transportation or food services. So I think, Angie, both with the language you have before you, one, we're implementing our legislation as we are required to do so, as well as still allowing for flexibility. Then the last point I'll make is that it is, I think, in the course of a lot of questions, and I know feedback we've been receiving, it is not our intention to shift the technical assistance and supports and professional learning or referral systems that have been built up through the years that we've been doing Preschool Promise. Those are staying as regional and sort of community-based systems. What we're really talking about is the mechanism about how the funding is going from the state to communities, as well as then how that's monitoring and what kind of data collection. So it does allow for the state to, I think, provide some consistency around that across all hub regions. So hopefully that was helpful.
I appreciate that.
Yeah.
Thank you both for addressing that, and I appreciate the point you made about the expanded list of providers and the providers that you currently have grants with already, and that does make sense to do a bigger grant to those school districts and Head Start grantees that you're already granting with. I think the concern is just the sheer volume and needs of the smaller providers, primarily the in-home providers, the family child care providers that may not have the expertise. One, may not have the expertise, but two, just the sheer volume that this is going to put place on the Early Learning Council, our division, the ELT. And it sounds like I heard you say, Glenn, that you've been ramping up in anticipation for this. I just fear that those providers, if they don't get the support they need, that we're no longer going to be really offering parent choice the way that we've been able to do so far. And I think parent choice is a really important piece of Preschool Promise, that they have a lot of different types of providers to choose from. So I'm just concerned about losing those smaller in-home providers that maybe have, more culturally relevant or the right language or the right hours or the right location. And I don't want to lose that. But I appreciate, I thank you very much for just shedding some light on how we kind of got to where we are today.
And Angie, thank you for those comments. I think the other thing I will say is moving into sort of the next phase that is really important is of our work to implement this together and opportunities for the council is to really ensure that we are that there is that kind of outreach and that all provider types know and understand this opportunity. And so the division has been, ramping up to do that. And so that I think is one opportunity, and I think your collaboration support would be greatly appreciated. Is how do we get out the word about this opportunity? Number one, and then number two, as we look at the process to select providers, and that's something that I flagged before. We'll be talking about in March. Is how do we look across the applications as they come in, and also recognize that as selections are made, that we have in each of the regions and the communities across the state, we're looking at a range of providers to meet the needs or to be able to offer a variety of options of care providers through the Preschool Promise program, I think, as Angie's talking about. So just want to underscore again that we have an opportunity to do that as
selections are being made. Peter?
Well, I was going to say the hubs will still.
This is Eva. Can you hear me?
Oh,
Go ahead, Eva.
yeah. Go ahead, then Peter.
Hi, sorry, I've been trying to jump in, and then I figured out that I had to do the *6 thing again. I wanted to address the family child care provider thing. I have long asked for direct contracting or grants for Preschool Promise. One, because providers are already getting paid through the state many of them already getting paid to the state, whether it's like early head start or ERTC or, so for many in-home providers, it makes more sense to have that direct contract or that direct grant, because that money is already coming from they're already getting funds from the state. And I think that the early, like the hospitals largely have done really well with Medicaid. And I think that there were so many inconsistencies with how it was rolled out, and that it was confusing for providers to understand what they could really ask for and how to really build the program in a way that was useful to a family child care program. And the way that HUS also rolled out for centers, and they were paying for only one classroom instead of slots to build socioeconomic placement, a mix of socioeconomic placement, and to lift up more teachers, and instead it one teacher against all the other teachers economically, which was it's now against the pay equity law in the state, and it's morale. So I think that there were a number of issues, but that by bringing it back to the state, the ELT can look to address all the issues above. Work with providers to say, okay, your model might be slightly different than your neighbor's model or a person in another county, but for the most part, they're able to track and get to figure out where the money is going and how we're getting results from it, instead of having to do them.
Okay.
Thank you.
Thanks, Eva. Appreciate your comments.
So there was a little confusion with our hub when this first came down, but as they've worked through it, the hub still has a role in alignment of the efforts, the overall efforts, at the convening role. And by giving the subcontracting option, some of our smaller Spanish-speaking providers are talking to the ESD about the ESD becoming the subcontractor that then could still work with the smaller providers through our Child Care Resource Network, which has several bilingual employees that could add that kind of staff support. So it's given some flexibility to put together the programs, I think, in a good way.
Right. I think that's a great point. Yeah.
Great to hear. It's helpful. Thank you. Kelly?
I would ask if there's a timeline or schedule on the outreach side, because I'm concerned about providers knowing about this, and we have an early learning network that we recently held on Equity Fund, and because there wasn't any awareness of that, but I didn't talk about Preschool Promise, and some of them are eligible for Preschool Promise, and I just think that there's just not a lot of awareness for people on the ground sort of ensconced in the work that are not connected to any sort of larger organization, or the only thing that they really know is EDRC and some other sort of federal options. And so I really want to ensure, at least in the community that I'm in, that people have access to these dollars. And I'm happy to partner, but I need like a timeline and sort of I have no idea sort of what the schedule is. And I think having someone from the department come is better than me trying to talk about it. So knowing that you'll be in different communities, when they are, and then we can act as sort of hosts to try and bring you in.
We appreciate that, and we do have a pretty robust schedule.
Great.
And we've already met with the small business development centers and did a webinar with them last week, and just really preparing as many people as we can in the community for this to help providers fill out the applications and to be aware. But we are doing 7 different road shows where we've asked our local child care resource and referral agencies to help. And so there's a lot of different activities, but probably the best thing to do would be to share that plan with the group. And then if there's any opportunities that any of you see that you'd like to support, or that we haven't, that would bolster the plan, then our goal is to really make sure that everyone who would want to participate, has an opportunity, is aware and has an opportunity to be successful in their application.
Yeah, I think sharing that timeline would be great. And also, and I know we'll be talking about the Equity Fund in a minute, but letting council members know when staff is going to be in different communities answering questions and talking about these different funding opportunities. So in case council members want to sit in or be a part of it, or let other people know about those meetings,
that's another role we could play.
Perfect. Yeah, so I will let everyone know. Yeah, we have evening and weekend hotlines and English and Spanish and materials announcing the release of the application into the pipeline. So we're really trying to really make sure that we are able to reach the providers that are interested and who will serve best the priority population. So I did want to go back to something too, if it's okay, because I realize that sometimes I start something because I've been involved in the work. That back to the standards, and just because there was another shift in the legislation that with the original legislation on preschool promise, it required all providers to eventually obtain either a star rating of a 4 or 5 in our quality rating and improvement system, SPARK, and that has now changed to participation in SPARK. And so without having sort of the framework of the standards for the 4 and 5 star is sort of like that guiding light for providers, it was necessary for us to develop our own preschool promise standards because we really depended on the SPARK standards, the top 2-tier rating standards. So just want to let you know that was what sort of was the impetus for that. And so then we looked to the legislation, what are the standards in statute, and then how do we now develop, we don't want to use the statute language necessarily. It's not as friendly as the standards that we've been working on. We've been doing a lot of stakeholder engagement on the standards with providers, current and potential. So I hope that helped. Just a little history on why now.
Why now?
Yeah.
Oh, it's across the street, right? Okay, we need to go still deal with Autumn's testimony and this handout that we all have. And who's going to explain when I.
Yeah, let me find,
I don't understand this at all. So the motion that is hopefully going to be made soon is going to include this latest revised language that's in front of us. But just for this one section.
Yeah, that's the change.
That's the D.
Okay, so let's talk about that proposed change, why and what's its impact versus what we've seen before.
So the feedback was, there was from Autumn and others, actually we received from other providers as well, was I think we made the shift earlier that it was the original language that we put in kind of made it sound like the bachelor degree was what we were aiming for because we were saying professional development plans. And then, so it was really, it's the change from bachelor's degree or the AA or then other sufficient training experience that would qualify a teacher as highly qualified to be a preschool promise teacher that the early learning division determines. And so what we tried to come up with was some language that really took into account sort of where our workforce is at and in alignment with what is allowable within our Office of Child Care rules and regulations. So the step 8, the reason that was added was because that is sort of it's one option. It's on the step registry. That's the one option, like where a preschool promise. I mean, not a preschool, where a teacher in a preschool classroom can qualify to be supervise children and to be left alone with children. So we wanted to make sure that our rules did not have anything that sort of set us up to be in contradiction with the Office of Child Care licensing and regulations. So that is why it's now set at a step 8, and also the Child Development Associate's degree. That is also an entry point into being considered a teacher, a lead teacher for our licensing regulations as well. I'm not sure, Miriam, if you
Yeah, sure. So I'm going to build on that. I think to connect this with some of the testimony that we heard today, the legislation says for the teacher preschool promise requirements are a BA plus lots of other things, or an AA plus other language, or sufficient alternative credentialing to indicate that the teacher is highly trained. So that's that first sentence that you see there, right? So what this language is doing is, as Gwen noted, aligning to our licensing requirements, making clear that or option, you don't have to have a BA, or you don't have to, if you don't have a BA or if you don't have an AA, you can have a CDA preschool credential or be a step 8 on the Oregon registry. So that I think is one thing to clear up from what seems like there was some confusion. Nothing in this in these proposed rules, we're attempting to move, bring back, I think, a bachelor's degree requirement that wouldn't be consistent with legislation. I think there was some language we got feedback on that was confusing, where it said have a plan to get a BA. That seemed like it was that was happening, so that that language has been stricken from the rules. So, and then I just want to say a moment about the use of the word until sufficient alternative credentialing, and just say a few words about that. So what this allows you to do is, if you have a CDA or you're step 8, to be qualified as a teacher in the Preschool Promise program. But this, what we're also looking towards doing with this language is to actually do the work to meet what we believe is really the intention of statute and legislation, which is to develop an alternative credential that is and is equivalent. And we think that there's work to do there. I think some of the things that you heard in the testimony today about what the recognizing good training programs that are happening in our state, I think is an important one. Some about, I know we get feedback on the limited availability of professional learning opportunities and that exist in our state, but also to, advance in the Oregon registry in terms of steps, but also the fact that ORO, as it is currently designed, doesn't really recognize all of the professional learning that someone could participate in, including professional learning that could be meaningful sort of out of state. And, so I think that, or through participation in a network, or to be coached in a program, or to go through something like what a training program like was presented by Albina Head Start today, for example. So what I want to really emphasize that, because this is really language is just signaling to us that we have more work to do, I think, to build our system and to really look at alternative credentialing, which could be really, expanding ORO to recognize some of that other professional learning, or it could be, I think we heard Sarah present today some resources that we're proposing to look at teacher apprenticeship models and programs in our state, and building more of that capacity. So that's the meaning behind the until. I think the legislative intent, I think as we read it, was to really look at alternative credentialing equivalent to a bachelor's degree or an associate's degree, and also be more expansive about how we count the kind of participation in professional learning. We wanted to specifically call out the Educator Advancement Council as well, and note that we would be doing that in partnership with the Educator Advancement Council, because this is, and George can, I'm sure, expand more on this. This is also a conversation that is happening in the K-12 sector as well, as they think about alternative credentialing and other pathways to diversify the K-12 workforce. I think this is an opportunity where, we have many higher ed partners on the Educator Advancement Council. We have the Teacher Standards and Practices Commission, also representative on the council. It's not to say that these alternative credentials will look the same, obviously, but that this is very much an area that we know is a huge equity issue. It's an issue where the EAC will be doing work, and we think that it would be great to be able to kind of learn together and understand how they're looking at these issues, and we are as well. So just kind of putting out a bit of a North Star there for us to think about more work about alternative credentialing, as if we don't have enough work to do. So there's no time by when on here, you'll note. And certainly what this language is doing, I think, is sort of codifying where we are and what we do recognize right now as an option for meeting the requirements in Preschool Promise to be a lead teacher. So hopefully that helps.
Just the concept of paying lead teacher and paying for the assistant, and do we feel that we have as much adaptability, flexibility to work with all these other systems as well, if they, like for a school district and what they already pay? I know that we have that in there, but I don't know if it's flexible or adaptive enough, and is that what you believe right now? So if a school district does get funded.
Under
And
preschool prom, yeah.
they don't have a teacher that has a BA, and they instead use that as a classified. Is the early learning division going to say that's not okay? So my point is, do you have enough where you feel you're going to be working with them based on their CBA, based on their pay scale, based on Equity Pay Act, all these different things that you feel pretty okay about? Do we feel pretty okay, I guess?
Yeah, I'd say, I think that there's probably a lot of learning still. We've learned a lot from the K-12s that are involved already in Preschool Promise and some of the challenges that they've had and how they've had to figure that out and have some workarounds. I'd say, I think with this, the rule language is now, what it allows us to do is to really say highly qualified teachers become that from many different paths, right? And so, and that it's, that we want to recognize, that there are different ways in which we might qualify someone as highly qualified to lead preschool. And it's sort of that this then allows for education not to be like the primary maybe attribute, right? But that maybe does the provider, are they highly qualified and also maybe represent the children and families that they're serving their program. So it gives some, I think, some more options there. And then if, in referring to, like collective bargaining agreements, I think that's, we're going to have to, our goal is that that early learning professionals are paid well, right?
Yeah.
And so how do we work within the existing institutions and systems and maybe kind of push on that? That'd be my hope, but also recognizing that we want to have K-12s in as our partners, and this wouldn't be an eliminating factor.
Yeah.
And that there's a way for, them, for K-12s to document the challenges or why they're unable to meet a salary guideline that we might have.
Yeah. When I used to think, or I used to hear the language on trying to make sure that there's a pay that's proportionate to a kindergarten salary. And again, I think as long as there's flexibility and adaptability for folks, that'll be good, because it just won't be the same if we're having a head teacher at a preschool and kinder and they don't have the same degrees or and whatnot.
That's right.
It'll just be a mess.
Right, yeah.
And I want to make sure.
Yeah, no, there is that flexibility now, and that
Yeah.
has existed under Preschool Promise when K-12s have participated. And after, beyond the alternative credentialing, I think there's work to do to make sure that, as we've been talking with our K-12 partners, that, we maybe do some work to look at some of those barriers around, classifications existing, and that there, people, I guess, doing, the work that's required in a classroom, like for example, one example that's come up is teacher assistants, right? That that work in a preschool classroom is really a co-teacher or a second teacher, and not an assistant. That it's really a co-teaching model, and there's no kind of recognition of that in sort of the K-12. Sort of context. And so I think as we look at these classifications or all of the credentials and create that alignment, that's just another area of work. But the flexibility exists now within Preschool Promise. And correct me if I'm wrong, Gwen, but I think you worked a lot with our K-12 partners around those salary guidelines. And I think our K-12s have had to be very creative as well.
We've had some really great success stories, and some that continue to not be able to meet the sort of the minimum requirements just based on their collective bargaining agreement and how staff are classified. But so we can learn from those already and move forward.
Well, and let me just point out that at our March meeting, and we do need to talk about that before we adjourn today, Miriam said that we're going to be talking about salary guidelines. And in this rule that we are probably about to adopt, it says the Early Learning Councils shall establish a methodology to determine a target and minimum salary for teachers and teacher assistants. So it's going to be front and center for us. And obviously, there's a lot of work that has to be done between now and then. And certainly addressing your comments, George. So
no, we can fix them, but we can consider them in the context of,
well, and what a methodology is, I'm not clear about, but I'm sure I'll know it by March, right? Or some options. Give us some options. We love options, and then we can pick some.
With one more thing with regard to the language and the revised language in front of us is that the testimony that we heard today as well asked for us to indicate in the rule language that representatives of family child care would also be part of the work to develop an alternative credentialing. So when we get to that part, Chair, I would like, Miller, I would like to propose that we add after Educator Advancement Council and representatives of family child care to the rule language to be responsive to the testimony that we heard.
But does that not open the door? Aren't there going to be other
I was going to say, because then you can
groups that we
start
need
in
to?
others.
Yeah.
I was
mean,
thinking the same thing. How specific do we want to be?
Right.
Yeah.
Right. I mean, maybe there's more.
Well, we will
inclusive
certainly do the
language.
work to be as inclusive as possible. I think it's your decision whether you want that specific group called out in this language.
I would tend not to do that.
Is it possible to say Education Advancement Council and other partners or other providers? Something that indicates not just the Education Advancement Council, but doesn't specify all of the who's, or do you feel like it's going to be an issue with the
Other stakeholders.
with the union?
Say other stakeholders.
Yeah.
Yeah.
Sure.
Can I make I have a
what you
suggestion
want.
or a question suggestion.
Yeah.
I think you said something really well, which is just that a recognition that high quality takes different pathways. And I'm wondering if we can just include, I don't remember your exact sentence, I didn't write it down. But when you said it, I thought, yes, like that statement doesn't actually show up in this document. And I actually think it would be helpful for it to do so, even if it's just at the beginning under the minimum requirements of OAR 414, 470, like at that section, to just make that statement. Because I think that is a shift from what I think has been believed. And I guess I thought the way you said it, if you could repeat it that way, it was perfect.
We'll have to listen to the recording, right?
Yeah, it's taped.
I'd have to, I mean, I think it was just something to the effect of that we recognize that meeting, now you've got me on the spot.
Well, but it was
High quality standards.
It was that high quality,
that highly
different paths.
Highly trained.
And I just
Highly
think
trained,
the whole,
highly
the
trained.
And that
whole
language is
conversation
in
has-
here,
Mhm.
but maybe not
but
called
not so
out quite
clearly
much.
stated.
Yeah.
And I think, I mean, the conversation a few years ago was not that. It was like highly qualified is only if you have this.
To a certain degree.
And I just think, I'm
There are
glad we've
multiple
evolved. I
pathways
love the
to
way this looks
obtain-
now, and I think it
Oh,
would be
good,
good to
thank
state
you.
that value. You wrote it down?
No.
But we're going to figure it out.
We're gonna figure it out.
I think we have a couple of, my name's Katie Thiel, I'm the Senior Policy Analyst at the Department for Early Learning Division. So I think we have a couple of options here. We can either step aside, come up with a couple of words and bring them back to you before the end of the meeting.
I mean, I
within the
trust
next
that,
10 minutes.
I trust that you can do it, yes.
I think for
I don't
for
know
the
that I
action
need
for
to
the
wordsmith.
rule, I think we need to actually, in this case, other than,
Oh.
we need some final action on the specific language that we're going to adopt.
They'll have to come back in
So I
10
think-
minutes.
Right, I think we could accomplish that in just a few minutes.
Yeah, while you're doing the other
While
part.
I'm doing the other
Yeah,
presentation,
we
if
could do
that's
that.
okay.
Because,
Sure.
because then it would be evident to other people who aren't here for this conversation that that's what we're intending.
And we can just help modify the motion language so that we capture it correctly in the record.
Right, yeah, we've got this other modification going, so, yeah, we'll just,
Okay.
okay,
Tim.
get the list.
I know.
That's no pressure.
That's- We're used to this right now.
I'm sure you are, Quinn.
All right, well then, sounds like I'll excuse myself.
Yeah, we'll just put this
Can you hear
on.
me? Did I-
Hold. Yeah, we can hear you, Eva.
Okay, yeah, I was gonna jump in and say, I think it's best, yeah, expect to be able to upset the union. I think the point is that, we want people who have been going through the various types of training that know the work and know what's achievable and attainable and accessible to them, whether it's Albina and Start's in-house program or, licensed family child care providers who depend on ORO, and even vendors who depend on ORO. That we have perspective from multiple sources of what actually works for them be able to access professional development.
Right, yeah, I think we could add perhaps other affected stakeholders to the motion, and I think we'll be.
Yeah, that sounds great.
This one, yeah. Okay, so.
Thank you.
Yes, thank you, Eva.
Can we come back to this
Yes.
motion?
Okay, well, and Khalid, I just want to make sure, where you saying?
Here, I can step aside. I don't want to delay things. Sorry.
No, I was just, I think we can figure out where to insert that.
Why don't you two go
I think
figure
it's
it
at the top,
out,
though.
because Katie has
At the
to
top,
jump
right.
into the next conversation.
You want some
Unless you can do two at once, Katie. You probably could, but we won't ask you to do that. Okay, we will come back to preschool promise, and right now we're going to jump to the equity fund rules. And Katie Thiel is going, and Nikisha are going to walk us through this. And I just want to say once again, and Kelly knows this because she was on the Equity Rules Advisory Committee along with myself, that Katie and Nikisha just did a fabulous job of walking the RAC through this process and coming up with a document that I think represents all the input we received and is going to set this fund up so we are ready to really see some exciting grants go out the door. So thanks for your work, both of you.
Thank you.
So we'll turn
Chair
it over
Miller and
to
members
you.
of the council, my name is Katie Thiel, Senior Policy Analyst of the Early Learning Division. So as was mentioned earlier, the Equity Fund Early Learning Program is a new program set up by the 2019 legislature through the Student Success Act. We were fortunate enough to work with a group of stakeholders from all parts of the state, a diverse group that helped us really develop these rules. The process that they went through was very aggressive. Within a week's time, and I was fortunate enough to work with Chair Miller and Councilmember Thornlatt on the rules. With two-hour meetings, the Rules Advisory Committee really came up with a solid set of rules. Because of the timelines we were under, we filed them with the Secretary of State's office after that second RAC meeting. They continued to refine their work in the third meeting and have since met just one more time last Friday to take in any of the public comment we received and review the staff recommendations on technical changes. So the body of work that this stakeholder group undertook was amazing in a very short amount of time. And I feel like they left the process feeling like their voices were heard and that we came up with a set of rules that they could take away and feel like we can implement this program. So I'll just walk through a couple of items. So the legislature set up this program. The Rules Advisory Committee spent a fair amount of time really trying to figure out how to focus the funds toward culturally specific organizations within the boundaries that the statute gave us. So we had to navigate some waters to try to get to that point. They were able to add in, so the statute requires that the providers meet 2 or more factors of systemic disparity, including race, ethnicity, English language proficiency, socioeconomic status, and geographic location. The Rules Advisory Committee added an eligibility criteria, which was allowed by statute, to require that their programs demonstrate that people in leadership positions belong to the cultural community served. And so that was a significant shift in the conversation with the RAC. We were really struggling with how to really get to those culturally specific organizations, and I think that was the linkage that helped us get there. Consistent with the definition of culturally specific course. Exactly.
And that's on page 4 of the rules, if anyone's trying to track this.
That's number 5 under eligibility criteria, bottom of page 4.
Thank you. The other thing that came out in the Rules Advisory Committee was that the members were really wanting some assurance that the grant funding would continue. If the program was building up or starting this new effort, that there was an expectation that funds would continue. So we built into the rule structure an allowance that, depending on funding availability and program performance, that the grant could be renewed for 2 additional biennial cycles, giving the grantee up to 6 years. This first set of grants will be no more than 5 years, because by the time we get the first grant out the door, there's really a year left in the biennium and then 2 additional bienniums. So that was one critical change as well.
And it was interesting in that conversation, Kelly, you can weigh in here. They were making the point that many of these organizations may be small, obviously dispersed around the state, and the idea of starting up a program or even expanding a program only knowing you can do it for 1 year is just such a disincentive to invest in it.
Yeah.
And so, Peter, I'd be kind of interested in your thoughts about this, having been in the legislature.
I'm a little perplexed on how it's going to work, unless you hold back funding of the original 10 million to ensure that you can fund for 6 years. The legislature still is going to have to make an appropriation in the next budget. So that's just.
So we did make the renewal dependent on funding availability. So
Is the funding not reliable?
What's that?
The funding isn't reliable in terms of ongoing funding. I think there was a perception that there would be ongoing funding. The amount may waiver, but that there would be funds.
Right. I think it just is dependent on the revenue that comes in from the tax created. But the funding, there is 10 million that's intended to be set aside for this program per year.
As long as you have that proviso in it, then you're fine.
Yeah. Okay.
But it's good to set the expectation.
It is. Another issue that occurred at the last meeting of the RAC was, or another issue they paid attention to was the makeup of the grant review committee. So they had some specific recommendations around that have been incorporated into the rules, really wanting the bulk of the membership of the review committee to be made up of those who have experienced these systemic disparities, and really honing in on wanting that to be 3 or more disparities. So we agreed upon language that would require at least 2/3 of committee members to be made up of those that have experienced those factors. One other issue that I missed, that just taking you back to a step to the scoring criteria in the rules, the RAC also was interested in giving a preference. They actually wanted to put in a requirement for 3 or more factors of disparity. We ended up going with a scoring preference for that. Got some advice from our council that helped us kind of hone in on that language. So I think that will get to those organizations also. We have a lot of safety guards built into the language. There was also a significant amount of outreach that occurred in addition to the Rules Advisory Committee. Nikisha could speak to the webinar. There were webinars held. We did have a public hearing on the rules. Although we had a couple of folks listen in, there was no testimony delivered. We had about 6 or 7 written comments submitted on the rules, so really a small number. In addition to the stakeholder work we did, I know a number of our RAC members were working to get the word out and seek input on the rules, which was an additional help to us. So the rules that you have in front of you today, dated January 27th, reflect all of the changes to date, including the review of the RAC from last Friday. And I recommend your approval of those rules.
All right, thank you. Katie,
I
question?
just have one comment. In a previous life, I did a lot of public outreach processes, and I love all these rules around equity. What's most, equally, I guess, one gets the other, important is how you find those voices to do the grant selection, and that they're not always the same voices. And I think that warrants a lot of care and attention as you go forward. And that's what's not happening. That is the work, I think, behind the scenes that will actually make this robust. So I don't know, I just wanted to make that point. I don't know if that's language that's in there, but just acknowledging how much goes into the background of actually doing this well.
Right. And Let me ask Nakisha, will you give us the outline of the outreach that you are going to be doing
Absolutely.
starting at 3:30 today?
That is really ambitious, but yes. Thank you. So we have a number of outreach and technical assistance opportunities that are going to be available to applicants. So as Chair Miller said, the application, the request for application is due to be released today, this afternoon. Maybe 3:30, maybe soon after.
Assuming we're on time.
Yes, so, and it will close on April 2nd. So as you can imagine, it's going to be a lot of work trying to get out there to get information out to the field and provide the kind of technical assistance that will help applicants, with their grants, their grant applications. So we have a couple of webinars that are coming up as early as next week, actually one in English, one in Spanish, that's going to really provide an overview of the application itself. And we also have a third webinar scheduled later on in the month to walk through the grant application platform. And this is the way that they're going to actually submit their applications through this platform. In addition to that, we have a series of after-hour helpline hours available, Wednesday evenings and Saturday mornings throughout the months of February and March. So we'll be available on hand. We will be able to take questions in English and Spanish. The RFA is being released in English and Spanish, and the grant application portal will be available in English and Spanish as well. So we will be able to answer, and we have a language line that will help for those of us who are monolingual. And so in addition to that, we have a series of regional community sessions that are scheduled actually across the state. And again, another opportunity for the team to go out to meet with prospective applicants, answer any questions, walk through the application, just kind of see where folks are at and what the needs are. We have 5 of those scheduled, and I think a few of them are still being scheduled right now. But we have 5 opportunities across the state. And then the other thing, I think Gwen alluded to it earlier, was around the small business development centers. So we've met with them and are going to be really advertising them as a local place where applicants can go for some grant support. And so that's going to be another way for applicants to receive some assistance. So.
Did you mention the early learning hubs as a potential, say, vehicle to help inform their communities or their Head Starts or their preschools about how to go about this as well?
And actually, we are actually reaching out to all of our partners, including hubs will be a part of that as well, for assistance with this. I mean, the way that we're going to effectively reach those who we haven't traditionally engaged and reached is to do things a little bit differently. And so, Kelly, I really appreciated your comments earlier about how we're going to go out and reach. We're really going to rely on our partners to help us with that, because it is really important that, again, we're not just reaching those who we're already in an arrangement with. We really want to reach those that haven't traditionally engaged.
Yeah, and I would just, once again, and I know I've said this in other contexts in today's meeting, but look at the council members sitting here as part of those partners that should be integrated in your outreach program. So as these dates get set, and I think one's somewhere in Central Oregon, I don't know if that's Bend, but let Katie know when that's going to happen. Partly if she could show up if she wants to, but she could also help feed other people into it, and that will be true for all of us.
Okay.
So just look at us as part of that network, if you would.
Really appreciate that. Yes.
And we'll let George cover all of Eastern Oregon. No problem. Thanks, George.
Just to clarify, in some of the public comment, I know that people from Ocean, the Oregon Center for Children with Special Health Care Needs, kind of argued that that group, the children with special health care needs, was an area that had some disparity. The children and families of children with special health care needs had some disparity. And it looks like from the comments it says that there was no changes to the rules, but organizations and programs that support people with disabilities could apply for these funds as long as they met the eligibility criterion. Is that correct?
Yeah.
Yeah, okay.
Yeah, and I can add to that just a little bit. I think that, I don't think the mic's working. The statute was specific to this being to culturally specific early learning, and so I think while the council could choose to add an eligibility criterion rules for this group that has experienced disparities, they would still have to meet that culturally specific criteria in order to receive the funding.
So I guess my point was they're not excluded from this because they're not named, as long as they met the eligibility criterion.
Correct.
Thank you.
Okay, any other questions about the equity fund rules? If not, I would love to entertain a motion to adopt them as distributed, wherever this draft
I
motion
have that.
is.
Madam Chair.
Yes.
I move that we accept the draft of the Early Childhood Equity Fund Administrative Rules. We adopt Oregon Administrative Rules, Chapter 414, Division 575, as proposed in the packet provided to the Early Learning Council on today. I had 15 on here.
That's right.
Oh,
Good.
January 29, right?
Right.
30th, 2020.
All right. Kelly seconds it. Okay, any further discussion? Those in favor say aye.
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 Is there one more aye on the phone? Maybe. Usually.
May I just clarify?
This is the only I did.
Okay, thanks.
Yeah, I was just working on getting myself unmuted.
Okay, thank you. Yes.
May I just clarify that it was the January 27 version of the rules that you just took action on?
Yes.
Okay, thank you.
That's
For the record.
the most current ones.
Thank you.
Thank you. And Katie and Keisha, thank you again for the great staff work on these. Really very exciting. All right, shall we back up? We can't go anywhere without doing preschool promise. So here is some suggested language that on page 6 under 0040, we would add the sentence, there are multiple pathways to become a highly trained teacher. To be eligible to provide preschool services under the preschool promise program. That's trying to incorporate sort of what Kelly was suggesting earlier. So, yes, so that's one. Does that sound good to council members? To try to, yeah, be more inclusive? Okay. Thank you, Kelly, for that suggestion. And then the other suggested language change on this handout that we just received a few hours ago or minutes ago is after Educator Advancement Council to say and affected stakeholders. So once again, inclusive, broadening it. Okay, thumbs up, I'm seeing. So if those are acceptable to people, then the motion that I am looking for is, I move to adopt OAR's Chapter 414, Division 470, as revised and dated January 30th, 2020, and hand engrossed on January 30th, because this is the hand engrossed part, these other two amendments.
So moved.
Thank you, Peter. Is there a second, and then we'll discuss it? Thank you, Peg. And
I have one minor wordsmithing suggestion, which is that rather than saying there are many pathways to becoming a highly trained teacher, to say a highly qualified teacher.
Because that's consistent.
It sounds more limiting than qualified, and I think qualified was what I thought was the spirit of what we said.
I agree, and I think that that was used to mirror the language in statute, so that would be
the trained was.
That become a highly trained,
Yeah.
that's why we've used that, that's the terminology in statute.
I'd like to amend my motion to have it say qualified instead of trained.
Thank you. Does the second agree? Peg agrees.
I agree.
Okay. So So we have just, we're okay, Betsy?
All right. Gotcha.
Okay, we got it, so whatever this means. That's right. Hand engrossed, any other hand engrossed things you want? Now's the time. All right, if there is no other discussion, those in favor of adopting this amendment, say aye.
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 Angie may be on it.
Aye.
Okay, thanks, Angie. All right, it's unanimous. Nice.
Did you get mine on the phone too?
We did, Eva. We've got the whole council weighing in on this.
Unanimous.
Thank you. It's unanimous.
Yay, I appreciate all the work at the last minute scrambling from the staff. Well done.
Yes, this staff is used to last minute scribbling. I've learned that, even at midnight. Okay, so, wow, council, we went through a lot of material today.
Thank you, Gwen.
Yeah, but thanks, Gwen, and whomever else is leading. So let's talk about March, if we could. I know in the calendar Remy sent out 2 months ago, there was sort of a virtual hold on a virtual meeting in March. Are we sticking with that date? I heard you.
I think, Remy, did we want to look at a doodle poll, or? Yes, did that go out yet? Okay.
You haven't gotten the time to discuss this.
Okay. Okay, so we have a hold, we do plan on having a meeting using that hold. I think there was some consideration of if we wanted to send out a doodle poll as well, to identify if we could meet earlier, or if to just confirm that date still worked for all council members.
What is the whole date?
It was that was sort of what our concern was, is that it was listed in the
March 19th.
schedule of annual meetings of March 19th, but there wasn't a hold sent out in your calendars for that specific date.
There's currently a hold on all of your calendars for 9 to 11 a.m. on March 19th.
But that went out.
Yeah, that is.
That's spring break.
That's the week before spring break.
The Friday before, right?
No, Thursday. Yeah. Thursday before.
I feel like I'm leaving.
I just want to remind everybody that I'm not available that day. I am going to be out of the country.
Yeah, I think I'm flying out of town for spring break.
You have it now. Okay.
And
So
it's
it sounded like
virtual
we.
meeting too, though, is what it
It's a
says.
virtual, yes. That is staying the same, and it's a shorter meeting, and it's not a day-long meeting. Sounds like, though, we should send out a doodle poll and try to find another date that works. Okay.
Okay, better go out right away.
Yep.
March isn't that far away. All right, anything else to come before the council? Well, nice work, you guys. Thank you for coming so well prepared. Staff, thank you for having an amazing agenda put together with all the midnight hours that went into it. And council, good work. So we are adjourned.
Yay.
Okay.
Minutes.
Well done.